This is CNN Breaking News.
I'm Wolf Blitzer in Washington. We want to welcome our viewers here in the United States and around the world. This is CNN's special coverage of the coronavirus pandemic. We're also standing by for the first votes on round 2 of Super Tuesday. This hour, the coronavirus crisis, though, is worsening here on the East Coast of the United States, with the first death now reported in New Jersey. And New York State officials are also taking very dramatic action to contain an outbreak of the virus in New Rochelle, that's just outside New York City, including sending in the National Guard. We'll talk to the New York Governor, Andrew Cuomo, in just a moment. Jake Tapper, though, is also with us. Jake, this pandemic is hitting the United States harder by the day.
That's right, Wolf. And we're tracking the spread of the novel coronavirus, or COVID-19, hour by hour as we work to help Americans understand the facts about this outbreak, the scope and the risks. At this moment, at least 849 cases have been confirmed in 36 states and the District of Columbia. At least 27 people have died in the United States, most of them in Washington state. As the illness spreads, life in this nation is changing in multiple ways. More universities across the country include American University, Harvard, Ohio State now are canceling classes and moving to online instruction. Several airlines have announced deep cuts in international and domestic flights as people are being discouraged from traveling. We have correspondents covering all the angles of this story. First, let's start with Erica Hill in New York. Erica.
Jake, good afternoon. As you mentioned, these numbers jumping. It seems almost as quickly as we report them, the numbers change as more states report back. We are now at 27 deaths, as you mentioned. One man in New Jersey is the first death in that state, a 69-year-old man who didn't have a history of travel, but did have underlying conditions, we're told, including emphysema. Meantime, just north of New York City, in a big suburb of this city, New Rochelle, the National Guard is now being brought in to help distribute food and medicine to that community under new orders from the governor. Just north of New York City, Governor Andrew Cuomo announcing new containment measures today.
It is a dramatic action, but it is the largest cluster in the country, and this is literally a matter of life and death.
A 1-mile containment radius in New Rochelle around the center of that outbreak. Schools and houses of worship closed through March 25th. At a Seattle area nursing home where 19 deaths have been linked to the coronavirus, more than half of the residents have now tested positive. And in Oakland, California, disembarkation and medical testing underway for hundreds of passengers from the Grand Princess, many of whom will go into quarantine for the next 2 weeks. On board the massive ship, confusion and frustration.
We have not been receiving timely nor accurate information from the government agencies who have developed and are managing the disembarkation plan, making it virtually impossible for me to prepare you and guide you on their processes.
Yesterday they had us doing this walk around on the deck where we had to maintain 6 feet of distance from everyone, and they kept telling us, 6 feet. And then last night, to exit the boat, they have us standing, next to each other.
As the number of confirmed cases rises, some communities working to limit interaction. In San Jose, slapshots silenced. Santa Clara County, home to the NHL Sharks, banning gatherings of more than 1,000 people. Across the U.S., some schools and colleges moving classes online, canceling events, or simply closing. When pressed, Health and Human Services Secretary Alex Azar offering this guidance.
I would encourage any individual who is elderly or is medically fragile to think long and hard about going into any large gathering that would involve close quarters and potential spread.
As for who can be tested and where, confusion remains. Vice President Pence said 4 million tests will be distributed by the end of the week. The CDC only has records for 4,800 run in public labs.
We don't know exactly how many because hundreds of thousands of our tests have gone out to private labs and hospitals that currently do not report into CDC.
And there have been questions about testing from the beginning. One quick update. The man who is at the center of that cluster in New Rochelle, his wife, in a posting on Facebook, noting a short time ago he went to the doctor several times. They couldn't figure out what it was. And even once he got to the hospital, she said it took them days to determine that he, in fact, had the coronavirus.
All right, Erica Hill in New York, New York. Let's go now to New Rochelle, New York, where we find Bryn Gingras. And Bryn, the National Guard is being deployed to New Rochelle. How are citizens there reacting?
Yeah, they're taking preparations now, Jake. The National Guard going to be here in 2 days' time, and we've talked to some people here on the street who tell us they've already gone to the grocery store, stocking up on supplies, making sure they have everything at home. Now, to be clear, the governor said that people will not be restricted to their homes only if they've already been given the order to self-quarantine. However, of course, people know that the line for that 1 mile radius isn't exactly a thick line. It could expand even further than that, so they are taking every precaution possible. Now, we know that there are several schools who will shut down, which will shut down in the next 2 weeks. The school district sending a notice out to parents saying that the kids cannot get behind during this 2 weeks time, offering to hand out computers to families who may not have access to one at their homes. So certainly this is the time right now that the people in this town, no matter where you are, inside the zone, outside the zone, they're starting to prepare.
All right, Bryn in New Rochelle, thank you so much. Let's go down to the New York Stock Exchange where we find Allison Kosik. And Allison, it's been a bloodletting the last few weeks, but I guess the stocks rebounded a bit today?
Big time. They rebounded today, Jake. Plenty of wild action here at the New York Stock Exchange as we watched the Dow swing between gains and losses all day today, only to end in the green, deep in the green, up more than 1,000 points, cutting in half that massive loss yesterday of more than 2,000 points on the Dow. Traders I'm talking to tell me get used to this volatility, get used to investors being on edge as long as the number of coronavirus cases continues to accelerate. Today's mood, though, was much more upbeat. We saw oil jump 11%. Also, the president's plan that he floated for a possible payroll tax cut, that put investors in a good mood. At this point, they're concerned about a possible recession, so any support is welcomed. Jake?
All right, Allison, thank you so much. Joining me now to discuss the governor of New York State, Andrew Cuomo. Governor, thanks so much for joining us. You've asked for a 1 mile radius containment area around New Rochelle, which essentially means schools, synagogues, churches, other large gatherings are canceled for 2 weeks. You've also activated the National Guard to help clean schools and other facilities and to deliver food. What else can you tell us about this containment plan?
Thanks for having me, Jake. Think of it this way. We have 173 cases in the entire state, right? We have 108 in New Rochelle. New Rochelle has about 3 times the number of cases New York City does. New York City is 100 times the size of New Rochelle. So it's unique in the nation in that it is a very dense cluster of positive cases, and it's been going up exponentially. What we're doing is we're bringing all resources to bear on that cluster. The quote-unquote containment zone really just says, in that immediate vicinity, no large gatherings, which people are doing all across the country, and it makes sense. If you have that high degree of a number of positive people, you don't want them going into large gatherings. So we're going to close the schools for a period of time, no large gatherings. Meanwhile, clean the schools, clean the public transit system, and bring in a satellite testing system where people in that community can get tested.
Governor, you noted that the cluster is in New Rochelle and not in New York City. Why? What's going on in New Rochelle that this is where it happened?
It just so happened that it started with 1 or 2 cases. There were then a number of convenings in that community that brought several hundred people together for celebrations. And it took off like fire through dry grass in those convenings. And that's why we have this very dense cluster of positives right in that area. And that's why no large gatherings, and let's go in and do what we have to do. But, you know, Jake, this is a microcosm of what we're going to be looking at. The numbers are going to go up consistently because our testing is way behind the reality of what the situation is. I have no doubt that the reality is a multiple of everything we're seeing in the numbers. And as we test more, that's what you're going to see. You're going to see those numbers skyrocket. The only way this has ever been contained, what China did, what Korea did, you only have 2 options: quarantine or really increase the number of tests and get the positive test and then isolate. China was doing 5,000 tests 10,000 tests per day. This country, in total, we've done about 5,000 tests. So we really have to get that testing capacity up if we're going to make a difference.
I want to ask you about a different cluster, the first cluster that we know of outside Seattle. A source tells me, a first responder tells me that 7 firefighters in Kirkland who reported, obviously, to the Life Care Center there, 7 of them were swabbed for testing, but there was such a bottleneck at the testing center that the tests expired. Those 7 firefighters now have to be retested. They have to remain in quarantine. Are your first responders getting not only the testing they need, but the testing, is it being followed through?
Yeah, it's a good question. And you hear different people saying different things because it's apples and oranges. When they talk about the number of test kits they sent out, that's just the swab that you take, and then you send that swab to the lab. And sending it to the lab can be a logistical problem, and then the lab turnaround time, if they have a backlog, can be a day, 2 days, 3 days. Some of these new labs they're bringing on nationwide, they tell you, I can't get you the results for 3 days. So it's a long step between the swab and the test, the swabbing, and then the actual running of the test in a laboratory. We have been dealing with that from day one, right? CDC first was doing all the tests themselves. They were sending them to Atlanta. Then we made a fuss. Then they allowed state labs to do the tests. And then we've been advocating to allow private labs to come in and do tests to increase our capacity. In New York yesterday, they finally authorized the private labs to do automated testing. That will increase our capacity. But this is a very cumbersome process. And again, according to the HHS secretary, about 5,000 tests after all this time. Korea, China, we're doing 5,000, 10,000 per day, and then tracking all those tests. That's how they stopped it there. We're not going to stop it here at this rate of testing.
Governor, can I impose upon you? Could you stick with us? I want to continue this interview, but we need to squeeze in a break. Is that okay with you?
Sure.
All right, we're going to be right back with more with Governor Cuomo of New York talking about the coronavirus pandemic. Stick with us. We'll be right back. Welcome back to CNN special coverage of the coronavirus epidemic, as well as Super Tuesday 2, which we will get to later in the broadcast. I want to bring back Governor Andrew Cuomo of the Empire State, who's answering our questions about how New York is dealing with this. Governor, thanks so much for sticking around. You talked about how you have this zone around New Rochelle now, and the National Guard is being activated to go there and help clean schools and deliver food, clean public transportation. People are being discouraged from holding any sort of group event in New Rochelle. New Rochelle is just 20 miles north of New York City. You've noted that because of the inadequate supply of testing kits that are out there, we really don't know how widespread this epidemic is. Should people in areas surrounding New Rochelle start to consider not holding group events, self-quarantining if they need to?
Yeah, well, it's a good question, Jake. And we're mapping where we get the positive cases. And as we see them start to spread or pop up in a community, we identify that community and we talk to them and we make those kinds of decisions. But remember, it's not testing kits. And this is why the federal government will say we have plenty of testing kits. They have plenty of testing kits. That's the swab. They don't have the capacity to scale to do the actual tests. And that's the issue, right? And the way this stops, and again, only 2 ways. You quarantine the area, that's China, that's Italy, or you do enough tests, a high enough volume of tests where you can run down most positives. At that in China and Korea were about 5,000 to 10,000 tests per day, Jake. Mm-hmm. The HHS secretary said we've only done 5,000 since this started. That's our issue.
Right, so that's my point.
If you're not testing more people.
Yeah, that's my point. If we don't have the testing going on right now, should the government and should local communities be taking more aggressive measures because we don't know how widespread it is?
Yes, but the question is, what do you do? First of all, it is much more widespread than we know with these tests because it's been out there for a long time and our tests are nowhere near random sample or scale. So yes, it's out there. But what do you do? Unless you want to go to quarantine where you have a density of cases, what do you do besides find ways to increase the testing capacity? What would this country tolerate? You know, you're not going to do what you did in China. I think it's about increasing testing capacity, and that's why I keep pushing the federal government, and I annoy the president, who will now probably send me another nasty tweet after this broadcast. But I think they have to increase the number of tests. Also, the deep breath point is, this is not going to end the world. You know, this is not the Ebola virus, which I went through. That was frightening. If you're a vulnerable member of the vulnerable population, you're a senior citizen, you're immune compromised, then it's dangerous. But that's really what this is about, right? And let's keep it all in focus, because the anxiety and the fear are not connected to the facts and the reality of this situation. And we have a virus to fight. More, we have the fear and the panic to fight.
Right. No, I agree with that. Let me ask you, the containment area approach that you're applying to New Rochelle outside New York City, that was recommended by New York's Health Commissioner Howard Zucker. Is the CDC, the Centers for Disease Control, are they on board with this plan?
Yeah, we've spoken to CDC, the FDA, the whole alphabet soup of healthcare agencies. And yes, this is in line with everyone's guidance. And it's also common sense, by the way. You have one of the densest clusters in the United States. This is almost unique in the nation, Jake. So what do? No gatherings, get testing for as many people as you can, get logistical support. It's making it happen. It's not the concept. The concept is inarguable. What our government nationwide is dealing with is the actual capacity and the ability to do what it needs to do, right, to respond, to mobilize. That's our challenge.
So one of the things that is so shocking to me is that the Life Care Center, which is that nursing home outside Seattle in Kirkland, Washington, where 19 people have died already there. The idea that there are 180 employees, 65 of them have symptoms, none of them, not one of them, has been tested. Forget whether or not the test goes to the proper lab. Not one of them is tested. It just staggers the mind, and this is not your purview. This is in Kirkland, Washington, not New Rochelle, New York. But I guess the question is, are you prepared? And what are you telling people at nursing homes in New York, where the people are the most vulnerable, perhaps, because many of them have health issues? All of them are senior citizens, and obviously they're in tight quarters, many of them.
Jake, that's my nightmare. And that's where you are going to see the pain and the damage from this virus. Senior citizen homes, nursing homes, congregate senior facilities, that is my nightmare. We've taken steps, some drastic steps. In this area in New Rochelle, we're talking about, we said no visitors in a nursing home. All you need is 9-year-old Johnny to visit his grandmother in a nursing home, give her a kiss, and you can be off to the races. That's my fear. That population in those congregate facilities, that is really what we have to watch. But look, on the testing, you're right. We're still not where we need to be on the testing. And I do not understand why. I don't want to cast stones. I don't want to get in a fight with the federal government. We have to work together. But look, we saw China happening in November, December. We knew someone was going to get on an airplane and come to this country. How does China and Korea have a better, faster testing mechanism than we do? And the only explanation you get is, well, their tests aren't as good as our tests. Our tests have a higher degree of accuracy. Yeah, but their tests are 5,000, 10,000 per day, and that's what you need to keep the scale to stay ahead of this beast. And if you don't have that scale, then you're going to be playing catch up from day one, and that's what we're doing now. We're playing catch up. First, the CDC said they had to do all the tests. Then they became the bottleneck. Then they said, okay, finally, the state laboratories can test. That opened up some more capacity. And now they're moving to, and private laboratories can test. And then you'll have additional capacity. But this has been a long time coming on this evolving process, and we're still not where we need to be, and everyone will say that.
Governor Andrew Cuomo, best of luck dealing with this crisis. We appreciate your time.
Thanks, Jake.
We're going to squeeze in another quick break. When we come back, we're going to talk about this with experts about what we just listened to from Governor Cuomo and about the epidemic of the coronavirus in general. Stick with us. We'll be right back. This hour, the death toll from the coronavirus in the United States has jumped to 27 after the first fatality reported on the East Coast in New Jersey. We're bringing you special coverage of the coronavirus pandemic as well as tonight's Democratic presidential contests. I wanted to bring in CNN's chief medical correspondent, Dr. Sanjay Gupta. Now also with us, Dr. Jennifer Nuzzo, an infectious disease epidemiologist at the Johns Hopkins Bloomberg School of Public Health. And also with us, Dr. James Phillips, assistant professor of emergency medicine at George Washington University Hospital. Sanjay, let me start with you. So you saw there Governor Andrew Cuomo talking about this kind of strong, some might even say drastic measure in New Rochelle, where it's the biggest cluster right now, the highest number of cases in one area, where basically no public events are going to happen for the next 2 weeks. They're sending in the National Guard to clean schools, to clean public transportation, to deliver food. Is that the future, or is that just one governor doing the most he can for this one cluster? What do you...
Well, I think right now it's just one governor doing this for one cluster, but I think obviously a lot of people are going to be taking their cues from what's happening here in New York. It's a significant measure. I mean, and you have to basically, with all these things, figure out the risk-reward relationship. Listening to your interview with him, he said exactly, he wants to really decrease these mass gatherings, get rid of them, make sure people get tested, all that. One does have to ask, in order to achieve those objectives, was a 1 mile containment with the National Guard necessary? Is that going to be reproducible in all these places where this happens? Probably not. So, tough decisions. I mean, but I understand what he's trying to accomplish. I think it's just a question of how do you get there? And maybe this is the best way, or maybe it can be done slightly with less drastic measures.
And Dr. Nuzzo, you were saying that people shouldn't misunderstand the idea of testing. It's not like every American needs to run out and get a coronavirus test.
Right, exactly. I mean, as you're hearing people call for expanded testing, that's absolutely appropriate because that's a policy fix that needs to happen, and it is hopefully happening. But that does not mean that everybody who's got a mild illness at home needs to go to the health system to try to get tested. In fact, the health system can absorb it, and we very much right now need to offload from the health system, preserve those resources for the severely ill. And at this point, given limited numbers of tests, the tests should be prioritized for those people who are severely ill. Doctors need that information to treat and to be able to isolate those patients. Most
people who get the coronavirus, it will only be mild, or they'll have some symptoms, but it will not be deadly or damaging. Absolutely. And if you fall into that category of someone who has a fever and respiratory symptoms, absolutely stay home. If your condition worsens, lose shortness of breath, then contact your healthcare provider. But don't just show up announced at doctor's offices or emergency rooms looking to be tested because you just need to know or feel like you need to know. I understand that people are very interested in doing their part to try to control the spread, but really the best thing they can do is to stay home when they're sick. And Dr. Phillips, you heard Governor Cuomo there talk about something you and I spoke about a few days ago on air, which is the real threat that there is to individuals who are in nursing homes or retirement centers where people are older, where people, many of them have underlying health conditions. And if there is somebody who gets coronavirus who enters that home, the real risks that there are inherent there.
Yeah, I reiterate that. I still agree with it. I think nursing homes are perhaps our biggest risk right now. But anywhere where you have people gather together in large amounts, there's a risk of disease transmission there. We're still trying to figure out the nuances of when you're transmitting virus, when you're not, for how long. Are you doing so without symptoms? So, I speak to a lot of docs around the country, ER docs and disaster folks, and everyone has their team of experts that they speak to and get advice from. And there's growing concern about mass gatherings and growing concern about whether or not it's advisable for people to go do that. My primary focus is in keeping our healthcare workforce safe. And we're seeing medical conferences canceled around the country right now. And I think it's imperative that doctors and nurses, no matter your specialty, I think we have to take that extra step beyond what the CDC is saying, beyond what is being recommended about mass gatherings right now, and just take responsibility for ourselves and for our patients and stay home.
Stay home. And Sanjay, so a first responder told me, was a first responder outside Seattle, that there were 7 firefighters who were tested, and those tests went to, I think, the University of Washington Clinic or wherever they get tested. There was such a bottleneck that they didn't get tested in time that they expired, and now those 7 firefighters have to be retested, and they have to remain in quarantine. Meanwhile, the Life Care Center nursing home there, 180 employees, 65 of them have symptoms, 0 of them have been tested at all. If this is the first bad cluster, and this is how the firefighters and employees are dealing with this, what does that say about the U.S. healthcare system?
Well, this is a failure of testing for sure. You know, there's no question about it. I mean, and you know, Governor Cuomo said it. We're in the bottom tier, really, of the world, and where this is circulating in terms of testing, and that's a shame. Look, I think there's many things about our healthcare system that can work really well. A public health system, if it at full capacity, can work really well. We may have limited resources to handle what's about to come. We can prepare for that sort of stuff. But one of the basic pillars of public health, the surveillance upon which so many other decisions are predicated, didn't work here, obviously. And it's terrible. I mean, I don't know how to justify it. I don't know that there's any excuse for it. Obviously, again, Governor Cuomo still, after all his conversations with people, can't explain it. I've been interviewing people for 6 weeks on this now, Jake. I still don't understand exactly what happened here, why we failed so miserably with regard to testing.
Yeah, it's in more than 30 states and Washington, D.C. Coming up, the coronavirus pandemic having an impact on the presidential campaign trail tonight. We'll explain after the break.
And welcome back. I'm Anderson Cooper. We're following 2 major stories this hour. Super Tuesday 2 and the rapid spread of the coronavirus in the United States and around the world. Those 2 stories are colliding on the campaign trail right now. I'm going to go to Abby Phillip covering Bernie Sanders' campaign. Abby, Senator Sanders is canceling a rally tonight, correct?
Anderson, it is the first time we have heard of a campaign event being canceled due to coronavirus concerns. But the campaign spokesman, Mike Kaska, says in a statement that after consultation with Ohio public health officials, they've made the decision to cancel the rally that was planned for here in Cleveland in just a few hours. It's a few blocks from where I'm standing right now. A source tells CNN that Sanders made the decision to cancel this rally himself. This is after several days of saying that they've been consulting with public health officials wherever they go before hosting a rally. They had about 5,000 people RSVP to tonight's event. That's according to the campaign. So it was a major decision for them to do that, but it was one that Bernie Sanders made himself. Anderson, in recent days, we have had many conversations with Sanders himself and with the campaign about what their plans were to adjust for the coronavirus. Sanders, a 70-something-year-old man who has prior health concerns. He had a heart attack several months ago, said that he's consulting with doctors all the time and that he's running for president, and it takes a lot of work. So he said that his personal routine has not changed much, except that he is using perhaps a lot more hand sanitizer. But this is the most telling sign that the campaign is responding pretty aggressively to these growing concerns that these large indoor gatherings could pose a public health risk. Anderson.
Abby, thanks very much. I want to go also to Jessica Dean covering Joe Biden's campaign. What's the status of Biden's campaign events tonight?
Well, Anderson, we're just hearing from their deputy campaign manager, Kate Bedingfield, that they are also canceling their rally here in Cleveland tonight. You see people were still setting up and kind of continuing to. Let me read you what Kate Bedingfield said. In accordance with guidance from public officials and out of abundance of caution, our rally in Cleveland, Ohio tonight is canceled. We'll continue to consult with public health officials and public health guidance and make announcements about future events. She goes on to say that in the coming days, Biden will thank his supporters here in Cleveland, and they're going to have additional information on where he'll address the press tonight. But Anderson, we started to see yesterday at the event in Detroit, everyone that came in was getting squirts of hand sanitizers from volunteers and staffers there and trying to keep their hands as clean as possible as they came in. But the big news right now, Anderson, just hearing from the Biden campaign that their event here in Cleveland will be canceled tonight out of an abundance of caution and over public health concerns. Anderson.
And any sense moving forward, or is this just for today?
Yeah, that's a great question. We're still kind of figuring that out. What Kate said is that they're going to kind of assess moving forward. We know he has events scheduled for the rest of the week. He's supposed to be in Phoenix for a debate over the weekend here on CNN. So, Anderson, we'll see. We're hoping to learn more here in the next few hours about what they're planning ahead.
Yeah, Ohio's governor recommended rethinking these kind of events. Obviously, both campaigns making the decision that they have made to cancel events today there in Ohio. We're back now with our team. We've got a lot of folks who have actually dealt with public health emergencies. Andrew Gillum here, Mayor Landrieu, and we actually have a doctor, Dr. Abdullah Syed. Talk about what public health officials are going through, what the governor in New York is considering, how you get your arms around it.
Every governor in America, every mayor in America, every county executive right now is meeting with their emergency preparedness team, from their firefighters to their first responders to their public health threats. In this instance, your public health officer would be your incident commander, and you're beginning to figure out exactly what you're supposed to do, when you're supposed to do it, how are you going to get it done. There's a lot of lack of clarity right now. There is a playbook here that works. Clear command and control, clear coordination, clear communication between all levels of government. And you have to be honest, you have to be transparent, and you have to have a high level of competence. Those are the things that really produce confidence. Right now, there's a lot of uncertainty about who can get tested, when the tests are available, whether or not we're past containment and into mitigation. All of these things have to get cleared up.
For all the talk by the vice president last week about 1 million tests going out by the end of the week,
well, just to give you a scale of that, I mean, we have 330 million people in the country. This thing's going to spread. Clearly, everybody cannot get tested, and there are not enough tests, and there's not a protocol set up. If you don't have insurance, you can't get tested. If you can't get a test if it's not prescribed by a doctor, and you certainly can't get it soon. And so that's not accurate information today. They could be getting ahead of it, but it's going to be a challenge for them.
Gotcha.
Yeah, to piggyback off of what the mayor said, I think that's entirely right. Even if you have these tests, you need to triage them to the highest probability of action. There's a saying in medicine that you don't run a test, the outcome to which you can't respond. And so you've got to put the tests where they're most useful. And the fact that we're so behind this is a real issue. And one of the things people need to understand about containment is that containment literally means tracing every single individual who was plausibly exposed to the virus and then finding their contacts and tracing them. What you have to be able to do is rule out the negative cases. Say, look, we're going to stop tracing them because we tested them and we found them to be negative. But without that capacity, you just got to assume everybody's a presumptive case. And if they're a presumptive case, you have to keep tracing, which means that you very quickly overwhelm your ability to contact trace. And that's where we find ourselves. And these mitigation strategies are real about saying, well, look, once we've overwhelmed that ability, out of an abundance of caution, we have to reduce the potential that somebody could be spreading it to another. And that really is where we are right now.
We're going to take a quick break. We're going to have more immediately on the coronavirus with our experts. We'll be right back. And we're back with our special coverage of the coronavirus pandemic. 2 more deaths were just reported in Washington state, bringing the total up to 29. That's nationwide in the United States. 29 fatalities thus far. Back now with our panel. Mayor Gillum, you look at what the governor is doing in New Rochelle, which is a unusually large cluster. Does it make sense to you?
I mean, obviously, the governor's got to do what he's got to do to keep the people in his community safe. What I think he is demonstrating, however, is a lot of our attention is toward what the president is doing, what the federal administration is doing, which I think is critically important. And there have been a lot of missteps. But state government and local government right now are our strongest holdups against the spread of this virus, as well as the containment of the virus. Right now, as Mayor Landrieu mentioned before, in my state, home state of Florida, 67 counties, you have 67 different tables that are convening where you have schools, nonprofits, hospitals, all the cities, municipalities that are located there, first responders, and they're right now plotting through how it is that they would contain the spread of this disease should their communities be impacted by it. Which what I would say to folks is don't be distracted, overly distracted rather, by some of the chaos that we may see happening in Washington. I trust that it will come under control. But do listen to your local officials, your mayors, your superintendents of schools. Those individuals have a good handle on how it is that local communities can respond.
Let me ask you two, because this is something I've been wondering, and I get a lot of emails from people about this and tweets and stuff, which is there's this, on the one hand, you look at it and people say, well, okay, it's going to be like a bad flu, 2% mortality rate overall, perhaps, although we're not exactly know because we don't know what the total number of cases actually is. But for most people, the vast majority of people, not the elderly, it'll be kind of a flu, bad flu in some capacity. If that is the case, then some people look at that and say, well, that doesn't seem so bad. Why, for the flu, we don't have schools closing. We don't have these drastic measures of the National Guard coming in. Why is this an overreaction, or what is that missing out on?
Let me just put this in context. So the flu kills thousands of people a year. It's a terrible disease, and we really ought to be doing all of the things we're talking about doing to prevent it.
And half of Americans sometimes do not get the flu shot.
Right. And those are things we have to do. The thing about this disease, though, right, is that there's a difference in the experience of coronavirus if you're young and healthy versus if you're older and if you have chronic disease. So overall, the mortality rate's 2%, but that's driven by a very high mortality rate, 1 in 6 among people who are over 80 and people with underlying chronic disease. And so public health is
it's much higher for them.
Much higher for them. And the only way we protect them is we prevent the spread to them. And so public health is about all of us collectively coming together to keep our society safe. And so for folks, I say, look, yes, for you, it may not be that serious. But for us, it's going to be a lot worse. And we have a responsibility to do the things that we need to do to prevent those of us who are most vulnerable, and those are our seniors and people.
And with the death toll that high in the elderly population, the potential is it would overwhelm hospital resources.
Absolutely.
Yeah. No, I'm just saying that if you just count the numbers, we say it's just 2%. 2% is a large number of people, and you ask how many hospital beds.
And that's 2% overall in the elderly population. You're talking a much higher percent.
Yeah, there's no question about it. Mortality rate's high. Look, we don't want people to panic, and it is accurate that 80% of the people that get touched by this are going to be okay. But in the other 20%, this has the potential to upset our institutions. It's already having upset with the public health system, the economic system. We're going to see the healthcare system through a new prism. It is going to be something that is with us longer than I think people expect.
So I was reading what the president was saying. He said today, it'll go away. Just stay calm. It will go away. We want to protect. You talk about the shipping, airline, cruise industry, but everybody has to be vigilant. It has to be careful, but be calm. It's working out. A lot of good things are going to happen. The consumer is ready.
Well, it is
it's
true
going to go away.
That the admonition that people should be calm and not panic is the correct thing. But the notion that somehow it's just magically going to disappear is not going to occur. It's going to appear to get worse because we're going to do more testing, and there's reason to believe that the more testing you do, the more positives you're going to have. And so we have to manage it, but you have to be vigilant, and it's going to be an all-hands-on-deck issue for the country.
The president is used to being able to drive a news cycle, and unfortunately you can't drive biology. And so, yes, people should stay calm. They should be focused on their leaders, which, as the mayor noted, in this case are the state and local leaders who've got a real handle on what's happening on the ground. I do want to say a couple things, though. Our public health infrastructure in this country has been decimated since the Great Recession. We haven't built it back up. And the thing about public health is that it's the thing that's quietly operating in the background to keep you safe. I remember when this had first emerged, and I'd done a couple of interviews about coronavirus, I said, it's going to be okay because our public health infrastructure is fantastic. I didn't appreciate the point to which it had been decimated under this administration, and a failure to lead at the top creates a whole lot of chaos because people are looking for some sense of how we make sense of this situation. They're not finding it from the usual suspects.
All right, still ahead, we're going to talk to the mayor of New Rochelle, New York, about urgent efforts to contain the coronavirus in that community. The New York National Guard is being deployed. Stay with us.
This is CNN Breaking News.
I'm Wolf Blitzer in Washington with more of our special coverage of the coronavirus pandemic. An emergency situation is unfolding in New Rochelle that's just outside New York City. The National Guard is being deployed there to try to contain a growing cluster of coronavirus cases. We'll talk to the mayor of New Rochelle in just a few moments. Let's go back to Jake right now. Jake, this outbreak is being felt here in the United States from coast to coast.
That's right, Wolf. And I just spoke with Governor Andrew Cuomo of New York a short while ago about the outbreak in New Rochelle. It's being described as a life and death situation. This hour, the coronavirus death toll across the United States just jumped to 29 since the last time I talked to you from this post, after 2 more deaths were confirmed in Washington state. The total number of confirmed cases nationwide also has gone up to more than 920. This changes hour by hour. We expect to get even more information soon. We're standing by for a briefing at the White House by the Coronavirus Task Force. President Trump was at yesterday's briefing, of course. He promised to give reporters an update today. The White House has not confirmed whether the president will, in fact, be back today. We also have correspondents in the field covering this global crisis. First, let's go to Nick Watt. He's in Oakland, California, where an infected cruise ship is docked. And Nick, are all the passengers off that cruise ship?
Jake, they are not. We were told that this was going to be a slow process, and it is. They got 400 or so people off yesterday. 26 of them had to be taken to the hospital in ambulances. It is taking time to get them off. 3,500 people aboard that cruise ship. Now, today, hundreds more will get taken off. Some Americans will be put on buses and taken to Travis Air Force Base and other military bases to serve their quarantines. There are more than 200 British people on board. Will get on a bus straight to the airport and be flown straight out of the country. Containment and mitigation, that is the focus here. Let's take a quick look at what else is happening around the country.
A hotspot exploding in New York.
New Rochelle at this point is probably the largest cluster in the United States.
There's now a containment zone. Schools, facilities closed inside that ring. The National Guard deployed to help deliver food and clean.
This is literally a matter of life and death.
In New Jersey, 4 more presumptive positives and a death. A man whose only known travel was to New York. Coronavirus now in nearly 40 states, with another hotspot up in Washington state. Now 19 deaths connected to this nursing home. The elderly are most at risk, but younger people can still get sick and certainly carry and spread this virus. In Sacramento County, an elementary school student just tested positive, the youngest known case in the U.S. we've heard about. More colleges across the country are cancelling face-to-face classes. Harvard ordering students out of houses and first-year dorms by Sunday in an effort to de-densify our community. Testing, of course, also key at a meeting with major health insurers this morning. The vice president said they have
agreed to waive all co-pays on coronavirus testing and extend coverage for coronavirus treatment in all of their benefit plans.
But the CDC director says underfunding has slowed the testing process in public labs.
There's not enough equipment, there's not enough people, there's not enough internal capacity, there's no surge capacity.
Meanwhile, hundreds of passengers remain trapped on the Grand Princess here in Oakland, waiting to be tested, then dispatched for treatment or quarantine. Frustration building on board.
We have been unsuccessful in getting anyone with knowledge or authority to provide accurate information to share with you in a timely manner. And for that, I apologize.
There are about 1,000 crew members on that boat, and they will not be getting off. 19 of them have tested positive. We're told that they are right now asymptomatic and being kept in isolation in their cabins. The cruise line tells us it is at this point unclear exactly where the crew will serve out their 14-day quarantine period. Jake?
All right, Nick Watt in Oakland, California. Thank you so much. Let's go now to Kirkland, Washington, where we find Omar Jimenez. And Omar, the state of Washington just confirmed 2 more deaths. Do we know who they were?
At this point, Jake, those 2 deaths happening both in senior living facilities, one at each one happening at the Issaquah Rehabilitation Center and the other happening at the Ida Culver House, both in the Seattle area, and highlights part of the most vulnerable population in this, elderly patients and those with underlying health conditions. The story has been very similar here at the Life Care Center nursing facility in Kirkland, where we just learned moments ago 55 residents in total have tested positive for the novel coronavirus. 34 are hospitalized. 21 are still inside behind me. And to give you an idea of how badly this place in particular has been affected, it was less than a month ago they had 120 residents inside. They are now down to just 49 between the hospitalizations and the deaths. And of the deaths, the 29 that we have seen nationwide, 19 of them stem from this country. And it's part of why Governor Jay Inslee put in new guidelines in regards to visiting nursing facilities across the state of Washington today, Jay.
All right, Omar Jimenez in Kirkland, Washington, thank you so much. Let's go now to Jim Acosta at the White House. And Jim, just in the last hour, we've seen the Biden campaign and the Sanders campaign cancel events in Ohio, cancel rallies. Is there any indication that President Trump is changing any of his behavior, campaign-related or otherwise?
Not at the moment, Jake. As a matter of fact, right now, the president is preparing to give the Medal of Freedom to retired General Jack Keane. That is happening in the East Room of the White House right now. And then in about a half an hour from now, the Vice President, Mike Pence, along with the Coronavirus Task Force, they're scheduled to come in here to brief reporters on the latest on the administration's efforts to combat the outbreak. I will tell you, though, talking about some of the president's habits, day-to-day habits, federal health officials, I'm told, according to a source close to the Coronavirus Task Force, are starting to worry about the president's habit of shaking hands with people, politicians, constituents, and so on, as he goes about his daily business. According to the source close to the Coronavirus Task Force, some of these health officials wish the president would opt for the elbow bump that we've been seeing Vice President Mike Pence opt for as he's been out on the road talking to Governor Inslee out in Washington and so on. And one of the things that we've been looking for as he's awarding this Medal of Freedom to General Jack Keane right now is whether or not the president continues with that habit. He's famous for being a germaphobe in the past, but last week at a town hall on another network, he said, that essentially he's a politician. He can't stop shaking hands. Now, in terms of what the administration is doing to combat the outbreak, they have been talking today with Republican senators up on Capitol Hill about a possible economic rescue package that would target some of the industries that have been affected by this outbreak. And, we're going to get an update, I think, in about a half an hour from now from the vice president, from his task force about just what's happening with testing and so on that have been at the heart of the controversy surrounding this outbreak.
All right, Jim Acosta at the White House, thank you so much. And Wolf Blitzer, the Director General of the World Health Organization says you shouldn't even do the elbow bump, he says, because that brings you within a meter of another individual. Just wave to people.
Better off just standing away from a lot of folks right now. This is a really serious situation that's unfolding. Up next, so we're going to speak live to the mayor of New Rochelle, New York, that's just outside New York City, where the National Guard is now being deployed to try to contain an outbreak of coronavirus. Live pictures from the White House briefing room later this hour. The Vice President Mike Pence and the Coronavirus Task Force, they're expected to walk in, make some statements, give us the latest information they've collected, then answer reporters' questions. We'll have live coverage of that. We're back with our special coverage of the coronavirus pandemic. The death toll climbing here in the United States to 29 just minutes ago. Also tonight, officials are taking very dramatic action to contain a coronavirus outbreak in the New York City suburb of New Rochelle. Let's go to New Rochelle right now. The mayor, Noam Bramson, is joining us right now. Mayor, thank you so much for joining us. I know you have a lot going on. The governor of New York is making your city what's being described as a containment zone and deploying the National Guard. So, Mayor, what will life look like when this goes into effect?
Well, to be very clear, because there's some misunderstanding, the containment zone is an area in which large gatherings will be limited. So it does have a significant impact on major institutions, on schools, on houses of worship. But it's not an exclusion zone or a quarantine zone. So people will be permitted to come and go. It will not impact individuals or families or businesses. So this is a sensible public health measure in order to mitigate the spread of the virus in the area which has the largest concentration in our city, in our region, one of the largest concentrations in the country. What is the concentration right now? Well, there are about 100 cases in New Rochelle. I say about because it's a number that changes by the hour. It is important to keep in mind that even though the number is increasing, that's not necessarily an indication of the virus spreading. It is an indication of greater detection of the virus. So we need to keep those numbers in perspective. But there's no question this is a major challenge for our community. It's the kind of challenge no community would ever welcome. Many people in New Rochelle are concerned about their own health, the health of their families, the health of their neighbors. For those who are subject to quarantine, it's an additional burden. Can't go to school, can't go to business, can't engage in the normal life and commerce of our community. But I have to say I'm very proud of how people in New Rochelle have risen to the occasion. The concern has been proportionate to the issues before us, but it has not strayed over into hysteria or into panic. People are taking direction from public health authorities. They are being supportive of each other. They are listening carefully to information, and they're remaining calm. So we are demonstrating that this is a strong and resilient city, And even though we know the days ahead are going to be difficult ones, we have no doubt that we'll be able to overcome the challenge.
New Rochelle is in Westchester County, just outside New York City. The county executive, George Latimer, told CNN that Metro North and Amtrak trains will still come and go in New Rochelle, but individuals who are compromised won't be on those trains. Can you really ensure, Mayor, that anyone with this virus won't get on one of those trains into New York City or elsewhere?
Well, look, I don't think anyone is in a position to make an assurance of that kind, but what we can do is take common sense public health measures, which again can mitigate the spread of the virus. We also absolutely must take steps to limit exposure for the most vulnerable among us. Senior centers, nursing homes, assisted living facilities, additional safeguards for those centers, I think, are absolutely vital. Governor Cuomo has been outstanding in leading our efforts, and prohibition on visitors for those centers was implemented a few days ago, is still in place today. So it's a layered approach which recognizes that for most of us, contracting the virus will not be a life-threatening circumstance. We'll be able to recover without much difficulty. But for a fraction of people who are elderly or have compromised immune systems, respiratory systems, this poses a much more serious hazard. That's the population we need to be most concerned about.
The wife of a New Rochelle coronavirus patient says he went to the doctor many times and it took the hospital days to figure out what was going on. What lessons are you learning about identifying these cases and tracking this type of community transmission?
Well, ramping up our capacity to test in a rapid fashion and in volume has been one of the key challenges, which I think has been identified by just about every public health professional. In New York State, I believe the latest numbers were that we can test a few hundred per day. That's increasing. In fact, Northwell is going to be bringing in a testing center into New Rochelle, which will be automated, so it will accelerate things. But, you know, the old statement, you can't manage what you can't measure. And therefore, being able to test in a more widespread and efficient and swift fashion is very important to making sure that we, not just in New Rochelle, but nationwide, can confront this public health emergency in the best possible fashion.
Are you confident you have the resources to respond to this crisis?
Well, New Rochelle, as a mid-sized municipality on its own, would not have the resources, but we are grateful that the state is bringing in National Guard workers to assist us. And to be clear, they're not here to militarize our community or serve a policing function. They will be supporting with logistical and operational needs, principally cleaning locations, assisting with the delivery of lunches to students who are qualified for free or reduced lunch. We have 11,000 kids in our public school system. Several of the schools are going to be closed for a 2-week period of time. We want to make sure those people are carefully taken care of. And a city of our size would not be able to do it on its own. So we're grateful to the state for flooding our area with the resources necessary to confront our needs.
The mayor of New Rochelle, Noam Brownson. Mayor, thank you so much for joining us. I know you're very, very busy on this day. And good luck to you. Good luck to all the folks in New Rochelle and Westchester County, of course, as well. Thanks so much for joining us.
Thank you, Wolf.
Coming up, we'll go live to 2 of the global epicenters of the coronavirus as new deaths are reported and new action is being taken. Looking at live pictures coming in from the White House briefing room, the Vice President Mike Pence and the coronavirus task force members, they're expected to walk in fairly soon, make an update, some statements on what's going on right now, the latest information they have, then take reporters' questions. We, of course, will have live coverage of this briefing. We're bringing you special coverage of the coronavirus pandemic as only CNN can with our worldwide resources. Right now, I want to go to China, the epicenter of this crisis. CNN's David Culver is joining us live from Shanghai. David, what's the latest there?
Well, I can tell you that they are showing some signs of progress here, and that's coming all the way from the top. Early on in this, we noticed that the president here, Xi Jinping, was keeping a very low profile, even as this thing got worse and worse, and folks were getting more and more concerned. However, it marked a milestone this week. In fact, just 24 hours ago, we saw that the president made a visit to the epicenter of all of this, Wuhan. That's within Hubei province. That's where this outbreak started. That's where tens of thousands have been infected by this virus. Now, the most extreme lockdowns are within that area. And it is fascinating, Wolf, for me to listen into how it's being handled in the U.S. in particular, because you've got to wonder if they can do nearly the level of containment that has happened here. And containment, as your panel has been pointing out there, goes beyond just sealing off neighborhoods, which they have done here. Quite frankly, what I was hearing from New Rochelle as far as minimizing some of the mass gatherings, that's something that's happening in a city where I am, Shanghai, 24+ million people. That is light lockdown compared to the sealing off of communities within, for example, Hubei province. But then the other aspect of this, Wolf, is tracking people. And they're doing that here through big data. They're trying to figure out who you were in contact with, perhaps were you exposed, and are you taking that to another area? How exactly is that happening? I wanted to show you this, Wolf. This is a QR code. Every one of us here has to check in when we travel into a city, when we go into a hotel, when we go into a shopping mall. And when we do that, they're then able to know our location and figure out if perhaps down the line we are in an area that happen to have exposure. They'll be able to figure out where we are, and they'll track us down and potentially put you in quarantine, Wolf.
All right, be careful over there. David Culver on the scene for us in Shanghai. I want to go to Italy right now. That's seen the biggest increase in deaths due to the coronavirus crisis. At least 168 people have died over the past 24 hours alone. Ben Wiedemann is on the scene for us in Bologna right now. It's a beautiful city. I've been to Bologna, and the streets over there, Ben, clearly empty.
Yes, they are empty indeed. The only traffic we've seen are some police cars and food delivery bicycles going around. Now, even though Italy is technically on a lockdown, it appears that the authorities are going about this rather gradually, keeping in mind that unlike China, Italy is a democracy, and the people need to be slowly eased into this new reality. But we were speaking with some people today who said that in order to contain this virus, which the numbers have really increased dramatically in the last 2 weeks, that they believe that Chinese-style measures will have to be taken. There are some politicians who generally do support the measures taken by the government, who are suggesting that perhaps everything should be closed. Bars and restaurants, which are open now from 6 a.m. to 6 p.m., everything should be closed except grocery stores, where people can at least get the food to eat. Because what we have seen, we arrived here just 15 days ago. The number went from 322 recorded cases to now over 10,000. The number of deaths, there were 10 when we arrived, now well over 600. So there is mounting pressure to try to get this situation under control at a time when the medical services, the health services in this country, which are some of the best in the world, are under increasing strain trying to treat those who are in the intensive care units. And as we've seen, most of those who have died have an average age of 81. The worry is that young people who only make up about 5% of those who have the disease may be passing it to their older relatives. So the government here is struggling to get the situation under control, so far with limited success. Wolf?
All right, Ben Wiedemann in Bologna, be careful over there as well. Thank you very much. It's a serious problem. Italy, 60 million people, as we've been reporting, on lockdown right now.
And just one week ago, we went from like 2 to 20 deaths over a weekend. And now they're in the hundreds. Let's talk about more of this with CNN Chief Medical Correspondent Dr. Sanjay Gupta, also joining us, former U.S. Surgeon General Dr. Vivek Murthy. Dr. Murthy, let me start with you. What should people at home who are not over 60, do not have underlying health concerns, have not yet had it come to their community, in other words, the vast majority of Americans, what should they be doing and how worried should they be?
Well, first of all, we should recognize that what we're dealing with this novel coronavirus, COVID-19, is different from the flu. There are common questions that come up about, is this just a cold? Is this just a flu? And it's not. It is very transmissible, similar to the flu, but it is more deadly in the sense that it has a higher mortality rate. We're still trying to figure out exactly what that rate is, but by all estimates, it looks like it will be significantly higher than the mortality rate of the flu. But the good news is there are steps people can take to protect themselves. Basic hand washing measures, making sure you're washing your hands frequently and using hand sanitizer, staying at home if you're sick, making sure you're not touching your face, especially when you're out and about, and touching other surfaces, and decontaminating surfaces, including your keys and your cell phone, These are common steps we can all take. I also think now is the time for us to think about how we greet each other and to modify that so that we are minimizing contact. Instead of the handshake, we can do the elbow bump. We can also just use a hand over our heart as a simple greeting, which people do in many cultures around the world. But these are simple steps we can take that can reduce our risk of contracting this virus.
And one of the things going on right now, Sanjay, is a lot of colleges are shutting down or changing to an online system.
Yeah.
What about parents of children who are in grade school, middle school, high school? Should those parents be concerned? Should those schools think about closing if there is no confirmed case directly in that community?
It's interesting because I think the benefit of that has been largely modeled on the flu, like Vivek was talking about. This coronavirus is different. With flu, I think it made a lot of sense. Kids get the flu. They can transmit it. And here, we know that kids can get the infection and they can transmit it even if they're not developing symptoms. We know that. But it's a small driver of things. The bigger driver is people who are sick, coughing, sneezing, putting those respiratory droplets into the air. So I do think you have a harder time justifying school closures for this reason. Actually trying to prove that it works. And obviously everything in life is a risk-reward relationship. So the reward, maybe you do decrease somewhat. The number of, you social distance a little bit more as a result. But the disruption is pretty significant, I think, here. So the other things, closing of mass gatherings, possibly people working from home, these types of things. Obviously, identifying people through surveillance and testing and contact tracing, isolating people who have been positive. All those things, yes, I think, and do it early because that's when it seems to make the most difference. School closings, I think, is still a little bit of a question mark in terms of the real impact of that.
So it makes more sense to you that they're canceling concerts than it does for Harvard or Princeton to cancel classes?
I do. And look, I don't think there's a right answer here, and people are going to have differing opinions on this, I know, but what is the justification for it? What exactly are you getting by pulling all the kids out of Harvard and sending them home? What is the point? No question, campuses can be a hotbed of various viruses, the flu, meningitis, things like that. But again, we're talking about something that really doesn't affect young people that much. They seem to be fairly insulated from that. They are in the young and healthy sort of category, so far less likely than the vulnerable populations to have any negative impact from this. And now you're putting them back into the community where maybe they're going to be back with parents or grandparents, possibly taking a virus home. So I don't know, and I'm sure they gave it a lot of thought.
Mm-hmm.
But
and I'm sure their lawyers played a role also.
Yeah, maybe is this more just let's be full of abundance of caution, or is there a bigger justification? I don't know.
What do you think? I mean, is it overreacting for colleges to shut down, given the fact that the average age of a coronavirus death in the United States, we were told yesterday, is 80? And certainly we don't mean to make light of that. Obviously, this is a horrible disease, and if you're 70 or 80 or 90 and you have it, it's horrible. But if you're a college student, you're at far less risk. Does it make sense to you that Harvard, Princeton, American, and others are shutting down?
Well, this is what I think they might be considering. I think they're looking at not only the risk to their students, but they're probably also recognizing that once a student contracts this virus, they may have the ability to transmit it to other people who may be more vulnerable. Maybe that's their parents at home, whether it's other people in the community. But if you're a college making this decision, some of the data that you really need to know is how much local spread is there in the community around you. And the real challenge right now is because of the difficulty we've had getting adequate testing to communities across the country, colleges don't have adequate information. Whatever numbers they're seeing, they're wondering, are there many more cases and we just don't know about them? As we ramp up testing capacity, which I'm hoping we can do as quickly as possible, hopefully we'll get a better handle on this. But many institutions are worried that there are more cases out there than we're seeing.
And Sanjay, what about the doctor in China who died, who was one of the first physicians on the case, who was a whistleblower? This is back when the Chinese government was denying and very opaque about everything. I think he was something like 40 and he died. And we don't know of any underlying health conditions he had.
No, and and I talked to Dr. Redfield, specifically the head of the CDC, about this. I think there's two things. When you look at even with flu deaths, those are more likely to affect the elderly and people with pre-existing conditions. But you do get people, while the vast majority of people fall into those age ranges, there are some outliers every now and then. And also, as a physician who was taking care of these patients, is it possible that he had a much more significant exposure to this virus than other people? That's possible as well. So it can happen. It's far more unusual. I mean, you can actually put numbers behind this. We talk about the fatality rates being around 2%. People in their 70s and 80s, it's closer to 15 or 16%. Still, look, it's still not, it's not 100%. People think this is universally fatal in people who are older. It's by no means 15, 16%, but that's 8 times higher than people who are younger.
And then we just heard out of Children's Hospital of Philadelphia that a doctor there who just returned from a country where there are COVID-19 cases, not one of the ones on level 3, reconsider traveling there level from the State Department, but a place that there were sicknesses, came to the United States, saw about 24 patients at Children's Hospital of Philadelphia, interacted with about 17 staff members, and then about 4 days into it realized his progressive symptoms meant that he should get himself checked out or herself checked out. This is going to spread in ways that we cannot even anticipate.
That's right. And this is why the 2 things become really important here. One is that we have as much transparency into the situation as possible, which means that we not only need testing, but we all need to be aware of what the numbers are. But the second thing is that we have to get ahead of this, which means not only practicing safe sanitation practices ourselves, but also thinking about social distancing more. Now, we talked a little bit earlier about changing how we greet people, but social distancing also includes staying away from mass gatherings. It involves shifting to telework instead of everybody coming in to a workplace. And in most extreme measures, they can involve closing schools. Now, while we talked about colleges, the decision that affects far more young people is actually the closure of grade schools. So elementary school, middle school, high school. Some localities have made the decision that that's the right thing to do. But what this is highlighting is that we are woefully ill-equipped as a society to deal with situations where we may need to pull kids out of school. We don't have, for example, the safeguards to provide paid leave to parents who need to stay home. We don't have paid sick leave for those parents if they themselves become ill. So one of the things we're learning because of the coronavirus is that there are fundamental building blocks of a healthy and resilient society that we need now to build and put in place, not just for now, but also for future outbreaks.
You sound like you're about to announce your presidential campaign. You have my vote. Thank you so much. Really appreciate it to both of you doctors. We're standing by for a coronavirus briefing at the White House. First, we're going to squeeze into this quick break. Stay with us.
Once again, we're standing by for the White House briefing. You're looking at live pictures coming in from the White House. Looks like the coronavirus task force members, they're beginning to walk up there. The Vice President, Mike Pence, he'll be joining them, we're told, momentarily. He's going to be walking in. Let's listen into this briefing. There's the Vice President.
Great.
Good afternoon. We just completed today's meeting of the White House Coronavirus Task Force, and I couldn't be more proud of the efforts of the men and women standing behind me or all of those standing behind them. President Trump said from early on that this would be a whole-of-government approach, and today gives evidence of the fact that it is also a whole-of-America approach. We're bringing the full resources to the federal government and the full resources of this great economy and our great business sector to bear in protecting the American people and protecting American families. A few updates from today. As we continue to expand testing availability across the country, testing is now available at all state labs. By the end of this week, there will be more than 4 million more tests made available in jurisdictions around the country. 1 million are already in place. Thanks to the good work of our top commercial labs that the President Trump brought together yesterday, LabCorp and Quest are in the process now of distributing and marketing coronavirus tests all across America. And we're working with state and local officials to ensure that that happens as rapidly as possible. But as the testing is expanding, we wanted to make sure the American people knew that testing was available to them and that cost would not be a barrier. Today, President Trump assembled the top health insurance executives in America. And as we announced earlier today, all of our major health insurance companies have now joined with Medicare and Medicaid and agreed to waive all co-pays, cover the cost of all treatment for those who contract the coronavirus. They've committed to no surprise billing and they've committed to encourage telemedicine. It was a year ago that Medicaid actually expanded to pay for telemedicine. Medicare pays for telemedicine. So now for seniors who may think that they are either at risk or have contracted the disease, they can get medical advice without having to go to the doctor or go to an emergency room. I know I speak for President Trump when I say how grateful we are to see our health insurance industry step forward to meet this need so that no American should be concerned about being able to pay for or afford the cost of a coronavirus test if they deem and their doctor deems it to be appropriate and necessary. The President also went to Capitol Hill today to meet with members of the United States Senate Republican caucus. There he talked about an economic package, including he's calling for payroll tax relief. And I think most important to the President's heart, we want to make sure that hourly workers, hardworking blue-collar Americans that may not have paid family leave today, that small and medium-sized businesses in America would be afforded the resources to provide paid leave so that no one would feel that they have to go to work if they might be infected or if they might have been exposed to the coronavirus. We had a good reception on Capitol Hill. Our legislative teams have fanned out. We're going to be working with Republican and Democrat leadership to move an economic package. Larry Kudlow will be reflecting on that in just a few moments. We also talked about what are known as N95 masks, and we're working, Senator Deb Fischer and others have important legislation that would extend temporary liability protections so that masks that are made for industrial use could be sold to hospitals to ensure that our healthcare workers are properly protected and outfitted. And we're grateful for growing bipartisan support for that measure, and we're going to be working earnestly with Republicans and Democrats to move a reform that would make more N95 masks available. I'm also pleased to report that we did receive this afternoon a comprehensive proposal from the cruise line industry, a proposal that includes advanced screening, improving medical services on ships, providing for airlift evacuation and land-based care at the expense of the cruise lines for anyone that might be not only infected with the coronavirus, but with any serious illness. We'll be reviewing that in the next 24 hours. The President's objective is for us to make cruise lines safer, even as we work with the cruise lines to ensure that no one in our particularly vulnerable population is going out on a cruise in the near future. I'm going to recognize Dr. Fauci to talk about where we are. And Dr. Birx will give us some research that she's done on the scope. We'll have other updates. But let me say once again, this is a whole-of-government approach. And from early on, President Trump has insisted that our government at the federal level, all of our partners at the state level, work in concert to protect the American people. And as we stand here today, the risk to the average American of contracting the coronavirus remains low. But we're absolutely determined to give every American the tools and the information that they need to protect themselves, their families, their workplace, their schools, and we're going to work together. We're going to work together to see our way through this, and working with leaders in both parties in Congress, working with leaders at the state level all across this nation. I'm confident we will. With that, Dr. Tony Fauci for an update on the status.
Thank you very much, Mr. Vice President. Just to give you a very brief sketch of what we do every day, the cases continue to increase globally. We're paying particular attention to the cases in Europe, in Italy, and France, in which we're starting to see that up at the same time as the relative number of new cases come down from China. What we're seeing in Europe is that Europe is in that upslope. So that's something that is expected. That's the way these kinds of outbreaks go. This is not a surprise to anybody if you look at the history of infectious diseases outbreaks. In the United States, we continue to have new cases. As of this morning, there were 712, I believe, with 27 deaths. Guaranteed by the time of this evening, that's going to be up, and there'll be several more. and tomorrow there'll be several more. So we realize that this is something, obviously, that we've been saying all along, that we're taking very seriously. Now the question is, what are we going to do about that? And there are a number of things that one can do in order to blunt it. If you look at the curves of outbreaks, you know, they go big peaks and they come down. What we need to do is flatten that down. That would have less people infected. That would ultimately have less deaths. You do that by trying to interfere with the natural flow of the outbreak. So what we're saying today is that although we keep coming in and saying appropriately that as a nation, the risk is relatively low, there are parts of the country right now that are having community spread in which the risk there is clearly a bit more than that. And you know the places, you know, Washington State, California, New York, and Florida. But what I want to talk to you about today, just for a moment or two, is that we would like the country to realize that as a nation, we can't be doing the kinds of things we were doing a few months ago. That it doesn't matter if you're in a state that has no cases or one case. You have to start taking seriously what you can do now, that if and when the infections will come, and they will come, sorry to say, sad to say, they will. But when you're dealing with an infectious disease, you know, we always have that metaphor that people talk about, that Wayne Gretzky, you know, he doesn't go where the puck is, he's going where the puck is going to be. Well, we want to be where the infection is going to be, as well as where it is. So what we have here, if you could see that here, what it's here is that if you go to coronavirus.gov, remember when Dr. Birx yesterday mentioned some of the things that we put together. These are really simple. Keeping the workplace safe, keeping the home safe, keeping the schools safe, and keeping commercial establishments safe. This should be universal for the country. Everyone should be doing that, whether you live in a zone that has community spread or not. When you have community spread, you're obviously going to ratchet up the kinds of mitigations that you have. But at a minimum, this is the minimum that we should be doing. So everybody should say, all hands on deck, this is what we need to do. So I'll stop there, and later I'll be happy to answer questions.
Thank you, Dr. Fauci.
Thank you, Mr. Vice President, and thank you, Dr. Fauci, for that clarity. We continue to monitor the situation across the country and across the globe, and we are very fortunate between Dr. Fauci and I. We have long-term contacts out there in many of these countries that are experiencing current outbreaks. We continue to review all the scientific literature to look for insights and to really determine who's at the greatest risk. And that's why we've talked to you about people with immunodeficiencies at any age, people with medical conditions, and the elderly, and how important it is for all of us to take these precautions in the household to protect others. Because we have circulating flu and other respiratory diseases at this time. We all have to act like all of those diseases, any respiratory disease, can be transmitted to others. And as we said yesterday, we're hoping that decreases all the respiratory disease we're experiencing. Finally, we got new reports out of China who had 9 pregnant women during an acute COVID infection, and all 9 were infected. And they delivered while they were infected, and all 9 babies were healthy, and the mothers were healthy. So we continue to look for data like that to be reassuring to the American public, at the same time ensuring that every single person is participating in this response to this virus and taking those precautions that we should be taking every day. If we start doing this today, we will be ready next year for any of our respiratory diseases, because I think we'll be able to show that these simple household, simple work, simple school, simple business approaches across the country can change all of our respiratory diseases. So we thank you for getting the message out. We thank you for the participating and ensuring in your households and in households around America that we're protecting all of those who need our support right now.
Excellent. Thank you, Dr. Birx and Dr. Fauci. And this information is available at coronavirus.gov. And as we said, we can't say often enough, the risk of contracting the coronavirus to the average American remains low. But for senior citizens with serious underlying chronic health conditions, the potential for serious consequences is very real. And make no mistake about it, by practicing these habits in your home, in your school, in your business, you're not only protecting your health, but you're also protecting those that are most vulnerable. With that, for an update on the progress that President Trump made today with our health insurance companies, I'd like to recognize Seema Verma.
As the Vice President said, we had a terrific meeting with the insurance companies, a real example of a public-private partnership where they agreed to waive copays for testing, not do any surprise billing, and also cover the costs of the COVID virus-associated costs. The other things that they did is they asked the President for more flexibility in Medicare Advantage plans. And the President agreed to do that. And so today we issued guidance to our Medicare Advantage plans that not only can they waive the costs for the test, but they can also go further to removing prior authorization requirements. They can waive prescription refill limits. They can allow for mail delivery of prescription drugs and expand more access to telehealth services if they weren't offering that in their plan. Also at CMS, we continue to work with healthcare providers around infection control practices. We met with home health agencies and also hospitals, and today we issued guidance to dialysis facilities as well as home health agencies around infection control.
There's been a great deal of attention about the Grand Princess, and HHS, working with the Coast Guard, with the Department of Defense, is currently working through disembarking American passengers returning foreign nationals to their country, and I wanted to ask Secretary Azar to speak and update us on the progress.
Thank you. So with regard to the Grand Princess, I wanted to first express our appreciation to Governor Newsom, to the Mayor of Oakland, the people of Oakland, the longshoremen, the stevedores who've helped with bringing it in and clearing the dock area so that we can do all of our operations there. We've got Admiral Abel here with us today, who's been leading the Coast Guard efforts, and then Deputy Secretary Began from State has done incredible work with our foreign partners to help with the repatriation of their nationals who are on board the ship. As of our data that I've got is as of noon Pacific time today, so this will have increased quite substantially since my last update. But as of noon Pacific, we had 548 individuals who have been offloaded from the ship. 228 Canadians are already back in Canada, flown there, I believe, was overnight. 171 Californians were taken by the government of California and are now at Travis Air Base. 26 individuals were sick, and they are being treated for various. It could be from the novel coronavirus. It could also just be we had some frail individuals who are sick that needed treatment. Our goal is to get all of the citizens of California off today to be in the care of the California state government, as well as to get the UK citizens off today so that they could be repatriated to the United Kingdom. We continue to work with other countries on all of those maneuvers. We will have non-California residents who will be in transport to the bases at Dobbins and at Lackland today, we hope, or tonight. So everything is progressing. It seems to be progressing well. We're using the highest isolation, quarantine procedures, medical screenings possible to ensure the safety of not just the passengers, but also of the local communities and all of the healthcare workers and others, emergency responders are helping. So thanks to all of our partners for their help with this very complex operation.
Yeah, well done. Good report. And let me echo the Secretary's appreciation to Governor Gavin Newsom, the state of California, the city of Oakland. It has literally been a seamless partnership. Everyone on that ship will be tested, isolated and quarantined as appropriate, and provided with treatment. The crew on the ship, other than those who were ill, will be quarantined on the ship offshore. But it really represented the kind of partnership and cooperation from every level of government that every American I know is grateful to see. With that, on the economic front, Larry Kudlow.
Thank you, sir. Yesterday, in a meeting in the Oval, the President, acknowledging there are going to be challenges on the health and economic side, he mentioned that he intended to bring the full power of the federal government to deal with these challenges. And accordingly, as Vice President said, up at the Republican Senate luncheon today, and he mentioned it in this room yesterday, President Trump has unveiled his proposals, strong proposals, for a temporary payroll tax cut holiday, which I think he would prefer to last through the end of the year. Also administratively, as Treasury Secretary Mnuchin and others have suggested, we are trying to, we will use assistance to unpaid sick leave people, very important point. Also small and medium businesses, another important point, and also possibly to some distressed industries or sectors in the economy. Maybe tax deferral might be a useful tool and other means. So this is a strong across-the-board package. We are consulting with leaders in the House and the Senate with respect to this package, and particularly the payroll tax holiday. Let me just say, coming into this difficult period, the economy is in fundamentally good shape. We saw a blockbuster jobs report last Friday. Today, for example, the Small Business Confidence Index, the NFIB Business Confidence Index, registered a very strong number, keeping its near record high. The unemployment remains low at 3.5%. Other indicators look pretty good. We had a lot of momentum in the first quarter. Good thing. I recognize the challenges, and that is why we are proposing these fiscal measures to combine with monetary measures that have already taken. And again, I'll repeat the President's words. It just struck me as his determination. He intends to bring the full power of the federal government to deal with these health and economic challenges.
Thank you, Larry. Well said. And a word from Surgeon General Jerome Adams. General.
Good evening, everyone. As Surgeon General, whether it's opioids or cigarettes or the coronavirus, my job is to help the American people understand how to live a healthy life. And I'm asking all of you, I'm imploring all of you to help share my prescription for America to overcome this coronavirus situation that we're in. There are 3 parts to it. Number 1, know your risk. As you've heard many times, but it's still important to impress upon America, if you are immunocompromised, if you have chronic medical conditions, if you are over the age of 60, you are at higher risk. If you are a child or a young adult, you are less likely to be impacted by the coronavirus. Number 2, the second part of the prescription, know your circumstances. Are you in an environment where you can telework? Are you planning on going to large gatherings like church? Do you live in a community that is being particularly impacted by the coronavirus? And you can find out this information from your state or local health department. Does your state have a hotline that you can call into to help you assess symptoms? Again, knowing your circumstances. And number 3, and this is the most important part, know what you can do to stay safe. And we have really leaned into coronavirus.gov. Please send people to that website. We've put the tools on there for individual groups, specific audiences, so that people can understand how to stay safe. If we follow this prescription, we will overcome the coronavirus. As Dr. Fauci said, we will see more cases. Unfortunately, we are likely to see more deaths. We have not hit the peak of this epidemic quite yet, but if we follow this prescription, then we will decrease the number of people who are impacted, we will decrease the number of people who will die, and we will more quickly get to the end of this situation. Thank you.
Great job. Great job. Questions? Please.
Mr. Vice President, that poster right there, it says to avoid crowding, consider rearranging large activities. So will the Pence-Trump campaign suspend campaign rallies and other activities? I
think that'll be a decision that's made literally on a day-to-day basis. I thought Dr. Fauci spoke to that yesterday very well, that we're going to, I'm very confident that the campaign will take the very best information and make the very best decision going forward. But these proposals are things that every American can do all across the country that will reduce the risk of either contracting or being exposed to the coronavirus.
Mr. Vice President, on the economic package, the word unveiled was just used, but so far the public has not seen it. Mm-hmm. How big is this package? How big is the payroll tax cut going to be? When is the general public going to see what you all have put together?
Right. Larry?
We are working out details right now, so I don't want to quote any numbers ahead of time. You know, you make a proposal, we're checking with the leaders of both parties in both houses and see what is doable and where the, tough nuts are going to be. So I don't want to get into any detail. I think the outline of the thing is very important. The payroll tax holiday is probably the most important, powerful piece of this. But on the other hand, I want to draw attention. We can use administration and executive authority, again, to help unpaid sick leave people, which is very important. We can use it for the medium and smaller businesses, which is very important. Other distressed sectors, we have some leverage on tax deferral. We know, I mean, look, I will say again, as I have for quite some time, the economy is strong. We also know there are going to be problems ahead. We know there are going to be challenges ahead. Don't deny it. We'll see. I want to take that a day at a time and a fact at a time, a statistical release at a time. But anyway, this will be the broad package. And at some point in the near future, we will outline a more detailed package for you.
Great. Good. John. Actually, maybe while Larry's still up there, unless you want to answer it, Mr. Vice President.
Go right ahead.
The President proposed to the GOP policy lunch today to remove the entire payroll tax from both employers and employees. That would be a 12.4% reduction. Back in 2010, we had a 2% reduction. Can you basically eliminate, for however number of months, the payroll tax without blowing a huge hole in the budget? And furthermore, the President told the lunch he'd like to make that cut permanent. How do you do that?
You know, the payroll tax holiday is a bold move. It's a very bold move. And this has always been a bold president. And we've been cutting taxes and rolling back regulations and changing trade deals and opening up the energy sector and doing things that nobody thought we could do before, John. We've had pretty good economic results for it. We're in a challenge period now. I get that. So with respect to your question on the specifics, I think there'll be a big growth payoff. I think it'll help deal with whatever challenges occur in the next few months. I think beyond that, ameliorating the tax burden on the middle class, the so-called blue-collar boom that I talk quite a bit about, that's what this is aimed for. That's really what the payroll tax is principally about. By lifting the burdens of those middle-class folks, I think we're going to get a big growth kicker. We've had a terrifically strong labor market, as you know. It may stall a bit or not. I'm just speculating on the challenges on the health side. But I think over time, we'll make it up with much better economic growth. And I will remind also that later on, way down the road, probably later this summer, early fall, we will unveil another package of tax cut and tax reform proposals. But yeah, it's a bold proposal, and this is a bold president, and I think it's paid off.
If you were to make it permanent, can you backfill from general revenue to make up for, I mean, in fiscal year 21, Social Security, unemployment insurance, and Medicare Part A revenues are $1.23 trillion. Can you find that money somewhere else?
I just say we're not talking about Medicare at this point. I'm going to, by the way, the answer is yes, you can backfill it. And that has been done before because we've had other payroll tax cuts, and you mentioned one of them in 2010 or 2011. So the answer to that is yes, and the answer is we will always maintain a solvent Social Security system. But, you know, tax reform is very important. Economic growth is very important. Incentives for middle and lower income workers are very important. And I will just add, you know, in terms of the boldness of this president's policies, despite what some of our critics think, actually it's the middle and lower middle people that have done the best in wage growth terms. And I think this is absolutely consistent. This lifts tax burdens on the middle class. I think it's absolutely consistent with his earlier policies.
And let me also say, John, if I can, that the other piece of this is what the doctors have said to us, what the experts have said is if you're sick, if you have reason to suspect that you may have coronavirus, we want you to stay home. And the president's absolutely adamant, working with the Congress or using his executive authority, to ensure that hourly workers, people working for small or medium-sized businesses that don't currently have paid family leave, will be able to stay home and be confident that they're not losing a paycheck. I think every American can identify with that concern, and we're going to work forward, whether we do it legislatively or the president has some resources in his executive authority to act. We're going to work to make sure that hourly workers don't feel like you have to go to work sick because you're risking a paycheck. Get home, stay home, take those couple of weeks to get better. Eamon.
Thank you, Mr. Vice President. I want to drill down on something that Larry just said, though, because in 2018, according to the Center for Budget and Policy Priorities, federal payroll taxes generated $1.17 trillion, which is an enormous figure. And Larry, you're suggesting that you can make that up from general revenue. Where are you going to get $1 trillion from?
You know, let us put the proposal out in concrete details and flesh that out, and we'll have much better answers. Right now, I want to stay in my lane, and I think the health story, the coronavirus story, is very, very important here. We will do the best we can, Eamon, to give you specific plans and details once we flesh them out.
Yes, please.
About the increased testing capacity. We're still seeing reports of severe rationing in many cases because of the limited supply. It appears to be close to impossible for average Americans to get tested without being hospitalized first. So when can the American people expect to see these test kits available at doctors' offices, at urgent care, at minute clinics, that sort of thing? Specifically when?
Well, I'm going to have the Secretary step forward and address that. But let me say we've made great progress over the last week. 1 million tests are in the field. Every state lab in America can do coronavirus tests. If you're concerned that you have coronavirus, your doctor can contact the state lab, can have a test processed. By the end of this week, another 4 million tests will be distributed. But to your very important question, we're working day by day with the largest commercial labs in America. We had some good discussions today with outside experts as well, who said that when the president brought the commercial labs in, he did exactly the right thing, because it's those big companies that have logistics infrastructure all over the country, have labs all over the country, that can distribute the tests, process the tests, whether it's Quest or whether it's LabCorp. And we believe that in the days and weeks ahead, we're going to continue to see the availability of tests dramatically rise, and we're driving toward that every day. Mr. Secretary, did you want to add to that?
Sure, maybe Dr. Redfield can add in also. So by the end of this weekend, we had 1.1 million tests that were actually shipped. We have another 1 million that are either in transit or waiting for orders. So we actually have a surplus capacity already of tests that have been produced. And as the Vice President said, by the end of this week, be another 4 million tests. So the tests are out there. The tests are in every public health lab in the country. They're in hospitals. They're in labs. But I think there's a false premise in your question, which is the notion that just because I, as a person, say, oh, I'd like to be tested for the novel coronavirus, I should be going to a minute clinic or some other facility and just walking and saying, give me my test, please. That's not how diagnostic testing works in the United States, or frankly almost anywhere in the world.
Trump said on Friday, said anyone who wants to get tested can get tested.
If their doctor, we've always been clear, if their doctor or public health physician believes they should be tested, it needs to always be clinically indicated to receive a test. So it's a false premise. Go to your doctor if you first, actually don't go to your doctor. Call your doctor's office if you believe you may have the novel coronavirus. Call the clinic, call the hospital, call the doctor's office, so that you don't just walk right in, follow their infection control procedures for doing that, and then they will decide, working with you, whether a test is appropriate to be done. But there are millions of tests out there now, and it's going to, as the Vice President said, with Quest and LabCorp getting it at the doctor's office, swabbing their distribution and transport system, it's going to be an even better, closer to the patient experience, as I talked to you on Saturday when we met together.
That's very good. And answer, I'm going to ask Dr. Birx to speak to this too, because she's just done a tremendous job bringing our commercial labs to bear on this. But to your other point, the president directed us to essentially change the criteria that CDC was giving labs around the country. We heard from governors around the country that people that were only mildly symptomatic were being told that they couldn't be tested. We changed that. We changed that description. And so, as the president said, anyone who on a doctor's order wants to be tested can, at a doctor's indication, be tested now. We're working to fill that need, and we're making great progress every single day. But I wanted Dr. Birx to speak to it as well.
Yeah, I just wanted to talk to you briefly about what happened in decreasing barriers. I've been a lab person, I've been a vaccine developer, I've been a doctor, I've been all those things, but I've never in my lifetime of government service have worked with the CDC in a way that every time the state or local government calls and says, I have this barrier, I need a modification to the regulations. That has happened almost daily. And the reason we have commercial labs willing to step in immediately is because the FDA has created that ability and posted on their website, I don't know if you've been there, this unbelievable waiver system and the clear definitions where every single hospital, every single university can utilize this testing algorithm. And that's highly unusual, but it's also what's bringing the super large high throughput companies to the table. And I just this has been unique for me to be able to see this unbelievable dialogue between what states need, what local governments need, and federal government being responsive with changing those regulations. And that has been really wonderful to watch.
Thank you, Dr. Birx. Can I get you right here?
Yes, I wanted to ask, I guess the administration has really touted the success of the travel ban on China and Iran. Why has it not extended those bans to South Korea or Japan or Italy? And is it still under consideration, or has the administration really shifted to mitigation from containment?
Well, I'm going to let Dr. Birx speak to that in a moment. But there is no question, as Dr. Fauci said just a few days ago, we would be in a very different place if President Trump had not suspended all travel from China. And we would also, I suspect, be in a very different place if we hadn't issued travel advisories for portions of Italy, portions of South Korea, and initiated screening of all passengers on all direct flights into the United States from both of those countries. I will tell you, we had a very thorough discussion today of the prospect of recommending to the President additional travel advisories. What we're doing, particularly as Dr. Fauci said, is we're following the facts, and we're going to bring those recommendations forward in the time and manner that we, as the White House Coronavirus Task Force, determine are appropriate. But let me tell you, it is literally a day-to-day consideration, and we're going to continue to put the health and safety of America first. Dr. Birx, did you want to amplify that? Or
I think that was perfectly said.
Dr. Fauci, did you want to say?
Thank you. Tom Bossert, who used to be a part of this administration, had an op-ed where he basically said that the U.S. has 10 days before hospitals could be overrun. He recommended that schools be shut down for maybe 8 weeks. What does the administration think about that? Does it agree that the U.S. could be at the point where there could be a turning point in the next 10 days or so? And what about keeping schools open? Should they be kept open?
Well, let me say the recommendations that you have and that every American now has at coronavirus.gov apply to every jurisdiction in the country, every state and every community, irrespective of whether or not there's been a coronavirus case established. I will tell you that we're working very closely with California, Washington, New York, Florida, to develop community-specific recommendations for those areas where we have had what is known as community spread, a number of coronavirus cases that appear that it's being transmitted in the community. In the next 24 hours, working with those states, we'll be publishing CDC's recommendations for what ought to be done. But I want to turn it over to Dr. Fauci to tell you that we really think the most important thing here is that we continue to bring the facts forward to the American people, and that our proposals and our recommendations, well, all of these apply to everybody in the United States, and it'll help reduce the infection rate of the coronavirus. That for those communities that are being impacted, we're going to develop specific recommendations that'll make the most sense for them. Dr. Fauci?
Thank you. And Dr. Fauci, can you say can you wait until there's community spread to make some of these decisions?
Well, it depends on the degree of community spread. I mean, community spread could be just a small amount, or you could start to see multiple generations. But getting to your individual question, that everything is on the table for consideration. So the idea that we're not closing I think for the country right now to say we're going to close all the schools in the country, I don't think would be appropriate. Would school closures be appropriate depending upon not whether you have already the horses out of the barn, but when you start to see we're getting a little bit danger here, so let's do it. So it's incorrect to say now everything has happened bad, let's close the school, and it's incorrect to say let's just blanket close the schools in the entire country tonight. I don't think that would be appropriate, but I do think it would be appropriate to carefully try and do things like closing, but there's other things besides closing, to do real mitigation sometime before you think you really need it. That gets back to what I said a few moments ago about where the puck is going to be. But you want to make sure you're not so far ahead that you overshoot.
Great.
All right, thanks, guys.
Just real quick, should the president stop shaking hands with people? He just did it at the Medal of Freedom ceremony a few moments ago. On this sign up here, it says you should stop handshaking if you're at your workplace, in your school, or in commercial establishments. Should the president set that example? I notice you've been opting for the elbow bump.
I've been shaking hands too.
What do you make of that? Is that necessary, do you think, at this point?
Well, look, as the president has said, in our line of work, you shake hands when someone wants to shake your hand, and I expect the president will continue to do that. I'll continue to do it. What this is a broad recommendation for Americans, but a really good recommendation is to wash your hands often. And all the experts tell me that while people want to get the various sanitizing lotions, washing your hands with hot soap and water for 20 seconds is just as good as any lotion you can buy. So how about right there? How about one or two more?
Is it a plan to coordinate a response with other countries?
I'm sorry, say again?
Is it a plan to coordinate a response with other countries in the continent? President Trump met President from Brazil, Bolsonaro, this weekend. Did they talk about coronavirus?
I know that they spoke about a broad range of issues, and I'm confident the coronavirus was discussed. What I can tell you is that our focus is on the health and well-being of the American people. We're going to continue to communicate with nations across this hemisphere and across the country. But what the president's given us as a mission of the White House Coronavirus Task Force is to see to the health and well-being of the American people, and we'll continue to make recommendations to do just that. How about one more?
Thank you, Mr. Vice President. Two questions. One, on Washington State, they made a request of a strategic stockpile for, they said, 233,000 masks, and they received half of that. I'm wondering if that report is inaccurate, please speak to it. And secondly, on cruise lines, are you looking at a bailout for cruise lines? Several of these companies are tax exempt.
So they got half of the shipment from the Strategic National Stockpile initially, and then when the Vice President actually went out to the state of Washington, that's when the second half of the shipment arrived. But I have spoken directly with Governor Inslee, with whom we've had a superb working relationship, and he has informed me that there are some additional personal protective equipment needs that a couple of their hospitals have, and we're working through the Strategic National Stockpile to make sure we are directing and fulfilling shipments to them as needed.
I want to echo again our gratitude to Governor Inslee and all the health officials the state of Washington. I was there last week. Our teams are working very closely together. We'll follow up on that public report, but the Secretary's indicated. But look, we're, as I said, in the next 24 hours, we'll be working with not only Washington State, but California, with New York, with Florida, and unveiling our recommendations, CDC's recommendations, to those areas that have been impacted by community spread. And then we'll continue to come alongside those communities to do everything in our power to mitigate the spread. But let me just say again, as a resource, thank you all. We'll be back here again tomorrow. Coronavirus.gov, practical information for every American, details for state labs that may yet have questions about performing their own tests. We have specifics, enzymes, agents, ingredients that where they can be acquired and how for the performance of coronavirus tests. But for every American, I just want to say again, remember the risk to the average American of contracting the coronavirus remains low. But however, the risk to senior citizens with serious underlying chronic health conditions is very significant, and it's important for all of us to continue to take all the steps necessary to look after the most vulnerable, to look after our health, and I'm confident that we'll get through this together. Thank you.
Okay, that was Vice President Pence and the coronavirus task force, leaders in the health and business communities within the administration, talking about the steps that are being taken to help protect Americans from the pandemic of coronavirus. We heard a lot of information there. There is a website, coronavirus.gov. That we have been told by the Vice President to check out for more information. You heard the Surgeon General talk about the importance of knowing your risk. If you are immunocompromised or have a chronic medical condition or are over 60, you are at higher risk for coronavirus, COVID-19 than others. Know your circumstance, whether or not you should be in a crowd, whether or not there are any cases of coronavirus in your community, and knowing what you can do to stay safe in terms of social distancing, in terms of washing your hands. Let's talk about everything we just heard with our panel here, and let's start with you, Dr. Sanjay Gupta. President Trump was up on Capitol Hill earlier today talking about how everything was going to be okay. And it was just on February 27th, not even 2 weeks ago, that he said we had 15 cases and it's going to go down to 0. Not exactly what we heard from the task force today, armed with actual facts.
Yeah, no, I think there's a distinct change in how they're sort of describing this now. And I wrote this down because Dr. Fauci said this, and I think it's really important. Doesn't matter if you live in a state that has no cases or just even a single case, whatever, you have to take this seriously because the cases are coming. Now, obviously, when you hear it from someone like Dr. Fauci, it takes on an added gravitas, but I think this idea that we've known for some time that the cases were going to spread within communities, and that we haven't had clear vision on this because of the lack of testing. He believes that those cases are there. So people have used this word containment a lot, and we can still try and contain this within certain communities, just like you try and contain flu within certain communities. But for the most part, the United States seems like is now moving towards mitigation, which is accepting that the cases are there, trying to decrease the spread as much as possible.
And Dr. Murthy, we heard the idea today that there are going to be, by the end of this week, 4 million testing kits on their way to healthcare providers around the country. But what we didn't hear there, which we know from reporting, is that it is a big question as to whether or not there are the labs to do that testing. We know, for example, firefighters, first responders in Washington State, which is where the first and worst cluster was, are now in quarantine and being retested because 7 firefighters there were tested, had their lab results sent to the lab, or had their swabs sent to the lab, and then they weren't tested soon enough. And they now have to be retested and quarantined. That's where the bottleneck is right now.
Yeah, so making sure that we have adequate testing capacity is an extremely high priority. Without it, we're just flying blind, not knowing how many cases we're really dealing with. And getting to that capacity means that we don't have to just ship out the cases, but we got to make sure that they get to where they're needed in sufficient capacity. And we're finding that this is a process that takes time, which is why as we think about how we need to deal with this in the future, we have to make sure that we have the ability to produce testing capacity and deliver it to the places that's needed much, much faster. And other countries have done this. They've shown us that it's possible. We should be able to do that as well. There is one other point that came up in this conference that I think is worth mentioning, which is the stresses that will be placed on hospital systems as a result of the coronavirus outbreak. Now, what we're already seeing during flu season is that many hospitals are stretched to the limit. Their ICU beds are full. Their beds on their main floors are full. Their staffing is also is stretched to its limit. And what we have to ask ourselves is what will happen as the number of coronavirus cases increases. Now, we're going to see even more pressure on hospitals that are going to impact and show up in three big ways: a lack of space, a lack of people, and a lack of equipment. Already, we're hearing from hospitals that don't have enough masks and gloves, where ventilators are running short. So part of what we have to think about as a country, knowing that this is coming, is how do we make sure that those hospital systems are supported in terms of resources, and also that we have a plan to help support the workforce as people get sick.
And something else we heard talked about in there in that press conference was the question about whether the Trump-Pence campaign will continue to hold rallies, given the fact that all these doctors and medical professionals are saying avoid large crowds. Bernie Sanders canceled a rally in Ohio today. Joe Biden canceled a rally in Ohio today. Sports events are being canceled. Concerts are being canceled. The idea of being in a room with more than a dozen people is being frowned upon. And the response was they're thinking about it on a day-to-day basis, but they have not canceled anything.
That's right. That was his response. And as he was talking, I was communicating with a Trump campaign source who said that what CNN had previously reported is still going to happen, meaning we do expect a Trump campaign rally to be announced this evening. We don't know where, we don't know exactly when, how soon, but the announcement is still going forward. This is coming from the candidate. I mean, the president, you kind of started out this conversation reminding us what he said today, what he said all along. He is desperate for things to go on as usual, as much as possible, and this is something he can control. It's his campaign.
Dr. Fauci just said we cannot live our lives the way we were living them a few weeks ago. I mean, this is not what we're supposed to do.
Yeah. Well, that might be, but the president right now wants his campaign to continue on with the plans that it has.
There does seem to be this message, Sanjay, and I know you don't like to get political, but there does seem to be this message from the president that everything's okay. Right. He wants things to be okay, and therefore he has been downplaying the risks of this. Meanwhile, Vice President Pence, Dr. Fauci, others in his administration are being very clear-eyed about what's going on.
Yeah, I mean, there is a definite cognitive dissonance, and I think it's really interesting when you hear how they answer some of these questions. And again, Dr. Fauci, he's a doctor, he's a scientist, so he doesn't like to be political either, I imagine, but he was asked about the campaign events, and I wrote this down as well. He said, if someone canceled a campaign event, I would not criticize them. That's probably as close as he gets to saying what he's trying to say here.
Well, he's trying to keep his job at the same time, because if you say things that the president dislikes, you could get fired specifically. And I mean, I think a lot of people would want Dr. Fauci to stay in that job.
Absolutely.
And then, of course, there's the question about schools. Should there be schools closed? People are worried. Kids are not really affected by this in terms of mortality, but they certainly can get it. And you heard Dr. Fauci say there should be no blanket rule. It's really up to the school district.
That's exactly right. We have to make decisions based on what's happening in a particular community. If we find, for example, that there is a lot of local spread in a community, then we may need to take more aggressive action there. But what matters is not just the number of cases, it's where those cases are, how fast they're growing, and whether the contacts of the people who are infected are able to be contained. So there are a number of factors that go into deciding how aggressive to be. We've already seen some localities in the United States have made the decision to close schools for a short period of time. And I think that's appropriate. But it's worth coming back to the point that in order to make these decisions, communities need to know how many cases they have. And without adequate testing capacity, they can't make those decisions nearly as well.
A really good idea, maybe not necessarily canceling school, but canceling Grandparents' Day. That's what happened at my kids' school. They still have school, but they cancel Grandparents' Day because you don't want the most vulnerable people, not the kids, but the grandparents to be affected.
Yeah, I mean, and we do know. We do know who the most vulnerable people are, and they are the elderly, so everything and anyone can possibly be spreading the virus to them. I think the school thing is going to be really interesting, and obviously Dr. Murthy and I have been talking about this, but most of the modeling as to why schools should be closed and the benefit of doing so is based on the flu. And this is a different virus.
With the flu, there's a higher mortality rate for the flu with kids than
That's right.
coronavirus with kids.
But is it accurate that maybe, as you said, that there's not a high mortality rate among children, but they can carry it?
They can carry it. There's not a high mortality, and they can carry it, but their carrying it seems to be a smaller driver of spread. It can happen, but to sort of base these large policies on that idea, we'll have to see. I mean, this is a novel coronavirus, so we have to learn this as we go along. But it's a big decision to close these massive schools and colleges, and I'm not sure that we have proven the reward of that yet versus the risks.
Sanjay, what should we be calling this? I mean, it's been called everything from the Wuhan virus to coronavirus. Coronavirus, as you know better than I, is more of a widespread term.
It's
I think
family of viruses.
Yeah, MERS was a coronavirus.
And SARS was.
People call it a novel coronavirus. Should we just be calling this COVID-19?
Perhaps, we made a decision to call it novel coronavirus here because that's what we started calling it. COVID-19 we felt was a little too clinical, and people sort of understood that, but the novel in front of it is definitely important.
All right, thanks so much. Coming up next, our first exit polls of the night, the first hints about what voters are thinking about in the 6 states holding Democratic contests tonight. We're going to take a quick break. We'll be right back.
Welcome back. We're a little bit more than an hour away from the first poll results actually coming in on this Super Tuesday round 2, but we are getting some fascinating information from the exit polls. David Chalian is joining us right now. David, what are we learning?
Wolf, in one of the states voting today, Washington State, where the coronavirus outbreak has been pronounced, we actually asked voters in Washington State what their concerns were. What level of concern did they have about the effects of coronavirus? Take a look at this in Washington State. 38% of the electorate very concerned. I will note among senior citizens, that goes up to a majority. 51% of seniors very concerned. Under 45, it's down at 20%. Add in the 44% somewhat concerned, you get to 82%. More than 8 in 10 voters in Washington are very or somewhat concerned about the effects of coronavirus. Now, I also want to take you through this question that we asked voters in several states today about who do you trust to handle a major crisis? Take a look here. This is a strong Joe Biden category. In Washington State, 46% say Biden, 27% say Sanders. That's a 19-point gap there for Joe Biden on handling a major crisis. Take a look in Michigan. You're going to see similar numbers here across the board. Look at this. A majority of Michigan voters, election day voters in Michigan, those showing up the polls today, 51% say Biden is who they trust to handle a major crisis, 32% Sanders. And then take a look in Missouri. This is the widest gap we've seen on this question. 61% of voters in Missouri trust Joe Biden to handle a major crisis. 27% Sanders. With all that's going on right now, Anderson, this is clearly a Biden strength. I think we should watch him to try to press that advantage going forward in this campaign.
Yeah, David Chalian, thanks very much. Unclear how the coronavirus is going to play into ultimately election results months from now. Michael Smerconish, what do you make of what we're seeing so far?
So big night ahead. Already the Biden campaign and the Sanders campaign have canceled the rallies for tonight. And the way in which we're interpreting that is that wisely, out of concern for the communities, best to not move forward. I'm mindful of the fact that the president is 73, Vice President Biden is 77, Bernie Sanders is 78. You've heard the administration speak to going to coronavirus.gov, which I've done. When you go there, what you're told is that older adults should stay close to home. In lay language, that's what they say. So when does this become a conversation about, hey, what's the president going to do to protect himself? What's Bernie Sanders going to do to protect himself? Same with Joe Biden. Is it really wise for them to engage in any of the kind of retail politicking that we've come to expect? That'll be a very interesting issue to watch.
Also, I mean, if there are no large rallies, I don't know what kind of an impact that actually has on an election, do you?
Well, I think it obviously is a detriment to Bernie Sanders, who is capable of bringing out really large crowds. That's where the momentum narratives come from. That's where we see those great images of all of the younger people out there rooting for him. I think it certainly probably cuts more against him than Biden, who has struggled to get those crowds, although clearly not to get the respect of people who think.
But does it turn out more vote? I mean, because obviously, the young people that they expected to come out have not necessarily come out.
Right. Yeah, and there's a chance that it doesn't actually affect the vote. I think we had a complete unintended consequence of moving from a caucus to a primary state in Washington this year, where they did a complete mail-in ballot. We have no idea what would have happened on Election Day in Washington state, given what they're dealing with, had they not done that. So add another one in the pro column for moving from caucuses to primaries and for making it easier to vote by voting via mail. We're experiencing a complete dereliction of leadership from the president right now. We can't trust the things he says. His own administration contradicts him. There's a moment when propaganda runs up against reality, and that moment is usually a major crisis. So either one of these men, either Biden or Bernie or both, have the opportunity to step in and be the reality-based voice in the room at this point. And it looks like with both of them canceling their rallies, they understand that, and that's where they're going.
We've got to get a quick break, and we're going to come right back to our folks here. Coming up, we'll dive deeper into our exit polls. How are Democrats feeling about President Trump in Michigan, the state that helped him seal his win in 2016? We'll find out next.
We're only an hour and 10 minutes away from the first polls closing on this Super Tuesday, round 2. 6 states holding Democratic presidential contests. David Chalian is getting more information, intriguing information from our exit polls. What are you learning there?
That's right. Well, we're taking a look at the Trump factor in 2 critical states tonight, Michigan and Washington. We asked voters this question we've been asking all cycle long. What are you looking for in your candidate that you're voting for tonight? Somebody who can beat Donald Trump. 57% of Democratic primary voters, Election Day voters, that's what this exit poll is about, Election Day voters in Michigan said they could beat Trump. 38% say somebody that agrees with you on the issues. Look in Washington state, you see a similar divide, even a bigger one here. 69% of voters in the Washington Democratic primary are looking for a Trump defeater. Only 29% are looking for somebody who agrees with them on the issues. We also asked about feelings about the Trump administration among these Democratic primary voters. In Michigan, the angry number, 63% of Election Day voters in Michigan say they are angry when they are asked about their feelings about the Trump administration. And in Washington, that number jumps 20 points. Take a look. In Washington state, Democratic primary voters there, 83% of them are angry when asked about their feelings about the Trump administration. Anderson?
David Chalian, thanks very much with the exit polls. Mayor Landrieu, I mean, can you even assess at this point? I mean, we can't assess what the impact of coronavirus is going to be on anything. We can't assess really what it is going to be on this race for.
Well, a couple of things. I think Tony Fauci told you everything you needed to know. He is the foremost expert on this kind of thing in the world. And he basically said, we need to go where we think the puck's going to be, right. Which is to say his expectation is it's going to get worse.
Right. If it's not in your community, it's coming.
And even though 80% of the people are going to be fine, to him, the 20% is a significant number. So he said, get ready. The president's message seems to be, don't worry about it. It's going to go away when it gets warm. And just the juxtaposition of those two messages, I thought the press conference was really good. I thought the vice president and his team handled it well. But what was not said is really the most important thing. So I would think, again, this is not a time to panic. It is absolutely a time to be prepared. It is absolutely a time to lean forward. And by the way, everybody can't get a test when they want it. That's not accurate because that test has not gotten down to the ground yet. And so I think here there's more to come. And I do think the rest of the campaign will be seen through the prism of what impact the coronavirus has on the economic system, what it has on the debt and the deficit, what it has on the healthcare system, because it will stress the system, and we'll be able to see it more clearly like a magnifying glass, like we did in New Orleans after Katrina.
It also brings in, I'm sorry, I was just going to say, I love where Mitch was going. It also brings into focus the leadership question, which, you know, hard to speak about it. In many ways, it's like, I can tell you when I see it. I know it when I see it. And right now, people don't see it nationally. And so those early returns that we saw come in earlier around this question of who do you trust in a time of leadership, these candidates, and I mean both of them, right now have an opportunity to step into a void that exists nationally under the Trump administration to say, look, in these moments, in these times, you want a calm, a soothing, a reassuring, and a fact-based voice that doesn't send us into hysteria, but levels with us at a very honest level, gives us information about what we can do. And what they did today was they put the experts first and foremost. and allowed them to build their credibility with the American people. And I think that is going to have a huge opportunity for turning point as we move forward in this race.
If it gets to a situation of hospitals overwhelmed, as the former one of the Homeland Security officials formerly from the Trump administration has indicated that it could very easily get there quite quickly, just as you said with Katrina, who in leadership is a hustler and what they say isn't true and who is actually telling the truth, that becomes much more important and much clearer, to your point, in an emergency when life and death is actually hanging in the balance.
That's right. You can't spin biology. And you look at the doubling time of this virus, you're talking about 6 days between when you start with 1 case to 2, 1,000 to 2,000. And so this is coming. I will say that I think campaigns have started to really focus on this, whether it be their operations and thinking about how do you push a digital-focused campaign, which you can do with the internet, but also in terms of showing leadership. Senator Sanders held a roundtable on this issue just yesterday, bringing together a group, and I'll admit I was on that roundtable, to talk about specifically the science. And I'll say, his directive to us was speak to the science. What would competent leadership look like? And I also want to just make sure we all understand this. We draw this false dichotomy between politics and public health, as if this dealing with science and focusing science and bringing science to the fore isn't a matter of politics, right? There are politicians who choose to do that, and there are politicians who choose not to. And so we've got a responsibility to understand where politics does meet public health and have a thoughtful, coherent conversation that admits that public health can be political and at the same time drives the science forward and demands our leaders pay attention to it.
We're closing in on the first poll closings of the night. Our first chance to project winners. Our special coverage continues right after this.
It's another pivotal night in the Democratic presidential race. Take a look at this. These are live pictures coming in from Washington State, where election officials are processing mail-in ballots right now. Notice they're all wearing gloves. We're back here in the CNN Election Center on this second Super Tuesday. I'm Wolf Blitzer reporting. We're about an hour or so away from the first votes and our first chance to project winners. The Democrats now deciding if Joe Biden or Bernie Sanders will be the nominee who takes on President Trump after Biden's big comeback last week shrank the field. 6 states are holding contests right now. We're also awaiting results from Democrats voting abroad. Starts getting busy very, very soon. At 8 p.m. Eastern, voting ends in Mississippi, Missouri, and North Dakota. An hour later, the last polling places close in Michigan. That's the most delegate-rich state tonight. At 11 Eastern, all voting ends in Washington State and Idaho. 365 of the delegates needed to win the nomination are up for grabs tonight. Jake, after tonight, nearly half of the delegates will have been awarded.
That's right, Wolf. And as we wait for those first actual votes to come in, let's look at the challenge facing Joe Biden and Bernie Sanders. 1,991 delegates are needed to clinch the nomination. To date, according to CNN's count, Biden is ahead of Sanders by 77 delegates. Now, those numbers could change dramatically tonight. It depends in a large part on who wins the big prize of Michigan and how that state's 125 delegates are divided between Biden and Sanders. The former vice president is eager to build on his victories last week and potentially deliver a knockout punch. Sanders is hoping Michigan, where he scored an upset victory over Hillary Clinton 4 years ago, will be his firewall. Our correspondents are covering it all from the first votes to the final results. Let's check in first with Jessica Dean. She's with the Joe Biden campaign in Cleveland, Ohio. Jessica, there was supposed to be a big rally for Joe Biden in Ohio this evening. Not so much anymore.
Yeah, it's pretty much me, myself, and I here, Jake. Not anybody, no supporters here because they have canceled Biden's event in Cleveland out of an abundance of caution. They said over coronavirus fears. They don't want anyone getting sick. So Joe Biden and his team now headed to Philadelphia. That's where his campaign headquarters is located. And we are hearing that he will speak in Philadelphia later tonight. In the meantime, taking kind of a wider look at tonight and what it means for the Biden campaign, what their expectations are. One campaign advisor tells me that the question for them tonight is, can Bernie Sanders prove he's still a viable candidate? That's what they said they're looking at tonight. That's what they say that he has to prove, and that they think everyone else should be looking at that as well. So that's one thing that the Biden campaign is keeping an eye on. Here in Michigan, you guys mentioned how delegate-rich Michigan is. It's the big prize tonight. The Biden campaign telling me that they expect it to be very close. And what's interesting about that is that a Monmouth poll came out yesterday showing Biden with a double-digit lead over Bernie Sanders. But a Biden advisor telling me, look, they remember what happened back in 2016 when polls had Hillary Clinton up by double digits, and Bernie Sanders went ahead and won pretty narrowly here, but won the Michigan primary. They're very aware of that, Jake. They don't want that mistake to repeat itself. So again, they're saying, look, despite the endorsements they've gotten here from the governor, the lieutenant governor, from Kamala Harris, from Cory Booker, they still expect Michigan to be pretty close tonight.
All right, Jessica Dean with the Biden campaign in Cleveland, Ohio. Also in Cleveland is Abby Phillip with the Sanders campaign. In a similar situation for you, Abby, you were supposed to be covering a rally this evening, also not happening.
It was supposed to be a pretty large rally for Bernie Sanders. About 5,000 people had RSVP'd for this event, and now it's just an empty room that they were breaking down just a few minutes ago when we were down the street. Now, the Sanders campaign says that after hearing from Ohio public health officials, they determined it, out of an abundance of caution, they needed to cancel this event. It would have been a large indoor rally, thousands of people expected, and Senator Sanders himself was the person who ultimately made that final decision. Outside of that event, I spoke to a couple of his supporters who had gathered there expecting to go in. Some of them said they were disappointed, but they were going to go and do canvas shifts instead. And for the Sanders campaign, this is a pretty big deal. His large rallies are a staple of his campaign. It is how he gathers people to go out and become volunteers. It's a major get out the vote operation for his young supporter base. And so as we look forward, there's a real question about how they're going to evaluate these events going forward. And in the meantime, tonight, Bernie Sanders is actually headed back to Burlington, Vermont, to his home, where he'll be tonight and for the next several days, based on what we know right now. Aides in the campaign are telling me they believe tonight they still have a fighting chance, although one aide acknowledged to me that Michigan is going to be an uphill battle. 4 years ago, he narrowly pulled out a victory, but they are expecting an uphill battle, though, as Jessica pointed out, the Sanders campaign also believes this race will be closer than some of the public polling has suggested, Jake.
All right, Abby Phillip, also with the Sanders campaign in Cleveland, Ohio. Let's go now to Renton, Washington, outside Seattle, where we find our Sarah Seidner. And Sarah, I can't help but notice that a lot of the election workers behind you are wearing plastic gloves. Of course, Seattle and the surrounding area, really a large cluster of coronavirus cases there. I imagine that is out of an abundance of caution.
Absolutely. It's actually mandatory, Jake. I'll let you take a look at those folks who are going through and sorting these ballots, taking the ballots out, for example, of their sleeves. This is basically the area where people become anonymous. They take those sleeves off that have the signatures on them, and then these ballots move on to a different room. I want to give you some idea of what the turnout is like already. I do want to also show you, Jake, right over here, you'll see a little shelf, and all of that is gloves and things for your fingers, just to make sure that people are safe, hand sanitizer and wipes as well. But again, in King County, it is mandatory to wear gloves now, and that is because there is concern that there could potentially be some contagion from people licking their envelopes. Giving you an idea of this room, this is how many of the ballots have been processed in this room alone, 395,248. We have talked to election officials here, and they have told us, Jake, that this is so far a bigger turnout than 2016. 2016 was about 33%. They're now about 40% of the eligible voters are voting in this particular election. So it gives you some idea of the importance of this election and the importance in people's mind. Another room, this is where they check to see if the signatures are valid. If there's any issue, they will come in and they will look at these and they will check them on the computer. And just want to take you to a room. This has helped save people from having to deal with real worry about opening those ballots, because back here they've got this incredible sorting machine, and the sorting machine actually opens the ballot, so it slits it open so that people don't have to actually undo the part where people may have licked the ballot. And by the way, the Washington State Secretary has told us we are telling people and tweeting out to people that you should not lick your ballots. If you're dropping them off, you should use a wet cloth to do it or a sponge. But this is the machine where they do the sorting, and you'll see it. It starts going every time they get a large number of ballots, and they put them in there. And then you see the election workers there. Every single person here that are touching ballots have gloves on. Every single person, and that is because it is now mandatory in King County. This is where the largest number of voters are in Washington. Jake?
Sarah, that was an incredible live shot. I thought you were going to hop on a ferry and take us to Puget Sound. Thanks so much. Appreciate it.
I was trying to get it done fast for you.
It was fantastic. Hey. Thank you so much. I appreciate it very much. Let's go to David Chalian now, who has some exit polls.
Jake, we're taking a look at the racial and ideological makeup of some of the electorates voting today. I'll look here first in Missouri. Take a look among the Democrats voting in the primary today. The electorate is 78% white. That's up from 72% just 4 years ago. I'll more on that in a moment. 17% black, 3% Hispanic. We are seeing across so many states the electorate's a little bit whiter than they were 4 years ago, in large part because there's no competitive contest on the Republican side, and some of those folks are able to come on over and vote in the Democratic primary. Take a look in Mississippi. We see something similar in the racial breakdown. Today in Mississippi, the Democratic primary electorate is 31% white. That was 24% 4 years ago. So again, a whiter electorate, 64% black, overwhelming 2/3 of this state. If Joe Biden has his advantage with African Americans today, we'll see when the votes come in, but that could be huge for him here. And 4% Hispanic. Ideologically, we're also seeing slightly more moderate electorates showing up. In Missouri, 24% call themselves very liberal, 36% somewhat liberal, but 33% moderate, 7% conservative. This 40% combined here, a bit more moderate of an electorate than 4 years ago. Same thing in Mississippi we're seeing ideologically. You see that quarter of the vote, 26% very liberal. But again, if you look down here, 44% moderate, 8% conservative. So combine that, 52%, a majority of the electorate in Mississippi today, more on the moderate conservative side, Jake.
All right, David Chalian, thanks so much. Let's chew over all this with Dana Bash. And so on face value, and again, who knows, right? Who knows? But on face value, you have a whiter electorate, which you would think would be better for Bernie Sanders, and you have a more moderate electorate, which you would think would be better for Joe Biden.
Right. So it's a mixed bag, but we have to keep in mind that on this and on some of the other exit polls that we've seen from the past, and even that we see mirrored today, the way that people say that they vote when it comes to issues don't always equal the candidate that makes sense. For example, on the question of privatizing health insurance, overwhelmingly the answer is yes in some of the states today, just like in the past, even in states where Joe Biden won and he says flatly, that's a terrible idea, and I would even veto that. But the question about African-American voters is interesting because Joe Biden did really well in the South. And one of the open things that we're looking at tonight is not just Missouri, but also Michigan, and whether or not that support among the African-American community will translate, since just because they supported him in the South doesn't mean that African-American voters in the Midwest have the same kind of interest in a candidate.
Yeah, that's right. And obviously, white working class voters are a base for both Sanders and Biden. They've really been fighting for them. Wolf Blitzer?
All right, Jake, thanks very much. Up next, we're going to do John King over at the Magic Wall. He's gaming out how the fight for delegates may play out tonight. We'll be right back. Polls are closing in 44 minutes. That'll be our first chance, potentially, to project a winner. John King is over here at the Magic Wall. So where do things stand right now?
So it's our second Super Tuesday. The big question tonight is 6 states, Washington, Idaho, North Dakota, Michigan, Mississippi, and Missouri. Can Joe Biden stretch this out? This is his current delegate lead. Or can Bernie Sanders, who got stunned on the first Super Tuesday, can he use the second Super Tuesday to narrow the gap, maybe even catch up? And so let's take a look at that from a delegate perspective. We'll come back and look at the states as we go through the evening. But let's look at where we are from a delegate perspective. Again, this is where we are right now, right? You count that up, 42 and 35. You know, that's the 77 vote lead, delegate lead right now for Joe Biden as we continue to count the delegates. I just want to go back in time to show you how dramatic this is. If you go back, This is where we were after February, the first 4 contests. Bernie Sanders actually had a slight lead after Iowa, New Hampshire, Nevada, and South Carolina. But then we had the Super Tuesday stunning performance by Joe Biden, wins 10 of the 14 states, pulls into a delegate lead. Now, we're still counting some delegates in some of those states that voted last week, but this is where we are tonight. Just imagine a scenario, right? Scenario number 1, this is a hypothetical. We're going to go through a couple. Scenario number 1, Joe Biden wins 60% of the delegates tonight. Wins in Mississippi, wins in Missouri, wins or splits evenly in Michigan, comes out with 60% of the delegates tonight. So let's take a look at that. What would happen? That would move Biden out to almost 150, essentially double his delegate lead from 70-something to just shy of 150 if he did that. That would be stunning. You'd say, oh, that's not that far apart. Democratic rules. You get it, if a candidate gets out that far ahead, as Hillary Clinton did 4 years ago, once she started to get ahead, it gets very hard to surmount it. What's the flip side of that? Does Senator Sanders surprise us tonight? Does he win Washington again, North Dakota, and Idaho like he did 4 years ago? Michigan surprise like he did 4 years ago? So let's say in a different scenario, what if Bernie Sanders won 60% tonight and Joe Biden got 40? 2 candidates in the race, so you'll see bigger swings in the delegates. If Sanders could get 60% tonight, he would essentially get back in the game, pull slightly ahead of Joe Biden. So that's what tonight is about. Delegates, delegates, delegates. Joe Biden has that lead. Let's go back to where we are. Come back here. This is where we start the night. The question for Joe Biden is, can he stretch it out? And for Senator Sanders, who got knocked back on his heels last week, Wolf, can he get back in the game?
And we will be getting not only the actual votes starting at the top of the hour, but we'll also be able to get a sense of the all-important delegate count.
Yes, and so you look in different ways as you come through it. Let's come back to the other map to take a peek at what we're looking for. One way you do it, and again, you can look at these congressional. I just want to pop this up as you look. Just want to show you what we're doing here. This is last week in California. They're still counting the votes in California. You get some delegates by the statewide totals. Bernie Sanders won statewide. The other delegates under Democratic rules are done based on congressional districts. So you see the different lines at play in here as you go through the delegates. So we're still a lot of delegates away. One of the interesting things in California in this delegate count, 2 days ago I looked at the map, Joe Biden was leading in only 1 California congressional district. Now it's up to 7. Doesn't mean a ton in terms of delegates in the sense that you see how close they are. But Biden was behind there. So that's one thing we're going to do. And then we're going to come to tonight, Wolf, and we're trying the biggest prize tonight is Michigan. You see Michigan pop up here. Let me get this, take this off and come back to the race here. You got 125 delegates just in Michigan. What are we looking for? Number 1, what have we seen in the rest of the country, right? The African-American vote. It has been absolutely essential to Joe Biden throughout the campaign. Dana talked a moment ago. It can be a little different up here in the Midwest and in the South, but Joe Biden wants to run it up, especially Wayne County. That is Detroit. Can he get big, high turnout, and can he get the majority of those votes, or will Sanders compete there? Over here in the Grand Rapids area as well, that's where you look for that vote to play out there. Another thing you look for in the state of Michigan, let's bring this out and close this off, and let's go back in time. I got to... Oops, get out of there. Thank you very much. Turn that off. Come back to the 2016 race in the state of Michigan, and you'll see what happened then. Let me turn this off the map. Secretary Clinton did run it up in Wayne County, but Bernie Sanders was competitive in other places, like Macomb County, blue-collar district, a lot of the auto industry out here, the so-called home of the Reagan Democrats. What is the fight in Macomb County? I'm going to watch this one, Wolf, very closely tonight in the sense that Bernie Sanders says he's the blue-collar candidate here, and if Joe Biden has been in there saying that can be him. Another place to go is over here, Oakland County, more of the suburban areas. This has been absolutely essential to Joe Biden. If we come back to this year's map and you look at the contest so far, what Joe Biden has been able to do is win the African-American vote in the urban areas, then win out in the suburban areas and run up the numbers, Wolf. That's what we're looking for tonight as we start to count votes. But 6 states to count. We'll have some fun.
Yeah, we certainly will be spending a lot of time with you over there, the Magic Wall. David Chalian, what are you looking for as far as the all-important delegate count tonight is concerned?
Well, you just heard John King run through some possible scenarios, sort of the what if the delegates fell a certain way. Let's take a look at what is. As John was just saying, you see here, if I just highlight the delegates, this is where we are. That's that 77 delegate lead right now in the overall count to date, the quest to 1,991. You see Biden with 635, Sanders with 558. Now look at this next column, Wolf. Here is what the percentage of delegates that they've won to date. So Joe Biden has won 49% of the delegates allocated to date, and Bernie Sanders has won 43.1%. That's what they've won. What do they need to win of the remaining delegates to get to 1,991? This is what they need. Joe Biden just needs barely over a majority of the rest of the delegates, 50.5%. Bernie Sanders needs substantially more. He's obviously behind. He needs 53.4% of the remaining delegates. And this is what I want you to compare those last two columns there. This is what they've been winning. They both actually need more than they've already won. So they both have to perform better than they already have to make sure they avoid a contested convention and somebody gets to that 1991. They both need to step up their game, but obviously Bernie Sanders needs to do so more than Joe Biden.
Well, we're getting closer and closer to the top of the hour when we get the first opportunity potentially to project what's going on. Just minutes from now, voting ends in Mississippi, Missouri, and North Dakota. Once again, we'll get the first results of the night, possibly project winners. We'll be right back. All right, we have an announcement to make about the upcoming Democratic presidential debate that will air right here on CNN. At the request of both campaigns and out of an abundance of caution, there will be no live audience at the Arizona debate taking place this coming Sunday, March 15th. The DNC has been in regular communication with local health officials and the mayor's office, which advised that we could proceed as planned. Nevertheless, our number one priority has been and will continue to be the safety of our staff, campaigns, Arizonans, and all of those involved in the debate. We will continue to remain in daily contact with all stakeholders through Sunday. The debate's Sunday night, 8 p.m. Eastern, right here on CNN. Let's go to David Chalian. He's got some more information about the exit polls we're getting. David?
That's right. Well, if we're taking a deeper dive in Michigan, as you've noted, it's the biggest delegate prize of the night, 125 delegates. What issue mattered most to voters showing up today, Election Day voters in Michigan? Take a look. What have we seen the entire cycle so far, this whole primary season? Healthcare, healthcare, healthcare. 45% of voters showing up in Michigan today to vote say that is the issue that mattered most. Further back, climate change with 20%, income inequality there at 18%, and race relations at 10%. How about this notion of, will you favor a government-run healthcare program instead of private insurance? Dana was just talking about this a little while ago. We're seeing it again here in Michigan. 57% of those participating today in the Michigan Democratic primary are in favor of Medicare for all over private insurance. 39% oppose the Medicare for All proposal. And then finally, the economic system in the United States. What do you think about it? Does it work well or not? Take a look here. 49% of those voting today in the Michigan Democratic primary say it needs a complete overhaul, not little tinkering. 39% say minor changes. Only 10% says works well as is. But nearly half the electorate says the U.S. economic system needs a complete overhaul, Anderson.
David Chalian, thanks very much. Gloria Borger, I mean, we have seen that now frequently from this electorate.
Yeah, Democrats want to fix health care. They wanted to fix health care when Barack Obama was president. They thought they had fixed it, but now they want to fix it again, update it, or do away with it. Do away with Obamacare and replace it with Medicare for all. I mean, this is a key issue, not only for Democrats, but it's a key issue for Republicans as well. So number one on the list. And I think, that's a clear difference between Bernie Sanders and Joe Biden.
It's also going to be interesting to see how coronavirus plays into this. Mitchell Andrew before in our last hour was saying how an event like this, just like with Katrina, tends to kind of expose what works and what doesn't work in the healthcare system. Yeah. And certainly it seems like coronavirus, could very well do that.
There's no doubt about it. Look, this has always been a question as to what would happen if there were a major crisis, given the way in which this president manages the government. And those of us who've been inside have seen what is required to deal with a crisis like this. But what's interesting relative to this race is it could cause people to put a greater premium on the ability to handle a crisis. David reported earlier that in these exit polls, Biden has a big advantage in that category. So, and there's another way in which, Anderson, the coronavirus may affect this race. It is now crowding out coverage of the campaign, so it's going to freeze this race where it is today. It's much harder if you're a challenger to break through if you're not at the top of the news every night. And quite properly, this isn't at the top of the news every night because this is a major national.
You also have back to that point, though, about Medicare for all, right? This is a moment where people are starting to stare down the barrel at the potential for a pandemic that affects a large proportion of this country, and they're asking, what does it mean for me? And the recognition that we have this porous healthcare system that relies on people paying a lot of money both upfront and then on the back end in a deductible when they get sick, it's not working for people. And so that kind of outcome in Michigan, 57% saying they want government health care, right? That's not splitting words. It's not using jargon like single payer. It's not Medicare for all where people can interpret it their own way. Government health care plan says a lot about what people are looking for in a moment where that insecurity of our current system is being laid plain.
And that's why Pence was talking about no copay on a coronavirus test. Is clearly the American public is thinking, okay, the American public wants to see something working for them, and if they've got to take a test, they don't want to be stuck with a copay.
Well, the other big issue with this coronavirus, for a second, though, is how it affects the economy. This is what the main stool that Donald Trump wants to run for re-election on. I've made your 401k better. Things are great. Well, we've just saw trillions of dollars lost from people's 401ks over the course of the last 10 days. People are panicked about their 401ks. Trump is losing the economic argument. He doesn't look like a leader. He's telling Americans, oh, don't worry, everything's going to be okay. And, you know, that's not how Americans feel today. I can tell you as a former governor, in a state you are very concerned. You rely on the federal government for information. We can't operate without the federal. We can't do it at the state level. And our individual health departments in our cities and counties, without leadership from the federal government, it is paralysis.
And this notion of being able to rely upon the government to actually make sure that there is a safety net, whether it's healthcare or on the economy, this pandemic potential and the stock market there's an echo of what happened during the Great Recession, right? Everybody was in a panic. Government, including the Obama administration, had to step in to stem the tide. And I think that's why you're seeing the numbers in these exit polls about people being confident in Joe Biden, because he was part of an administration that really did save the country from free fall.
I think if you're Trump, you want this election to be about the economy and not about health care. And now it's just going to be about both, but in a negative direction. But, underneath the politics at the top, you got a lot of fear at the bottom. And I think Democrats need to step up for some of the populations that have not been talked about yet. If you're incarcerated, you are terrified because you got people who are behind bars right now who are just waiting for this thing to hit. If you're homeless, if you're uninsured, if you're elderly, the most vulnerable people who Democrats are supposed to stick up for are now really on the firing line. And so I think there's a great opportunity for Democrats not to just step up and say that Trump is bad, but to really call out the need for a government that can help the least of these.
And if you're living paycheck to paycheck, quickly, if you're living paycheck to paycheck, the problem with you not being able to pay your mortgage, if you have to take off time and be home because your kids are out of school, what do you do? That notion of 40% of people not having $400 in their bank account in the case of an emergency, this is a role for government. Sorry, Andrew.
Oh, not at all, Jennifer. If you think about the millions of Americans who work in retail, hospitality, tourism, events, it's going to impact wage workers that can least afford to take a few weeks off. This is not a situation where you can just go home and say, okay, I'm going to cool out. You're going to start missing rent payments. You're dealing with pervasive financial insecurity. And a lot of these voters were Trump voters. This is going to make Donald Trump wish that he'd reacted differently, because this, unfortunately, is going to threaten one of the core pillars of his case for re-election. If you're at home with your kids because your school closed, your 401k is collapsing, if you have a 401k, and you're not able to get the wages you need, that's a terrible case for an incumbent. And you can see them already grasping for solutions. Exactly. They're proposing this payroll tax, which is not going to do the trick. These industry-focused efforts also are not going to be enough. Jason Furman of the Obama administration came forward and said we should just put cash directly in Americans' hands.
That's a good idea.
And I believe that this is going to become the issue that's facing the administration, is how can they try and make all of these voters whole in a way that they'll actually feel in their day-to-day lives.
On the issue of federal leadership, I mean, there were election security briefings today in Congress, across the Senate and the House, and there's no indication so far whether or not coronavirus was included in those briefings, but it's a legitimate question whether or not lawmakers from the top on down start trying to talk to the state and the localities about what happens in the fall if this virus is still prevalent, which there's no indication that it'll subside by the fall, and what impact that has on voters being able to cast their ballot in November.
Also, Governor, I mean,
which one?
When you, Governor McCall, because you were jumping in. When
you look back at President Trump's statements from even 2 weeks ago, those are not going to that's just going to start to smell worse and worse if this does get worse. He's saying it's going to go away.
Well,
it's 15
first of all,
cases.
it's going to go away. It's not a big issue. Nobody should worry. We have it contained. It's not contained. But the most serious thing is he keeps telling people that if you want to get a test, you can get a test. That is not the case anywhere in America. I can tell you in Virginia today, we do not have the test kits to test people. That is just not the case. Today, the president went before the Senate Republicans at a luncheon and said to them, let's do the payroll tax cut, but let's do it through Election Day. Donald Trump cares about one thing, re-election. He does not care about the American public. And today was a sad
The funny thing about it, the best politics in situations like this is no politics.
That's
the
right.
best
Right.
politics is to just play it straight and be as professional as you can.
We're minutes away from the first votes, our first chance to project winners when polls close in Mississippi, Missouri, and North Dakota. Stay with us.
We're counting down to the first round of poll closings right at the top of the hour on this second Super Tuesday. Let's check in on the final minutes of voting going on in Missouri and Mississippi right now. Let's go to Brian Todd first. He's in St. Louis. Brian, what are you seeing?
Right, Wolf, an exciting moment here at Webster Grove Rec Center, just outside St. Louis, just about 20 minutes before the polls close here, getting a last push of voters here. It's been a very busy day in this precinct and a very busy day overall in St. Louis County. This is maybe the biggest county as far as voting goes in the state of Missouri. 750,000 registered voters in St. Louis County. You've got a lot of people coming in through here. They check in with the electronic poll pad here, and they've done a very good job here of wiping these poll pads down, of course, with sanitary wipes all day long because of the coronavirus concerns. I can talk about that more in a second. But a lot of voters coming through here now. And we've sampled some voters who came in and out of here. My producer, Brad Hodges, and I sampled more than 100 voters who came through here, detecting a lot of support for Joe Biden in this precinct. That doesn't mean that's how the state's going to go, Wolf, as you know. Doesn't mean how this whole county is going to go. But Biden getting a lot of support in this precinct. And surprisingly, some of the Elizabeth Warren supporters, after she dropped out, telling us they're going for Joe Biden, more so than we saw for Bernie Sanders, at least in this precinct. So that's a little bit of a surprise. We also talked to you about the coronavirus concerns here. We've talked to officials here at this precinct and others. You know, again, they're wiping down the electronic poll pads. They're even wiping down the pens that people are using for the paper ballots over here. As you see some people here checking in. And I talked to the Secretary of State, Jay Ashcroft, not long ago. There were a couple of polling places that are in senior living centers in the state of Missouri where they've moved those polling places out of those centers just in an abundance of caution. They've moved them to alternative sites. At one polling place, he said, they moved it to just outside, a few feet away, in tents with space heaters. So they're making all sorts of precautions here, taking provisions so that people can vote, and moving some people out of senior living centers that also act as polling stations, Wolf. But a very exciting time here as polls close in less than 20 minutes.
We'll be watching closely with you, Brian. Thank you very much. Let's go to Jackson, Mississippi right now. Victor Blackwell is on the scene for us. What's it like over there, Victor?
Yeah, Wolf, we're seeing a last-minute surge of voters come to this precinct as we have between 15 and 20 minutes now voting before polls close here. The Secretary of State's office says that day of voting is steady here with 2016 primary turnout, but absentees are up just a bit. And what we're hearing from voters reconciles with the optimism we're hearing from the Biden campaign. Voters we're hearing are supporting the former vice president. The expectation is that he will do as well here in another southern state with a large African-American population as he did in South Carolina several weeks ago and in several states on Super Tuesday. One other element that was pointed out by more than one voter is that Senator Sanders' decision to, after Super Tuesday, cancel his rally in Mississippi and instead focus on Michigan was not lost on the voters of at least this precinct and several others across the Jackson area. I've been here since Sunday speaking with voters. We'll see if that has any impact on the turnout for the senator from Vermont. But again, that decision to skip Jackson, as it was described by one voter who said, I like Bernie, but he skipped us. We'll see if there's an impact on the vote. Wolf?
Polls close in a few minutes. Victor Blackwell in Jackson for us. John King, give us the big picture right now. What are you looking for as we get ready for the first poll closings?
Well, the biggest question is, does the delegate math change tonight? Joe Biden with a modest lead, decent lead after Super Tuesday. Can he stretch it out, or can Senator Sanders, who is back on his heels after last week, tighten it up? How do you do that? Well, winning the biggest prize would be a big way to change the delegate math. If Joe Biden can win this, 125 delegates at stake in Michigan, the biggest prize tonight. This is also a statement state. It's in the Midwest. It's the state that Trump took away from the Democrats in the general election last time, and it is the state, if you go back to 2016, it was close. But this was a stunning upset. Bernie Sanders won it in 2016, essentially extended his campaign. Hillary Clinton had a good Super Tuesday 4 years ago. Then Sanders served notice right here that I am in this race to stay. So what do we look for tonight? We look for Detroit, Wayne County, African-American vote. Remember what Joe Biden has done, whether you're looking at Virginia or North Carolina or Texas, in the states he has won. Win in the urban area where you have an African-American population, and then get out and win in the suburbs as well. Put those two pieces of the puzzle together, the math gets overwhelming, right? People tend to live in cities. You get a higher population center, Wayne County, the #1 county in the state, just shy of 20% of the state population. Then you move out into the suburbs. 12% of the population here, the second largest county. That's been Joe Biden's recipe so far. Can he do it tonight, or can Senator Sanders serve notice, don't count me out yet? That's what Michigan was for Sanders 4 years ago. He needs the win there tonight. So this is the biggest piece you're looking at because of the statement the state makes in the industrial Midwest, in the middle of the economic conversation, and also because of the delegate math there. Then we just pull out, and let's just go straight down here. If you come in here, you just talked to Brian Todd in St. Louis. Again, it's the same challenge for Joe Biden. Hillary Clinton won Missouri last time, but let's come back and just show you again. Hillary Clinton did win this state last time, but look at that. Look how close it was in 2016. Joe Biden needs bigger wins if he wants to stretch that math out. Bernie Sanders wants to either win or keep it this close if he wants to, because of the proportional rules, have the delegate fight. So what are you looking for here? You just talked to Brian Todd in St. Louis. Again, you want to get the inner city vote if you're Joe Biden, run up the African-American vote, and then you move out from St. Louis City into St. Louis County, and beyond that into St. Charles County. Move out through the suburbs and get you more affluent voters. If you can put together that coalition again, like Biden was able to do in Super Tuesday states, that is the big math. And let's go back to we just talked to Victor down here. First, just look at this. Just look at the map. Look what happened on Super Tuesday, starting with the Saturday before that in South Carolina. Across the South, Joe Biden has been running it up, largely because of his African-American support. That's what he wants tonight. Jackson, you just see the blue all around it. You just saw Victor Blackwell here in Jackson, Hinds County, the largest population center in the state of Mississippi. Joe Biden is counting. David Chalian told you the exit polls earlier. It was about a 71% African-American electorate 4 years ago. It's a little below that this year, a whiter electorate. Still, Joe Biden hopes it's 60-plus African-American percentage. He hopes to run it up there. These are the big pieces for Joe Biden. Mississippi, Missouri, and he hopes to take Michigan. If he can do this, he does this right here. And one of the ways to do it, Wolf, if you want to look at it again, just to the point I was just making, if you bring this in, especially in Mississippi, let me just move this over so it gets out of the way, especially in Mississippi, the deeper the shading, the higher percentage of African Americans in these areas. So in the South, in these southern states where it's going to be 65, close to 70% of the Democratic primary electorate tonight, that is absolutely critical. But it works as well.
What about the African American vote in Michigan?
Right, it works as well if you look at Michigan as well. Again, you're going to be somewhere in the ballpark of 20%. It was 21% 4 years ago. Early exit polls suggest it'll be slightly below 20% this time, but that's still a big chunk, 20%, 1/5 of the electorate on primary day. Much of it is here in Wayne County, which is Detroit. So, Joe Biden wants to run. It's that combination that has been so critical for him. He gets a big number, a big percentage among African Americans, and then keeps it as he moves out into the suburbs, which are more diverse and then tend to get more white and more affluent. And just one other point, Wolf, is just you pull out the map here and turn this off. Bernie Sanders 4 years ago, let me get this out of the way. 4 years ago, the West was very kind. You have North Dakota, Idaho, and Washington State tonight. It's different this time. There are all caucuses last time. This is a mail-in primary. The other two are still calling them caucuses, but the rules are different. It's more show up and vote. And so that's a question as well. Bernie Sanders 4 years ago did very well in these caucus settings. Can he run it up in 2020 in those places as well? He needs it very much. If Joe Biden is making a statement in this part of the country, Bernie Sanders better win out west.
Because he's been, let's go to Washington State right now, because there's a whole bunch of delegates at stake right now. And give us a little perspective what happened 4 years ago and what we're looking for tonight.
Well, here's the most interesting thing when you do the flashback. Because it was a caucus system 4 years ago, when we go back to it, we can't show you county results because that's just not the way it was done. It was just not the way it was done 4 years ago. But look at the numbers. Look at the numbers, 72% for Bernie Sanders. The Sanders campaign hopes for a win in Washington tonight. They are not expecting a blowout like this, in part because it's a primary, and in part because, as David talked earlier, about leadership, the question of leadership in the middle of the coronavirus crisis. This is the epicenter of the crisis up here. So where are you looking for? If you come in here, you just come in King County in Seattle, you see right there. It's more than 29%. More than 29% of the population is right here. Again, Joe Biden's formula has been Win in the cities where most of the people live, and then stretch it out into the suburbs. You have Seattle here, Tacoma here, the count out here. You saw our Sarah Seidner. That was the most amazing live shot in election history. The backpedaling through that, the mail-in center here. So how quick do they count out here? Because most of the votes are cast by mail. But again, Bernie Sanders needs this to be Sanders blue at the end of the night. If for any reason Joe Biden can win in Washington State, there's going to be a lot of rethinking in the Sanders campaign.
He needs Idaho, too.
He needs them all.
Let's take a look at that.
Idaho is smaller when you come over there. In terms of the delegate count, you're only talking in the teens here, just 20 as you come through here. Again, it's more of a firehouse primary this time than it is a true caucus. But Senator Sanders very strong out here 4 years ago, if you go back to it again, 78%. This was a mistake the Clinton campaign would actually concede. Now, they didn't compete as much in these areas because they thought they were fine in the bigger areas. The bigger, you think it was 23 delegates then. It's 20 delegates now. You think, oh, well, that doesn't matter. In a close race, remember what Barack Obama did in 2008 to Hillary Clinton. In a close race, every delegate counts. He went into the smaller states and did it. Again, we will see. Different rules this time. Senator Sanders is expecting a win here. We'll be counting those ones a little bit later.
We certainly will. Here's a look ahead at the polls that are about to close. We're closing in right now, and the first results of the night right at the top of the hour. That's when voting ends in Mississippi, Missouri, and North Dakota. 118 delegates are up for grabs in those three states, most of them in Missouri. It's an early slice of the 365 delegates on the line tonight. Jake, tell our viewers what we can expect.
That's right, Wolf. We're getting closer to the first test of Joe Biden and Bernie Sanders head-to-head. The former vice president is aiming for a win right out of the gate in Mississippi as he looks to extend his southern winning streak. Senator Sanders is hoping for a victory in North Dakota's caucuses. He trounced Hillary Clinton there 4 years ago. Both candidates are eager to pick up delegates in Missouri, the biggest prize this hour, with 68 delegates at stake. Let's check in with Jessica Dean. She's covering the Biden campaign. Jessica?
Well, Jake, we're here in an empty gymnasium because the Biden campaign canceled their rally here in Cleveland. He will now be giving remarks in Philadelphia. So we are here in an empty gymnasium with no people out of an abundance of caution surrounding coronavirus. Let's talk a little bit about strategy, though, for the Biden campaign as they head into the results tonight. I talked with a Biden advisor who told me their strategy for tonight is like the one from Super Tuesday a week ago that they used very effectively, which is concentrate on specific congressional districts within these states where they can really run up the score and then try to keep Bernie Sanders' margins down in areas where the race is going to be a little bit closer. So one example they pointed to, we're about to hear more from, is Mississippi. They really think that that's a place where they can run up the score there and really have an impact. They pointed to Bernie Sanders canceling his event there over the weekend and coming here to, or going to Michigan rather, and that Joe Biden was able to get into Mississippi. He attended church service there. He held a rally there. So they're focusing on places like that where they think that can make the difference for them in this delegate race. Jake.
All right, Jessica Dean covering the Biden campaign in Cleveland. Abby Phillip is also in Cleveland covering the Sanders campaign. And Abby, the big question for Sanders, prompted by last week's results, is can he expand on his base? Can he reach out to more people? Of the 6 contests going on today, Sanders 4 years ago won 4 of them outright. The 5th, Missouri, he and Hillary Clinton basically tied. He only lost Mississippi. Does the Sanders campaign think that they can at least match the record of last time, 4 years ago?
You know, Jake, when you speak to campaign advisors, they are pretty candid that they acknowledge that tonight is not going to be their best night. They're looking at 2 states where they think that they can perform well. Washington State is one, no longer a caucus, now a primary, but they still believe they can do well there. They also think that they have a chance here in Michigan, but you can see based on the schedule that he has been keeping over the last several days, how important Michigan has been to them and how much work they think they had to do here. They basically pulled out of Mississippi, canceling a rally in that state in favor of doing more events here in Michigan. And they have tried to engage with the African-American community, which is about a fifth of the electorate here in this state. And it's been a weak point for the Sanders campaign in basically all of the primaries up until this point. So the Sanders campaign knows that they have some work to do in engaging non-white voters, particularly black voters in a state like Michigan. And it's very telling, though, that even while some advisors tell me they believe that this race will be closer than the public polling suggests, just like it was in 2016, they are looking at Michigan as an uphill battle. He won this state 4 years ago, but they think it's going to be really a challenge for them to compete here, though they've been pretty insistent that no matter what happens here, they plan to continue on. Sanders plans to be at that debate on Sunday night, Jake.
All right, Abby Phillip covering the Sanders campaign in Cleveland, Ohio, where both candidates, Sanders and Biden, have canceled big rallies planned for this evening out of caution because of coronavirus. Dana, what are you looking for this evening? What's on your mind?
Well, polls are closing at the top of the hour in Missouri, North Dakota, and Mississippi. And what I'm going to be looking at is whether or not the Sanders campaign can increase turnout among young people. Last week, one of Senator Sanders' biggest disappointments was that young voters who make up a big part of his coalition did not come out in the numbers they needed, not even close. I'm told by a top campaign advisor that in the past week, they've really tried to redouble their efforts to get young voters who say they like Sanders to actually go out and vote. And that matters even in states like Mississippi, where Sanders aides admit they don't expect him to win, but hope that he can still do well in pockets like college campuses, because, Jake, it is all about racking up delegates.
Indeed it is. Dana Bash, thanks so much. David Chalian, what are you looking for?
One of the things, Jake, that we're taking sort of a deep dive into in these exit polls is the candidate quality that mattered to voters in two of these key states, Mississippi and Missouri. Up first, Mississippi. Which candidate quality mattered most to you? 34% say they're looking for somebody who can unite the country. Just behind that, 30% say looking for a candidate who can bring needed change. And just a tick below that, cares about people like me. This is pretty even distribution across candidate qualities. Take a look over in Missouri. You see a similar trend here, except change overtakes uniting here. 35% of Missouri Democratic primary voters today say they're looking for a candidate that can bring needed change. 32% looking for a uniter, 26% looking for that empathy factor, somebody who cares about people like me, only 5% looking for a fighter. Again, the electability issue, looking for somebody who can beat Donald Trump or looking for someone you agree with on the issues. In Mississippi, 53%, a majority of the electorate there, looking for a Trump defeater. 45% agrees with you on the issues. A little more narrow distance between those two choices than we've seen in some states across this primary season. It looks different in Missouri. It looks more like that wider gap we've seen. 59% of Missouri Democratic primary voters today looking for a Trump defeater. Only 37% looking for someone that agrees with you on the issues, Wolf.
All right, David, thank you. You know, John, next few minutes, we might be able to make our first projection of the night.
And we'll get our first sense of whether voters on Super Tuesday round 2 share the same sentiment as they did Democratic voters on Super Tuesday round 1. If you go back a week ago, it was as if a switch flipped. And Democratic voters just decided, even though Joe Biden hadn't campaigned in Minnesota, hadn't really campaigned in Tennessee, hadn't really campaigned just one event in Texas, they just decided all of a sudden, boom, we're going with Joe Biden. That's what happened last week. Biden wins 10 out of 14. Does Sanders bounce back tonight and get back in the delegate chase, or does Biden stretch it out? So we look through. Mississippi will start to get early again. If you look at the map, Joe Biden fully expects to win Mississippi. He's hoping by a big margin so that he can take the bulk of the delegates from there. I want to focus on Michigan because this is the biggest prize tonight. Missouri is the show-me state. For me, Michigan tonight is the statement race. It's where Bernie Sanders won 4 years ago. It's where he served notice to Hillary Clinton that my challenge is real and I am in this to the end. He has to win Michigan tonight to get back in this race for obvious reasons. Joe Biden wants to say, Bernie Sanders, you say you're the blue-collar voter. No, you are the appeal to blue-collar voter. No, I'm going to do it. And again, let's go back and look at the map in 2016 as we think about this. Yes, it was very close, but the statement from Sanders in winning Michigan was enormous. How did he do it? Even though Secretary Clinton ran it up pretty strong in Wayne County, ran it up in the suburbs, but relatively close, 5 points there. Look at the map when you pull it out. Senator Sanders won all these smaller counties throughout Michigan, and he won. This is a place to watch tonight. Kent County, it's the 4th largest county in the state. Grand Rapids. Joe Biden was just there the other day. Watch this for an early sign. If this is Bernie Sanders blue, he's in play. If it is Biden blue, we have an issue. Why are we watching Michigan? Number one, it was defining 4 years ago in the Democratic primary. It will be defining tonight as Joe Biden tries to stretch out that lead. But let's also remember, Wolf, this was one of the states that Donald Trump flipped. It's one of the states that Donald Trump flipped. He broke the blue wall by winning Pennsylvania, Wisconsin, and Michigan. Democrats need to get it back if they have any hope of defeating the incumbent president. Here's one of the reasons we'll judge a little bit tonight. If you go back 4 years ago to the Democratic primary, and you see right here Macomb County, just outside of Detroit, home of the auto industry, a big part of blue-collar workers here. Look how close it was. This was our first big sign that Hillary Clinton had trouble among blue-collar men, right? You come to the presidential election, Donald Trump carries Macomb County over Hillary Clinton. By the margin here, Donald Trump won Michigan by 10,000 votes statewide. More than enough right here. Macomb County, Michigan made the difference, gave Donald Trump the margin of victory there. So as we think about the 2016 presidential map in the general election, we'll watch the primary campaign tonight, Wolf, Michigan being the statement state. A lot of other delegates at stake in the other 5 as well.
Lots at stake indeed. Just seconds from now, voting ends in Mississippi, Missouri, and North Dakota. 118 delegates are on the line in those 3 states. This is the first test of the night for Joe Biden and Bernie Sanders. And we have our first projection of the night. Bernie Sanders, not happening right now. Joe Biden is the winner of the Mississippi primary. Joe Biden carries Mississippi. There we have it right there. You can see it. Maybe you can't see it. We'll fix that technical problem. But the most important thing is this. Joe Biden is the winner. Joe Biden is the winner in Mississippi. It's another southern state that goes for the former vice president of the United States. It's a big win in Mississippi. It shows that he has been able to win most, if not all, of those southern states, in part due to the large African-American vote in those southern states in the Democratic contest. Joe Biden, once again, the winner, the big winner in Mississippi. As far as Missouri is concerned, North Dakota is concerned, too early to call. Let's go to Arlette Symes. She's covering the Biden campaign for us. Arlette, normally when we make a projection like this, that Joe Biden has won Mississippi, we go to you and there's a big crowd. They're watching CNN. They're cheering. But right now, very, very little crowd, right?
That's right, Wolf. It's entirely different circumstances this evening, but Joe Biden has won Mississippi. The campaign had felt good about Mississippi going into the night, and for good reason. It is a state that has a large African-American population, which makes up a core base of their support. A lot of those southern states that he won also mirror Mississippi's makeup. Now, Biden spent Sunday campaigning down in the state. We're going to see how some of those other states he campaigned in, Michigan and Missouri over the weekend, how those turn out for him tonight. But this evening, Joe Biden canceled that rally in Cleveland. He instead will be giving remarks here to the press in Philadelphia. And one thing that is markedly different is there will be no public audience here. A handful of members of his staff will be on hand, as well as the press corps that's been traveling with him and reporting on him when he makes those remarks that will include a portion about coronavirus. But they're also expected to give an overall arching vision for his vision of the country. So Joe Biden, the next few hours, will be addressing press shortly.
We'll watch it very closely together with you, Arlette. Thank you very much. They've canceled all of those rallies, the Biden rally, the Sanders rally, out of concern because of the coronavirus. Let's recap right now. Once again, Joe Biden, the winner in Mississippi. He will win the Democratic presidential primary. 36 delegates at stake in Mississippi. Joe Biden, the former vice president, the winner. In Missouri right now, too early to call between Biden and Sanders. We are not yet able to make a projection based on the actual vote as well as the exit poll. 68 delegates at stake in Missouri. Similarly, in North Dakota, too early to call between Biden and Sanders. Only 14 delegates at stake in North Dakota, but we are not able to make a projection. Let's take a look at the big map right now, and you can see, as far as, let's go to Bernie Sanders. For state sees what? Well, you can see the big map. The dark blue are states that Joe Biden has won. The light blue are states that Bernie Sanders has won. And now Joe Biden has won one more state in the South, Mississippi. You can see it right there. The map shows it's pretty significant. The Biden wins in the South. Let's go over to Jake and Dana. Another important win for the former vice president.
Sure, and he can rack up a lot of delegates in a place like Mississippi because he will not only win the state, he'll win all the congressional districts like he did in Alabama last week. Not really a surprise like I mentioned before, of the 6 states that are voting today. Bernie Sanders last time won 4, basically tied with Hillary Clinton in Missouri, and got clobbered in Mississippi, which had, I think, a more than 60% of the electorate today is African American, which is, of course, the heart and soul of Joe Biden's base. So I'm really not surprised by this at all.
It's not surprising now, but it was a week and a day ago that the Sanders campaign, or maybe even a little bit before that with South Carolina, they were really hoping that all the effort that he and the people around him put in over the last 4 years since he got clobbered in states like Mississippi, because the African-American voters were not with him. They were with Hillary Clinton. They put in so much effort in the African-American communities, particularly in the South, to show who he is, to try to make inroads with that community, and it didn't work.
Yeah,
it just didn't work.
I saw a really great Instagram ad for the Sanders campaign. It was picture of Bernie Sanders that the Chicago Tribune found recently, I think, getting arrested when he was a student at the University of Chicago in 1963, protesting housing discrimination. I mean, this is somebody for whom civil rights has been literally a lifetime cause.
And he talks about that a lot in areas where he was hoping, and I guess he's still hoping in the future, to get African Americans to come his way. And it is it was a bit of a surprise and a big disappointment. I can tell you in talking to Sanders' campaign aides that he really didn't get very far with this community. Now, the question, as we talked about earlier, is whether or not African American voters in the South, which now the Southern sweep that Joe Biden has, which is really remarkable, will match what we see in the vote in Michigan. Remember, Bernie Sanders got the endorsement of Reverend Jesse Jackson, and he is very much hoping that African Americans in the Midwest, particularly older African Americans who really identify with him, will follow that endorsement, just like other endorsements on the other side that Joe Biden has gotten.
We should note, of course, it was Sanders, I think, endorsed Jesse Jackson when he ran for president in 1988.
That's right.
So it was an opportunity to return the favor. David Chalian, you have some exit polls.
Yeah, Jake, we're taking a look at sort of how Joe Biden won Mississippi, exactly what you and Dan are just talking about. Look at that black vote, 64% of the electorate African-American today. Look at this. Joe Biden won 84% of African-American voters in the Mississippi Democratic primary. Bernie Sanders, only 13%. 4 years ago, he only got 11%. He's not improving with this core constituency inside the Democratic primary. This is what Victor Blackwell was talking about when he said that he ran into a voter who said he skipped Jackson. This is huge for Joe Biden. Take a look also at the electability issue. Remember, I said 53%, a slim majority, but a majority want a Trump defeater. Who won those voters? Joe Biden got 80% of those voters who say they're looking for someone who could defeat Donald Trump. Bernie Sanders only got 17% of him. Biden is crushing Sanders here in Mississippi with the notion of electability. Take a look among mainline Democrats. So take out independents, take out Republicans, just self-ID Democrats. They make up 77% of the electorate in Mississippi. Biden gets 81% of them. Sanders, 17% of them. 4 years ago, he got 12% of self-ID Democrats, so a little improvement there, but not nearly enough. And finally, the split between the candidates in terms of the candidate quality looking for a uniter, can unite the country. Remember, 34% of Mississippi Democratic primary voters looking for a uniter, the highest quality, the plurality of voters chose that. Biden, 91% of them he wins, to Sanders 9% on this notion of a uniter. Biden just crushing across categories Bernie Sanders in Mississippi, Wolf.
Thanks very much, David. You know, John King, another southern state, you see that dark blue in the South, all Biden, largely because he's so popular in the South with the Democratic African-American.
Right, his own relationships, which go back many years, but let's not discount the fact he was Barack Obama's vice president for 8 years. Now, I can put this on just to show we've called Mississippi. What happens when we do that is California goes off because we have not yet officially called California, even though if you take it out and look at it, Bernie Sanders has a healthy lead in California. It just takes a long time to count the votes, and so we want to be careful and play that out. So let's just look. We do have some votes in Missouri. 27 votes total, 27-6. I'm sorry, 33 votes there. So we're very early on in Missouri. But hey, that means they're counting. You know, we've had a couple issues in this campaign. If you've been with us since the beginning, they're starting to count them in Missouri. We'll watch how that plays out. But to your point here, if you put on the called states, if you just go across here, before this win, remember, the conversation before South Carolina was, is Biden's campaign faltering? Is Biden's campaign stumbling? He wins by 30 points in South Carolina. And then, again, as I said earlier, it is as if a switch flipped. And Democratic Party voters, especially Southern African Americans, but also suburbanites, you have to put the two together. There's a sudden, like overnight, Bloomberg failed. The other candidates dropped out, endorsed Biden. Remember that remarkable Buttigieg, Klobuchar, then after Super Tuesday, Bloomberg, Beto O'Rourke came on in Texas, the rally around Biden movement, and you see it filling in on the map, especially here. And Jake made the point earlier, if you come into a state like this, let's come over to where we've already been, in Alabama, you see it like this. Let me get rid of these lines, just bring up the congressional districts for you. You're not only winning delegates, but especially in states where you have the higher African-American population in these minority districts, Democratic rules give those districts more delegates. So Joe Biden in these southern districts where you have the heavy African-American population, that just helps him run up the delegate count. You look at it this way, you look at the Biden vote, there's not many counties won by Senator Sanders across the South. Dana made the point. He learned lessons from 2016. He went into the Latino community. That has helped him. Out in Nevada and out in California, Sanders has grown among Latinos, but he has not grown among African Americans. And we're seeing that play out across this southern sweep for Joe Biden. And the question will be, when we start to get votes in Michigan tonight, when we get more votes in Missouri, when we come back to the race here, when we get more votes in Missouri here, especially as you come in to St. Louis and Kansas City, where you have large African-American populations, significant African-American populations in both of the areas, do we see it as well? Does what we see for Biden and the Democratic base across the South start to extend up the Midwest, Missouri, up into Michigan? If the answer is yes, then Biden is going to have a good night. And this delegate math, if we come back to the state of the race, this is the big question tonight. We're going to go state by state through these 6 states. Joe Biden comes into the night with this 70-plus lead among delegates. The question at the end of the second Super Tuesday, with so many delegates at stake, is he stretching it, or is Sanders getting back in the race? This one, Michigan, absolutely key to Senator Sanders getting back in the race, but you're starting to see the Biden coalition, at least in the South. We'll see if Super Tuesday 2 repeats that in the other places as well.
Yeah, 36 delegates in Mississippi, 125 in Michigan. We'll watch that very closely. Anderson, over to you.
Yeah, well, thanks very much, Van. What do you think it is that I mean, Senator Biden has put a lot of effort, even before this race, after the last time around, into trying to get African-American voters, obviously younger voters they were depending on. That it just has not happened.
Look, I don't think you can overstate the appreciation in the black community for what Joe Biden did for 8 years. Don't forget, Joe Biden was already a legend. He was known. He was an establishment guy. And Obama was the young guy. He was coming on. At no point did Joe Biden ever undermine Obama. He stood with Obama. He was willing to play the wingman. He did that job through thick and thin, and that matters to people. You can't take that away. Listen, I give Bernie Sanders credit for trying to expend the effort to try to push out, but the reality is his story of his civil rights victories are stories from the 60s, from the 70s. There's a big missing hole for Bernie in terms of his relationship with the black community. He's tried to fill in the past 4 years. It's just not enough, and it's going to cost him.
And Sanders' campaign was very aware of this heading into Michigan in the last week since Super Tuesday. They tried to reboot their outreach to black voters. They put ads with Obama on the air. They went up on black radio. They're going to stay up on black radio all the way to March 17th, the next round of contests. They rolled out the endorsement from Jesse Jackson. But again, it's this question of, is it too little, too late? He took some incoming after he scrapped the speech that he planned to give in Flint, Michigan, on racial injustice. That was something that a lot of black activists told me that they noticed. And then also we spoke to a voter on the ground in Flint. There was a younger African-American man who brought his older mother, and you see this age divide. He brought her to one of the rallies, and she said that she just couldn't get over the Democratic Socialist label. So these are things that Sanders, and I heard that in South Carolina as well, the socialism label. So these are things that he has to either explain better to African Americans or more directly communicate with them in ways that he hasn't.
The African-American vote is not we saw this in South Carolina. We've seen it in other places. It is not that liberal a vote. It is a moderate vote, and much more akin to Biden's politics. The awkward thing about those commercials in the Obama commercials was that Bernie Sanders just hasn't been historically that close to Obama. He was looking for a candidate in 2011 to run against him in a primary. So all the cool kids have Obama commercials in this campaign. Like I had one. Like 5 different. Well, you're ultra cool, so you're in a different category. But there really isn't that big a link between the two of them, and I think that
I do want to
could
jump
ring
in.
very true.
I do want to say though that we've got to stop lumping a whole group of people into one bucket. Bernie Sanders has done very, very well with young people of color, particularly young black folk, and there has to be a conversation that we have about some of the divide in terms of how people are seeing this race so starkly different based on a cutoff of 40 or older, 40 or younger. I will say, though, you've got to give credit where credit is due. Joe Biden's done a great job consolidating support among older black voters. The interesting question to be asked today, though, we kind of knew Mississippi was going to go that way. The interesting question today is that Bernie Sanders did show up. He went to Flint. He went to Detroit. He rallied in communities.
But he canceled the Mississippi rally.
Understood, but it's also because of the importance of the state of Michigan.
About race.
But it's also because of the importance of the state of Michigan on this calendar today. And so, and you think about it, right? There are more black folks in Michigan than there are black folks in Mississippi. And so, I do want to say that he showed up. He's speaking to that demographic.
Let me underscore something which I think is actually really interesting. Under 40, certainly under 35, Bernie Sanders is leading the most multiracial progressive movement maybe in the history of the country. I mean, African American, Latino, Native American. It's unbelievable what he's doing under that cutoff. But the reality is, above that cutoff is where the majority of our voters are, and he has not broken through there yet.
Why hasn't that movement moved people to the polls? Because the fact is that in most of the races we've seen, and we'll see what happens tonight, but I suspect it's going to continue, the turnout among younger voters has been lower in many cases than it was.
I'll tell you, I
4
voted
years
in Ann
ago.
Arbor. I voted in Ann Arbor on Monday, and on Monday it was all college students coming in, lining up to vote early, and he had just rallied there the night before. And so we have yet to see. I do think a lot of young folks realize that this is an immense moment and that they had showed up.
But they've been saying that now for the entire time, and they were saying this last Super Tuesday, and it just didn't happen. So why would, anecdotal stuff of like, the rallies are really big, it's not translating into young people actually coming out, which is a traditional, it's not a new problem.
No, it's not a new problem. And I think Joe Biden recognizes it. I thought it was very important the other night when he was standing there with Kamala Harris and Cory Booker, and he said, he is a bridge, to the next generation. This was a really important statement by Joe Biden. He knows he's not getting those younger voters. He knows he's getting their parents and their grandparents. He gets that. When he calls himself a bridge, he turned to them and said, you're the future. I understand it and I get it, and let me just do this now. And I think if you take that, you know where Joe Biden's head is at, and you know where those voters' heads are at, which is they see him as someone comfortable, they can trust, and he's the bridge.
The bottom line point, who can beat Donald Trump? That is the biggest issue these people are voting on.
I got to go to Wolf.
And they think that Biden has a much better shot in beating than Bernie Sanders.
Let's go to Wolf. Wolf?
Anderson, we have a key race alert right now. Our first key race alert, as far as the all-important state of Michigan is concerned, 125 delegates are at stake. Very, very early, less than 1% of the vote. The estimated vote is in. Bernie Sanders has a lead right now, 51.4% to Joe Biden's 46.2%. But you can see it's very early. Bernie Sanders ahead by 463 votes right now in Michigan. It's the biggest prize of the night on this Super Tuesday. Round two, we're watching it very closely. Let's go over to John King at the Magic Wall. Michigan is the big prize of the night. The other 5 states very important as well. Lots of delegates at stake.
But as you know, it is early. But as you look at it, it is Sanders blue right now. And if you're in the Sanders supporter or the Sanders campaign headquarters, you need it to stay that way. You need it to stay that way. But let's watch this and just take a look as we pop it out. We are very early on, 1% of the vote. I did mention earlier, though, one of the keys, if you go back 4 years ago, is that Bernie Sanders lost Detroit, but he did win Grand Rapids and the area around it, Kent County. 13% of the vote in here, so still a long way to go in this part of the state. Sanders ahead with a 5-point lead there. That's significant. If your expectation is that Joe Biden's going to carry Wayne County, which where Detroit and the African-American base is, if your expectation is he will get that, just like 4 years ago, Hillary Clinton won over here. Bernie Sanders offset it by winning there in Grand Rapids and Kalamazoo. Come back to it, small county up here. This is a very tiny percentage of votes, 8% in this county. 59 to 19, 40 votes there. So we have a long way to go. Michigan's a big state, a lot more people than this. But just to compare it again, you go back 4 years ago, Sanders did quite well, up in the top of the mitten, if you will. Up in here, we'll see how that plays out throughout the night there. But we're very early on. 1% of the vote there. In
I just
Michigan,
want to point out that most of the voting has ended in Michigan in the Eastern time zone, but the Central time zone, the voting still goes on. All of the polls won't close until the top of the hour. Let's take a look at Missouri.
You move through Missouri, you see it filled in. Biden blue there. We're very early on in the count here as well, but beginning to get some over here. If you look at Jackson County, this is Kansas City, second largest county in the state. Again, the Biden coalition has been win in the urban area and then stretch it out and win in the suburbs. At the moment, again, we're early in the count. Joe Biden doing what he needs to do in that part there. Run it up where the people live, second largest county in the state. You just pull out and take a look at it. Most of the others here you see coming in early on are pretty small rural counties here. 90th in terms of the county, but Joe Biden running it up big. This has been a key for Biden. One of the things we have seen in other states, Minnesota last week, where he has surprised us a little bit, is that not only is he winning in the cities and he's winning in the close-in suburbs, he is competing with Senator Sanders in places Senator Sanders did really well, small-town America, 4 years ago. And so we'll see if this continues. That we look in the count in Missouri. But again, if you just think about it, before we get west, last 4 years ago, Sanders won Washington, Idaho, and North Dakota. If you're Biden, we've already called Mississippi. He's leading in Missouri, and you want to fight this one. For Joe Biden, this central part of the map right here is absolutely critical tonight as he tries to stretch the delegate lead. Again, we've already called Mississippi based on the exit polls and the projections. We don't have any live votes yet there. And if you come up here, again, I just want to check to see if it's changed while you're here. We're still right where we are. The early votes coming in Michigan. We expect a long count because there was a lot of absentee balloting. In all of the states this year, a lot more people are voting absentee, but we're told this count may go a little slower than normal, but early lead for Bernie Sanders. We'll see if it holds up.
We're going to watch Michigan and Missouri very, very closely. Much more of our special coverage coming up right after this. We have a key race alert. Let's check the numbers right now in Michigan. Very early, only 1% of the estimated vote may be in. Take a look at this right now. Joe Biden slightly ahead over Bernie Sanders, 49.1%, 47% for Bernie Sanders, only a lead of 432 votes. Very, very early. Michigan, the biggest prize of the night with 125 delegates at stake. In Missouri, 68 delegates are at stake right now. Still very early, as you can see, Biden ahead significantly, 47.1%. There it is, just changed, 46.6%, 18.1% for Bernie Sanders in Missouri. But once again, very, very early. Let's go to Miguel Marquez. He's joining us from Warren, Michigan right now. You have some results where you are, I understand.
Yeah, so this polling place has 3 different precincts in it. The numbers that we're going to show you now are probably not reported in what you just talked about. We have 3 precincts here. This is Warren 1. Joe Biden with 176 votes. Bernie Sanders with 187. In precinct 3 for Warren, 143 for Joe Biden, 152 for Bernie Sanders. So again, Bernie Sanders edging him out just a bit. And in Warren, precinct number 4, Joe Biden 128 and Bernie Sanders 156. The county clerk saying that they have not seen huge turnout today. Bernie Sanders winning in all 3 of these precincts in this area. Doesn't mean the state will certainly go like this, but also several counties in the Upper Peninsula waiting to vote. They have about 40 more minutes before polls close in those areas, so we'll get full results before too long. One thing that the county clerk in Macomb County or in Warren City is saying today is that they have had a big number of people coming in to register and vote today. So a lot of interest in the closing days of this campaign here in Michigan and in Warren of people wanting to get in, vote, and try to get their voice heard in the democratic process. Wolf?
Important indeed. All right, thanks very much, Miguel. You know, John, let's go to Warren, Michigan right now.
We don't have those votes. Miguel just said we probably don't have those votes. Warren, Michigan is here in Macomb County. Warren, Michigan it's famous in American political history, at least in my first campaign. Warren, Michigan is where Michael Dukakis rode in that tank. Right. General Dynamics, Abrams Tank Factory. There's a General Motors Tech Center in Warren. It's part of the auto industry, the industrial center. It's here in Macomb County. Those votes, obviously, as you can see, have not been officially reported just yet. Just pop out to see where we are in the Michigan statewide tally. Come all the way out. You see the Sanders. It's been flipping back and forth. We're very, very early. But Senator Sanders now ahead up to 4%. 49 to 47 if you round the former vice president up. So this is a very close contest so far. Remember how close it was if you want to go back in time and be reminded. Pretty close 4 years ago. Shapes up in the early count is very close tonight. So what are you looking for? Obviously, we're waiting for Detroit. You see more areas filling in here. You're waiting for Detroit and the suburbs around Detroit to fill in, Macomb County being one of them, Warren, Michigan being one of them. Warren is the blue-collar battleground. And you saw Miguel saying those vote tallies were relatively close back and forth. That would take you back to where we were 4 years ago in Macomb County. This was hard fought between Clinton and Sanders. She just barely won the county. But again, this was one of the first warning signs of her struggles with blue-collar workers.
Let's take a look at some of those counties right now where Biden is ahead. He's the dark blue. Bernie Sanders is the light blue. If you go to some of those counties, see what they are like now and what they were like 4 years ago.
So you're over here now, and you just want to take a look here. These are pretty small counties, but this one's not bad, about 3% of the state population out here, Ottawa County. So let's just go back in time and take a look at where we were in 2016. Sanders. So Sanders, if you look, let me just come out to the whole thing before we do this. It's easier to look at it this way. Hillary Clinton won in the population centers and then had a couple of examples in other places. But Sanders won largely on the western part of the state. If you look at it here, again, a few pockets of exception. So let's come back to where we are right now and look. And the thing that strikes me most of all is you're over here on the western side. Again, this was a Sanders County 4 years ago. It's 52 to 44 4 years ago. Let's come up here and look here. Again, 4% reporting. So this could easily change as more votes come in. Early precincts are reporting. But that's one of the things to watch. This was a state Sanders won last time. It was very close last time. Both campaigns think it could be quite close tonight. The question is, can Sanders match his performance of 4 years ago, or in a two-way race against a different candidate, Joe Biden as opposed to Hillary Clinton, do we get a different dynamic? You move up here. Again, most of these are smaller counties when you get up this part of the state, but let's just take a look. You see the Biden blue up there, and we go back 4 years ago. Mostly, not all, but mostly Sanders, especially in the center here. So that's one of the things we'll look at as we go through the night. You should not jump to conclusions based on this early preliminary part of the vote, but we're up to 8% now, and Joe Biden has taken the lead. See, in a close race, this is the seesaw fun that we have in election night. It's not fun if you work for one of these campaigns. It's anxious, anxiety causing if you cause it right here. But if you pop it back out again and look, Joe Biden now with 9% in, 49% to 46%, just shy of a 5,000 vote lead. Why is that? Miguel Marquez just told us the votes in Macomb County. Some of them have now been reported. Joe Biden with a 52 to 42, essentially a 10-point lead in Macomb County. If that number holds up, Joe Biden will squeak out Michigan tonight just because of the importance of Macomb County and what it tells you as you go west. It's early, though. It's 2% of the vote, so we have a long way to go in the count. If you look at it here and you bring it up, that's just what Biden wants. He needs to match it here. The most important place for Joe Biden is not only the margins here, but the turnout. He needs to win by a big percentage and get the turnout in Detroit, then match it in Oakland County, suburban county, and then match it over here, Detroit suburbs, but much more of a blue collar in Macomb County. So if you look at these results early on, again, it's only 2%. But Joe Biden, if he can keep this one, Biden blue throughout the night, it bodes well for his chances statewide. But again, very competitive as we count early on. 12% of the vote in, 49 to 46.
12%, that's a number already. Biden is ahead by 5,500 votes with 12% of the vote is in, but there's still plenty of votes remaining outstanding.
Major population centers. Just
the biggest prize of the night.
Yeah, just before you go, Kalamazoo just came in for the first time, and this is essentially a tie, 48 to 47. And this was one of the places where if you go back 4 years ago, Senator Sanders won big out here. Again, Hillary Clinton won in Detroit. She won very close into Detroit. Sanders did very well in Kalamazoo and Grand Rapids as you move to the west. So that's one of the things we're going to watch tonight. Can Senator Sanders match those up? At the moment, he's leading in both places, Grand Rapids and Kalamazoo, not by the margins he did 4 years ago. We'll see as we go. We're up to 12% reporting. The former vice president has taken the lead in Michigan. This is the big prize tonight, both for the delegates, for momentum in the race, and for what it says. Both of these candidates are saying, I'm the best candidate to beat Donald Trump. Winning Michigan would help you make that case because, remember, Donald Trump turned Michigan red 4 years ago.
Let's check into Missouri right now and see what's going on.
Let's pop down here. Come on out. The early results suggest a very big lead for the former vice president, but 68 delegates at stake here. We don't see any. This is a tie, I suspect. Yes, it's a tie in the one small county here as we come through here, but 6 votes and 6 votes. But if you look through this right now, again, the only major population center we have, well, a little bit in Jefferson City. If you come into this here in the middle, that's a blowout right there so far there. And if you come over to Kansas City, Jackson County, again, a blowout in the early numbers here. It's early, so we have to see if this continues. But if you're Joe Biden and you look at those early numbers, Kansas City and St. Louis, where we don't have anything right now, that's where you want to run it up. Joe Biden's formula for success since South Carolina has been run it up in urban areas, run it up in the close-in suburbs, and then compete in these smaller counties where Sanders did very well 4 years ago. Again, you go back in time, you see a lot of the Sanders, not a lot of people live here, but if you win a ton of them, it helps you in the election. This was a very close one 4 years ago, 2,000 votes right there if you look at it. But if you come back now, Joe Biden is filling in some of the smaller counties in the rural areas. That has been part of his success and, frankly, part of the underperformance of Bernie Sanders in this campaign.
68 delegates at stake in Missouri. That's the third biggest prize of the night. David Chalian, you're taking a look at the exit polls. Or the delegates, for that matter.
Yes, that I am taking a look at right now. I'm taking a look at where we are with delegates. We were able to assign some of the delegates out of Mississippi already, that big victory for Joe Biden in Mississippi that we projected. Wolf, we've been able to assign him 8 delegates out of Mississippi so far. 28 remain unassigned. Remember, there are 36 delegates at stake in Mississippi, so a little less than a fourth of the delegates we've been able to allocate. 8 delegates added to Joe Biden's total.
So what's the total so far?
Well, the total so far in terms of delegates to date, Joe Biden has 643. Bernie Sanders has 558. You see up there, Wolf, you need 1,991 to win. We're still a long ways away from either candidate achieving that, but Joe Biden already adding to his advantage in the delegate race. This is what John King was talking about. If he can take tonight to stretch it out, to stretch that lead to a place where it becomes very difficult because of the way delegates are allocated proportionally. Everything is proportional. You got to get that 15% threshold statewide. You got to get more than 15% in congressional districts. And if you're winning big, like Joe Biden did Mississippi, you're kind of shutting out Bernie Sanders from collecting enough delegates to keep in this race. That's why Mississippi is not where Bernie Sanders is looking tonight to make up this delegate lead. He's looking in other places where it's closer, like Michigan right now. You were talking
Michigan, and maybe he'll do a better out west as well.
That may be, and perhaps it'll be a closer race in Missouri as well. But we were able to take 8 delegates from Mississippi, assign them to Joe Biden. He adds to his lead now, so that is 40. What is that? That's an 85 delegate lead that Joe Biden currently has in this race.
All right, David, stand by. We have another key race alert right now. All right, look at this. 21% of the vote in Michigan is now in. 125 delegates are at stake. Joe Biden has a considerable lead, 52.1% to Bernie Sanders, 43.2%. Right now, Joe Biden is ahead of Bernie Sanders by more than 30,000 votes in Michigan. 21% of the estimated vote is in. Very small vote so far in Missouri right now. 1%, if that, of the vote is in. Biden has a considerable lead, though, of 45.7% to Bernie Sanders, 18%. 68 delegates once again at stake in Missouri. Let's go over to John. You're looking closely at Michigan right now. The numbers just jumped to 23% in Michigan. 23%, almost a quarter of the vote, is now in.
23%, as you noted, 30,000 vote lead. A 30,000 vote lead. It's only 23%, but that gets hard. It just gets hard to overcome the math, especially when we still have nothing from Wayne County, which is expected to be a Biden stronghold. We'll see if that's how the votes come in. But this is your urban Democratic base center. Then you start moving out into the suburbs here. Still nothing there. So how is Joe Biden opening up this lead? Number one, cities where most of the people are, the close-in suburbs is where you find your next population center. You see Macomb County, we just talked about this a moment ago. Blue collar, a lot of auto industry here. Just 2%, but Joe Biden opening up a 10-point lead there. If he can keep those margins going through the night, it bodes well. Then you move over here. Oakland County, also some of the auto industry, some of the more affluent suburbs as you move farther out. This tells you a lot. This tells you a lot about the success that Joe Biden has had, not only in urban areas with African Americans, but as you move out into the suburbs. 16% reporting. If these margins hold up, this is where the math comes from. You talk about, look, you see right there, you see, what's that, 23,000 votes right there. You come back to the statewide numbers, 30,000 right there. People live in the suburbs, people live in the cities. Joe Biden has had success in the cities and in the suburbs. That is why he's having the success he's having. You come to the places where Senator Sanders is running ahead, the margins are much smaller. So in the eastern part of the state, Detroit and the suburbs around there, if Biden can run it up, Sanders has to do better in the other parts of the states, in the smaller cities. Grand Rapids there, come down to Kalamazoo here. It's essentially a tie, very close. So you can do the math yourself at home. If Vice President Biden is running it up over here, and Senator Sanders may be winning, but by narrow margins in the less populated, smaller, medium-sized cities, the math gets overwhelming. Let's just pop around a little bit more to see how we're doing here. Again, Saginaw, blue collar, 56% to 34%. Bernie Sanders' message the last week of this campaign has been Joe Biden is supported by Wall Street, Joe Biden is supported by Michael Bloomberg, Joe Biden is supported by senators and governors, he's supported by the Democratic establishment. That's not good for blue-collar workers. Well, these blue-collar workers at the moment are rejecting that and voting for the former vice president. You move up here, voting by large margins for the former vice president. So I just pop out. I just want to keep checking. We're up to 24% now. I'm waiting to see if anything comes in Wayne County, but you look at more of the suburban vote in here, 16% in Oakland County. The margin in the suburbs is a big deal, Wolf, as Joe Biden has a big early lead in Michigan.
He does have an early lead in Michigan. We have another major projection right now. And CNN projects that Joe Biden will win the state of Missouri. Joe Biden, the Democratic presidential primary winner in Missouri, 68 delegates at stake. This is his second win of the night. Mississippi goes for Biden. Now Missouri goes for Biden. An important win for Joe Biden. Certainly, they would be cheering at his headquarters right now, but they canceled those rallies on both sides.
This is a surprise, not a surprise that Joe Biden won, but it is a surprise that we're calling it so early, which suggests that Joe Biden won it significantly. This, 4 years ago, was a primary that Hillary Clinton barely won, 49.6% to Bernie Sanders' 49.36%. She barely won a victory. It was basically a wash. I think Hillary Clinton basically got one more delegate. This is trouble for Bernie Sanders, Dana, because this suggests that he, as last week, is not expanding on his base, is not adding to his supporters. He is losing supporters, and people who voted for him last time are actually voting for the other candidate, in this case, Joe Biden.
His whole argument for winning at every single rally where he's extremely consistent is we will expand the Democratic coalition. We will expand the Democratic coalition to the point where we will beat Donald Trump. And what we are now seeing is a very clear pattern of not only not expanding, but contracting. And the person who seems to be expanding his coalition, maybe not the Democrats' coalition so far, but we'll see, is Joe Biden. And it is a very, very big disappointment for Bernie Sanders across the board. We talked the last time we called Mississippi about how frustrating it is for the Sanders campaign, despite putting real effort into the African-American community, that he's not doing well. Well, you can say the same for young voters, which is his natural base. And it's not that he's not doing well among young voters. They still can't get them out in the numbers that they need in order to expand that coalition that he talks about all the time.
And in fact, the percentage of young voters as a part of who is voting today has gone down from Mississippi in 2016 to today, in Missouri from 2016 to today. The percentage of young people has gone down, which suggests, as George McGovern learned when they lowered the voting age to 18, that young voters cannot be relied upon. And if they are the essential part of your coalition, then you might be in trouble.
The one place where it looks like it ticked up a little bit, this is according to exit polls comparing 2016 to now, is in Michigan, where he's been trying so hard. He's been campaigning like crazy in the college towns, big college towns like Ann Arbor, and that is where he really needed to drive up the vote. We'll see when the votes start coming in there.
Yeah, but Wolf Blitzer, not a good sign for Bernie Sanders, given the fact that it was such a close race between him and Hillary Clinton in Missouri in 2016, and it is not a particularly close race between him and Joe Biden in 2020. Wolf?
Yeah, we projected that Joe Biden is the winner in Missouri. David Shelling, let's take a look at the delegates now that we've made this projection in Missouri.
Well, we were able to immediately assign 18 of the delegates. Remember, 68 delegates at stake in Missouri. 18 of them assigned. And you see here, Wolf, with that projection, knowing that Joe Biden's going to have a substantial lead, look at this advantage he gets just in these initial delegates. Biden gets 13 delegates. Sanders gets 5. Still 50 unassigned. But now look at added to the totals of where we are in this delegate race. You can see in delegates to date, Joe Biden just keeps adding to his delegate lead. Now he's at 656 to Sanders 563. Remember, we're still a long way from 1,991. That's what they need to win the nomination. But Joe Biden is piling on his delegate lead. Bernie Sanders, so far, and it's early, is not accomplishing the goal of narrowing that gap Joe Biden's actually extending his gap in delegates over Bernie Sanders.
2 for 2 so far, Mississippi and Missouri. John King, we're looking very closely at Michigan right now, and a big chunk of the vote is beginning to come in, and Biden is doing well.
Yes, and Super Tuesday 2 is off to the worst possible start for Bernie Sanders in the sense that Joe Biden wins Mississippi, he's winning it big. He's leading in Missouri so far by a significant margin, which means proportional rules for the Democratic delegates. This is the biggest prize of the night, the signature race. We're up to 28%. Joe Biden opening up his lead there now, over 37,000 votes. What's happening right here? We still don't have Wayne County. In the suburbs around Detroit, Macomb County now up to 11%, a 10-point victory right there. Again, we're going to go back 4 years ago and just show you Macomb County, essentially a tie, right? Very narrow Clinton win. Blue-collar workers right here. Bernie Sanders' prime argument in the race has been, I'm your guy. If you work with your hands, I am your guy. Voters tonight in Macomb County, Michigan saying, we disagree by 10 points, siding with Joe Biden. You move over here into the suburbs. This has been the formula since Super Tuesday. Out of the South Carolina win, look at Virginia, look at North Carolina, look at Tennessee, look at Texas. Joe Biden wins in the suburbs, runs up healthy margins, Democratic turnout. Bernie Sanders has not been turning out younger voters. Suburban voters have been coming out to play. One other quick point I want to make. This here, Washington County. This is where Ann Arbor is. This is the University of Michigan. Bernie Sanders is winning the county, but 49-47. 4 years ago, he won it by a much larger margin. So Senator Sanders underperforming as compared to 4 years ago when he pulled off a stunning upset.
You got a lead of almost 40,000 votes right now with 28% of the vote now in. Just minutes from now, the last polling places will close in Michigan. That's our first chance potentially to project a winner in that very important battleground state. Our special coverage will continue right after this. All right, we got a key race alert coming in from Michigan right now. That's the biggest prize potentially of the night. 125 delegates are at stake. 29% of the vote is now in, and Joe Biden continues to lead impressively, 51.6% to Bernie Sanders, 43%. Biden is ahead right now by 48,000 votes in Michigan. Let's go over to John King. He's looking at the state of Michigan. All the polls in Michigan will close at the top of the hour, but right now 31% of the vote is in.
And you get to 31%, almost a third of the vote. You get 48,000, almost a 50,000 vote lead. Math kicks in, common sense kicks in, especially, again, because we have nothing yet from Wayne County, which is Detroit, where Secretary Clinton won big 4 years ago. Joe Biden is expecting to win big here tonight. And yet, without any votes from the largest population center in the state, the largest base of the African-American vote in the state, without any votes from there, Joe Biden is nearly 50,000 votes ahead. How is he doing it? Right up here in the close-in suburbs in Detroit. Macomb County, 11%. You see the big lead right there. Move over here to Oakland County. The lead is even bigger. 30,000 votes. 30,000 votes, 25% of the vote in right here. Suburban voters are powering Joe Biden's march at the moment in the Democratic race. Move over here. It's a little bit smaller. You're moving out away from Detroit. But again, in smaller areas, Joe Biden running it up. So you look to where, okay, where is the Sanders blue? Especially when you're down nearly 50,000 votes, you're thinking, can I make this up? Well, Grand Rapids, modest-sized city there. The problem for Bernie Sanders is he's winning, but Joe Biden is close enough, keeping it to within 4 points there. Only 8%. We'll see if those numbers change as we move on. You pop out here, you go back to the map 4 years ago. Kalamazoo was critical to Bernie Sanders' very close win over Hillary Clinton 4 years ago. He's winning, but just barely. Just barely. So in places that Bernie Sanders won last 4 years ago, last cycle, to pull off the upset, he's underperforming, including college towns. We just showed this a bit earlier. I want to check to see the vote is now up to 13%. Washington County, this is home of Ann Arbor, home to the University of Michigan. Yes, Bernie Sanders is winning. He likes to win in and around college towns. He's winning, but he's winning by a very small margin there, 49-47, compared to a blowout in that area, 12 points 4 years ago. So if you look at the map, filling in, Wolf, Michigan right now, Biden blue, that is the biggest delegate prize. Add in Missouri and Mississippi, the Biden campaign is happy.
They certainly are, and we're standing by for more primary results right at the top of the hour at 9 p.m. Eastern. The last polling places close in Michigan. That's our first chance, potentially, to project a winner in that battleground state. Remember, Michigan is the biggest prize of the night, with 125 delegates on the line. That's nearly a third of the 365 delegates being awarded tonight. And Jake, we're getting more votes coming in from Michigan right now. It's looking pretty good for Biden.
It is indeed, and as the results come in, let's remember just how large Michigan looms over the presidential race as a swing state, one of three that helped seal the election of President Trump. Michigan also is very significant for Bernie Sanders. He scored a remarkable upset victory over Hillary Clinton in the Michigan primary just 4 years ago. But this time, he faces Joe Biden and a strong challenge for that white working class vote, which is so key in Michigan. The outcome in that state, with 125 delegates, will likely have a very critical impact on the race. Let's check in with our correspondents first. Let's go to Arlette Saenz. She's with Joe Biden in Philadelphia. And Arlette, we did not expect Joe Biden to be in Philadelphia this evening, but because of coronavirus fears, he canceled his rally in Ohio. But it looks as though he might have a good night tonight.
Well, certainly those first two states that have been called for Joe Biden are welcome news to the campaign. But right now, the campaign is closely watching Michigan, as it has the largest delegate haul in tonight's contest. And it's one that they believe is going to be very close against Bernie Sanders. Joe Biden spent the day campaigning yesterday in Michigan, as well as making a stop there this morning. But the campaign thinks that it's going to be close with Sanders after Sanders had that upset victory over Hillary Clinton back in 2016. And as he has had an on-the-ground organization in the state there for quite some time. But the Biden campaign is hoping that Biden will do well among African-American voters. They're also hoping that Michiganders remember the auto bailout from the Obama administration and hope that that might sway some voters their way as well. But certainly right now, 10 days ago, Joe Biden had never won a presidential primary or caucus. And now, as of today, he's won 13, and they're hoping to rack that up a little bit more.
All right, Arlette Saenz in Philadelphia, Pennsylvania, where the Biden campaign is headquartered. Let's go now to Burlington, Vermont, the hometown of Senator Bernie Sanders, who was once mayor of Burlington. That's where we find our own Ryan Nobles. And Ryan, not so good for Bernie Sanders so far. There are 6 contests tonight. 2 of them have been called, Mississippi and Missouri, both for Joe Biden.
Yeah, Jake, that's right. I mean, at this point, the Sanders campaign, it's a night that they didn't expect on many levels. They didn't expect that Sanders would be back here in Burlington, Vermont so early after being forced to cancel their rally in Cleveland, Ohio, where they expected as many as 5,000 people. And the Sanders campaign is already starting to manage the expectations of what looks to be a very difficult night for his campaign. Campaign manager Faz Shakir sending out a fundraising solicitation to his vast group of supporters, telling them to just be patient with the results here tonight, that it's going to take some time to count the votes in Michigan, which is, of course, very crucial to the outcome, but also to pay attention to some of the states that come in later, particularly in the West, Washington state being among the most important for Senator Sanders, and also a state the campaign believes they'll do well, particularly because of the emphasis that they put on the early vote in the state of Washington. Regardless, though, this is no doubt going to be a night of soul-searching for Sanders and his team as they try and figure out what the next step is for his campaign if they do end up racking up a series of losses here tonight. We do know this, Jake, at this point, and just as you take a look at their posture so far, sending out a fundraising email tonight, they've invested campaign dollars into some of these states that are further down the calendar, and we know by talking to aides that they're very much committed to participating in Sunday's debate. They want a one-on-one debate with Joe Biden and Bernie Sanders. So at this point, don't expect them to make any serious decisions about the future of this campaign in the days to come. They plan to stick it out regardless of how tonight turns out. Jake.
All right, Ryan Nobles with the Sanders campaign, and we should just remind our viewers that there are still 4 races that we have not called yet. Michigan, Idaho, North Dakota, and Washington State. And 4 years ago, Bernie Sanders won all 4 of them. We'll see how he does this evening. Let's go now to Jim Acosta at the White House. And Jim, Joe Biden and Bernie Sanders both canceled campaign rallies out of concerns about the coronavirus, specifically concerns not so much for themselves but for attendees. We were waiting to hear what the president would do. What's the latest there?
Yeah, the latest is, Jake, as you know, other organizations, companies are canceling large gatherings all around the country, just like the Biden and Sanders campaigns did earlier this evening. The Trump campaign announced earlier this evening that they're going to go ahead with an event on March 19th. That's a week from Thursday. They're calling it a Catholics for Trump event up in Milwaukee, where obviously the Catholic vote is very important in the state of Wisconsin, a state the president won in 2016. Asked whether or not this is going to be a rally, a Trump campaign official would only say it's a large campaign event. So it sounds like this is still a work in progress. But, Jake, you can tell this is a touchy issue over here at the White House. Vice President Mike Pence was asked about this during the coronavirus briefing earlier this evening, and he said that these campaign rally announcements and decisions are going to be made on a sort of day-by-day basis. Dr. Anthony Fauci, who is the top infectious diseases expert for the administration, was asked about this, and he essentially said the same thing, although he did add a caveat later on during that press briefing when he said that if organizations or campaigns start canceling these types of events, he's not going to argue against that. And we should also note this was also at the same coronavirus briefing where the vice president defended the president's continued practice of shaking hands, something I suppose he'll be doing at this campaign event next week. Jake.
All right, Jim Acosta at the White House, thanks so much. Let's talk about what we're seeing tonight with Dana Bash. Dana, as we're still waiting for results from 4 states to come in, what are you looking for?
Well, one of the key areas in all the states, particularly Michigan, as we're watching it, is the suburbs and how Joe Biden performs in the suburbs. You know, coming into tonight, the Biden campaign, they were playing the expectations game, just like all campaigns do. And they were saying that if Bernie Sanders did well tonight in Michigan, where he had been campaigning hard, as we've been talking about, did very well 4 years ago, the former vice president was still hoping to walk away with a healthy number of delegates in the suburbs. And one of the reasons is because that's where the Biden campaign and aides say that they believe that typical Biden voters are. They tend to be more moderate. And the other thing about the suburbs, Jake, is that they're beneficial to Joe Biden, not only in a primary, but also looking ahead if he does go up against Donald Trump in a general election. He has to do well in suburbs of, let's say, Detroit and St. Louis and other suburbs in a way that maybe Hillary Clinton didn't do as well as she should have in order to win the White House. And they see that, and they see this as kind of a test case of how that could go.
All right, let's check in now with David Chalian. David?
Jake, we're taking a look at the Michigan exit polls among voters showing up on Election Day. And you just heard Ryan Noble say that regardless of the results tonight, Bernie Sanders is in this to stick it out. If Biden has as strong a night tonight as he had a week ago, the conversation is going to become about party unity and whether or not the party can come together. Take a look. We asked if Biden won the nomination, would you be enthusiastic? 31% of Michigan Democratic primary voters today said they'd be enthusiastic. 40% said satisfied. So 71%, more than 7 in 10 Election Day voters today in the primary in Michigan say they would be enthusiastic or satisfied with a Biden nomination. Look at that same question for Bernie Sanders. Still a clear majority, a substantial one, but slightly fewer people. 39% say enthusiastic, 25% say satisfied. That's 64% compared to that Biden 71% of the Democratic primary electorate today in Michigan saying they'd be enthusiastic or satisfied if Bernie Sanders won the nomination. This is going to be part of the real challenge for the party if indeed Biden starts pulling away, how to stitch it all back together, Wolf.
All right, David, thanks very much. John, what, 43%, 44% now of the vote in Michigan is in, and Biden still has a significant lead.
77,000 votes and change there. One of the reasons that lead has grown is because we do have some votes from Wayne County, about 30%, and this is Detroit, some of the suburbs down this way. 9-point lead for Joe Biden there. 8 points if you round Senator Sanders up there, I guess, but vote count is what you're talking about there. See 7,000 right there. Winning here by a decent margin in the Detroit and the area around it. Winning in the suburbs nearby, including blue-collar Macomb County. Winning in the suburbs here, Oakland County, as you move out. Dana was just making the point a moment ago about the suburbs. If you look in this area here, it's not just Detroit in the suburbs, Lansing in the suburbs around here. 2 flips here in the 2018 Democratic elections. The areas that made Nancy Pelosi Speaker, Alyssa Slotkin, Haley Stevens, their districts are right in here. Guess what it is? Biden blue. More evidence that the suburban voters who made Nancy Pelosi Speaker, Wolf, are turning out for Joe Biden.
Yeah, so far so good for Biden. The last polling places are about to close in Michigan. It's the top prize once again. 125 delegates are up for grabs, and it may have a significant impact on the fight for the Democratic nomination. We have a key race alert right now. Too early to call in the state of Michigan. 125 delegates at stake. Biden and Sanders, too early to call. Right now, 44% of the vote is actually in. All the polling places in Michigan have closed. And Biden is ahead, 78,000 votes ahead of Bernie Sanders, 52.8% to 41.7%. So far, with 44% of the vote is in, looking good for Joe Biden right now. David Chalian, what are you looking for when you see the exit polls?
Well, now we can do a little bit of a deeper dive and look how voters are splitting between Biden and Sanders in certain categories. Let's look at age, Wolf, in Michigan. 65 and older, senior citizens in Michigan. They make up about 23% of the electorate, roughly a quarter of the electorate today in Michigan. Biden wins them by 50 points, 73% to Sanders, 23%. Huge group for Joe Biden. Well, let's flip that. And you see the Sanders success with young voters. Here's 18 to 29-year-olds. They make up about 15% of the electorate. So it's a smaller group, but Sanders actually wins them by a bigger margin than Biden won seniors. 82% to Biden's 15%. This is still very much on Joe Biden's to-do list. Young voters, it's playing out in Michigan. Take a look at voters who want a candidate who can bring needed change. Those voters looking for a change agent, 40% of the electorate in Michigan today. Sanders wins them big time, 61% to Biden's 35%. Sanders winning the change argument with Michigan voters today. And those voters looking for somebody who can unite the country, it's a smaller slice of the pie, 29%, but Biden wins them by a bigger margin. 82% of unite voters, voters looking for a uniter, go to Biden. Only 15% for Sanders, Wolf.
All right, take a look at this, John. 50% of the vote, half of the vote in Michigan is now in. His lead is building, 90,000 votes ahead, 53.1% to 41.8%. Biden has a significant lead.
Biden has a significant lead, and where he has that lead is just as significant, because 91,000 votes now, up to 51%. You're talking about how does Bernie Sanders make up 90,000 votes? Well, you need population centers to do that. And if you look at the open areas on the map where we have no votes, most of them are pretty small rural areas. So where do we have votes? The largest population center, Wayne County. This is Detroit, the suburbs around it, about 10 points right there, up to 47%. So for Bernie Sanders to make up 90,000 votes, this would be the easiest place to do it, except Joe Biden is winning, and winning quite comfortably by almost 20,000 votes right now. Again, I'm going to be a bit of a broken record tonight, but the key to Biden's success since the big win in South Carolina is win where you find black voters in the urban areas, and then win as you move out into the suburbs. That's exactly what's happening again in the state of Michigan. The question was, could he translate what happened largely across the South, Virginia, North Carolina, Tennessee, Arkansas, even in Texas after South Carolina? Could he translate that if you move up into the industrial Midwest? The answer so far in Michigan is yes, yes, and yes as you stretch it out. So Bernie Sanders, how did he pull this off 4 years ago? Well, he pulled it off, number one, by winning big in college towns. Ann Arbor is in here, the University of Michigan, but it's very close. Only 18%. We'll see if those numbers change. But Senator Sanders not winning in these areas by as big a margin as he did 4 years ago. And the math starts to add up when you go into the Joe Biden doing so well in the population centers. Again, in the smaller cities, Sanders winning in Grand Rapids, Kent County, like he did 4 years ago, but only by 4 points or 5 points there. If you round that up, 5 points there, only 8% in. We'll see again. If you're Senator Sanders, you're looking, where can I get votes? Can I engineer a comeback? This is one place to keep an eye on because we're only at 8%. But you move down here from Grand Rapids to Kalamazoo, up to 94% here. This is where the problem comes in for Senator Sanders. You're winning, but not by much. This is an area where 4 years ago he had a bigger cushion, a much bigger cushion against Hillary Clinton. So you're looking at the map. Sanders won 4 years ago in a very close race. He's underperforming in the places that he won last time, and Joe Biden is just doing an impressive job in the Detroit suburbs. One other thing I just want to point out, not a lot of people, but look at the Upper Peninsula. You see all that Biden blue? Still a lot of votes to count up there. You see that Biden blue? Go back in time. Almost all of that was Sanders 4 years ago. So Bernie Sanders, whether you're looking at this by county, whether you're looking at by constituency, underperforming where he was in the race 4 years ago. And the significance here, we're up to 52% now, 92,000 vote lead in the state of Michigan. This is the biggest prize of the night in terms of delegates. It's also, Wolf, the biggest prize of the night in terms of the psychology. Two candidates slugging it out, saying they're the best candidate to go up against Donald Trump. Remember, this is a very painful memory for Democrats in 2016. Donald Trump won it. So the Democratic bragging rights tonight, if you're Joe Biden and you can win Michigan by 10 points or more, that would give you not only a lot of delegates, it would give you bragging rights, the psychology this could be a turning point in the Democratic race.
52% of the vote is in. He's up by 94,000 votes. Jeff Zeleny, you've spent a lot of time in Michigan. You've been looking very closely at the state. What are you seeing?
Well, it's only been a week since Michael Bloomberg and Elizabeth Warren were in this race. And while Elizabeth Warren has not endorsed, I was just talking to a Michigan advisor for the Biden campaign who tells me this. Elizabeth Warren hasn't endorsed anyone in this race, but her supporters are going with Biden. We can see that now. No place more clear than in Oakland County that John was talking about. I spent some time there on Sunday and ran into so many Bloomberg former supporters and Warren former supporters who said it was time to support Joe Biden. So he is benefiting tremendously from an organization that was already on the ground there, the Bloomberg campaign and the Warren campaign. So that is what is helping Joe Biden win this, a stronger majority so far in Oakland County, which is critical around Detroit. So that's what the Biden campaign is counting on tonight. They're certainly thanking Elizabeth Warren, even though she's not officially endorsed. They say her supporters have.
Yeah,
Wolf?
an important point indeed. And I think, John, the Biden campaign, they can be grateful for several of the former candidates who have endorsed Biden.
Well, there's no question. Elizabeth Warren, of course, has not. But the other rally around Biden, again, Amy Klobuchar, Pete Buttigieg, Beto O'Rourke, who dropped out previously, all of them doing that in Texas. Then Biden going on to win in Amy Klobuchar's Minnesota, to win in, he never set foot there, to win in states. Let's go back and just look at that. I mean, 10 of the 14 on Super Tuesday a week ago, that was the big springboard for Biden. And the thing is, he is replicating it again tonight. And to the point Jeff just made, again, almost 100,000 votes. Yeah. We're up to 53% now. Simple math. It just gets hard to overcome a lead that big, even though you still got a long way to go, in part because in Wayne County, the biggest population center, Biden now stretching this out. This was closer earlier. We're up to almost half of the vote there, and Biden with a 12-point lead. But Jeff was just talking about Oakland. You need to win in Detroit, and then you move out into the suburbs here, right? Closer blue-collar workers here, more affluent workers as you move out. Look at this. Look at this. You're looking at 18, 19 points right there. Bernie Sanders was much closer, in much closer competition with these in the populous suburbs. Biggest population centers are your cities, then you move out into the suburbs. This is where the competition is right here. 4 years ago, it was close. Tonight, it is not. And that is the difference. And again, we have seen this in state after state after state, where Joe Biden's formula for success is win in the cities and then move it out into the suburbs. You're seeing it not only around Detroit and in Macomb County here, 10-point plus lead there. You move over to Oakland County, it's even bigger. We're seeing it not only in Detroit, but you're also seeing it if you come up to the Lansing area here. You bring this out here, Ingham County here, 11 points here, and you move around up in here. Joe Biden just anywhere, it's the same formula to success. Win in the cities, stretch it out into the suburbs, including, again, in the Lansing area here, 2 Democratic House seats now that were flipped. They were Republican House seats. The seats, the places that made Nancy Pelosi Speaker are coming out to vote for Joe Biden. We're seeing that in these 2 districts in Michigan tonight. We saw it last Tuesday in the Dallas area, in the Oklahoma City area. This has been a pattern throughout. Win in the cities, win in the suburbs, win in the flip districts that made Nancy Pelosi Speaker. Those are the voters who have decided, as if a switch flipped last week, we want Joe Biden.
And Biden spent some time in Michigan, but Bernie Sanders spent a lot of time in Michigan, canceled some campaigning in Mississippi to go to Michigan, and right now it's not looking very good for him.
And so you cancel in Mississippi. Joe Biden was going to win Mississippi anyway. The whole challenge for Bernie Sanders was try to move the margins. So you skip Mississippi, and look what you get as a result. Again, Joe Biden was going to win anyway, but Joe Biden looks like he's going to get 80% or more of the delegates out of the state of Mississippi. It's 36 delegates. They're allocated by statewide and then congressional district. But if you're winning 80% of the vote, you see no Bernie Sanders, that means you're going to get statewide and the congressional district. So big win for Joe Biden there. Move up the map. Right now, a big win for Joe Biden in the state of Missouri. He's at 51%, and you go up. And then, Wolf, you move up to Michigan, the lead as well. Again, the map filling in just as Joe Biden would like.
And, John, we have a major projection right now. And take a look at this. CNN now projects Joe Biden is the winner in Michigan. 125 delegates are at stake. Joe Biden is the Democratic presidential primary winner in Michigan. So far tonight, he has won Michigan, Mississippi, and Missouri. 3 important states, very significant wins for the former vice president. Jake and Dana, this is what Biden was really hoping for. So far, he's getting what he hoped for.
Yeah, and we've been talking all night and last week about whether or not Bernie Sanders is able to expand his base of support, expand those who are voting for him. And once again, we have a bad sign. This is the worst sign of the night. Bernie Sanders won the Michigan primary, 4 years ago. It was a narrow victory, but it was a surprise. Hillary Clinton leading by double digits in polling 4 years ago. Bernie Sanders won with something like 49.5% of the vote. Hillary Clinton with something like 48.5% of the vote. As with Missouri, which he narrowly lost last time, Bernie Sanders is actually, his base is going the wrong way. He's losing voters. Voters who went for him last time are going for Joe Biden in this case.
And the flip side of this is how well Joe Biden is doing. I mean, Joe Biden, if you look at how well he's doing, and the map behind us, across the country.
It's a lot of dark blue.
Yeah, I mean, obviously we don't know about California yet, and Bernie Sanders did well in the Southwest. But look at the South. Look at the Midwest right now. A lot of dark blue. Dark blue represents Joe Biden. And in particular, where you're talking about a state like Michigan, to your point about Bernie Sanders pulling out a surprise there 4 years ago, he didn't only want to do that this time, he needed to do that. And Joe Biden, it's not necessarily a surprise, but Joe Biden obviously is pulling out a pretty big win. And what that shows isn't just how the map looks broadly, but it also shows the kind of voter that Joe Biden is now able to attract. It looks like across the board, he is doing really, really well. And if you're the Biden campaign, you're looking at that not only as a plus to get the nomination, but looking ahead to a general election where you have a state like Michigan, where the Clinton campaign maybe should have seen the warning signs, considering how poorly she did among some of those key demographics in Michigan that ended up going to Donald Trump. And Joe Biden can look at that right now from the opposite point of view. Hey, I'm strong here.
Yeah, white working class voters, he and Bernie Sanders duking it out for them, and it looks like Joe Biden doing well, winning that fight, at least in Michigan. Wolf?
All right, David Chalian is with us. David, already with this big win, it's a very important win for the former vice president of Michigan. He's going to get more delegates, clearly, and this is going to be a big disappointment for Bernie Sanders.
Yeah, this is not the night so far that Bernie Sanders was hoping for at all. If he was looking for a turnaround, it's not happening yet. Look at this, 125 delegates at stake in Michigan. The biggest prize on the board tonight, Wolf, as you know. We've already been able to assign 36 of those delegates, 20 to Joe Biden, 16 to Bernie Sanders. 89 remain unallocated right now. But as you said, we were able to project this race. If Biden has a substantial victory here, he may be able to get more into his delegate lead. And look, just off the bat, he's already netted 4 delegates. I know that sounds small, but as you're adding through all these states, Missouri, Mississippi, Michigan of the night, Joe Biden is adding to his delegate
let's
lead.
take a look at delegates to date right now with these 3 wins that we've now projected for Joe Biden.
Plus the whole season thus far, right? The 4 early state Super Tuesday. You need 1,991 delegates to win the nomination, Wolf. Now we have Joe Biden. Look at this. At 676 delegates, Bernie Sanders is at 579. That's 97 delegate lead for Joe Biden. He is about to break into triple-digit territory of a lead and perhaps have over 100 delegate lead. That is substantial. That is hard for Bernie Sanders to make up with the way these contests are going tonight. So 676 to 579, Joe Biden is adding to his delegate.
So does that mean Biden is on track to win the nomination right now? Are both of them potentially still on track?
Well, let's take a look. This is exactly a chart that helps tell that story. So look here again. This column here, oh, man. Okay. The first column here, 676 to 579, as I just mentioned, that's the current delegates. Now I want to show you this next column. What you see here is what they've won so far. Joe Biden has won 49.8% of the delegates allocated so far. Bernie Sanders, as a percentage, is 7 points behind him. He's won 42.6% of the delegates so far. That's what they've won. What do they need to get to that magic number of 1991? Look at that third column here. 50.2% is what Joe Biden needs of the remaining delegates, Wolf, to get to 1,991. Look at what Bernie Sanders needs. He needs almost 54%, 53.9%. He has a tougher hill to climb. Now, we should note, go back to that previous column, neither of them have won more than they need as a percentage, if you will. So they are still underperforming where they need to be to get to 1,991. But look at the Joe Biden number. Look at this, 49.8%, okay? to 50.2% of what he needs. I want you to look at that compared to Bernie Sanders. Bernie Sanders has won 42.6%. It's like an 11% differential here. He needs 53.9%. He is significantly underperforming right now in the delegate race of what he needs to be doing to be the Democratic nominee. Joe Biden is getting close to being right on track with his performance and what he needs. This is significant and tells the story of why Joe Biden, Wolf, is on the march to the nomination at the moment, and Bernie Sanders is not.
Yeah, Bernie Sanders worked hard for Michigan, not happening for him tonight. Anderson.
Wolf, thanks very much. Really a major win for Vice President Biden, Governor.
A huge win. Yes, I'm so happy about it. And I think it tells you a little bit, if you look forward, about what it means about the general election, the kinds of voters that he was able to get in this primary. You know, it is true that Sanders previously had done so well in Macomb County and with white, non-college educated voters and in conservative parts of Michigan. It looks like Joe Biden is running the table, even getting close in a county like Washtenaw County, which is the county where University of Michigan has, and Bernie Sanders had a massive rally there. So it tells you going forward that there's a huge chance that he can put together a coalition like the Obama coalition. He's got more work to do in some pockets, obviously with Hispanics, with young people. But I just think that this is a great signal going forward that people are ready to put somebody in there who is going to beat Trump.
Yeah, let me say, this is a very bad night for Donald Trump. He is watching
bad
these
night
returns.
for Donald Trump.
And what Joe Biden has been able to build this coalition, which I've been talking about for a long time, not only the African-American community. He won women by 20 points tonight in Michigan.
Tell it.
Tell it.
Come on, Terry.
Yeah. He won women in Virginia by over 60%. That is a warning sign to Donald Trump. The biggest gains we had after 2016 to win those House of Representative seats are the places that people are showing up to vote in these primaries. Yeah. Joe Biden is bringing them out. He is building that coalition. I'm so excited. I mean, we now have the United States Senate in play. Why did Steve Bullock decide to run in Montana? Because he thought with Joe Biden at the top of the ticket.
Exactly.
We are moving. So we as Democrats got to come together.
Yeah.
We got to take on Trump. We got to keep our focus on
and
Trump.
Those suburban women, man, I think a lot
Doctor,
of
I mean, you're obviously you're a Sanders supporter. Is there a path ahead?
Obviously, disappointing night. I mean, the campaign pulled out all the stops, brought in the Reverend Jesse Jackson, which was a huge win. But I will say, in order to build that kind of coalition, let us not forget that the ideas that Bernie has been running on for the past 4 years plus, these ideas are ascendant. Government health care, fundamentally changing our economy. And the reason why they're so ascendant is because these are the ideas that young people are voting for. And I will say, if we want to beat Donald Trump in 2020, we've got to think about how it is that we embrace the ethos of these ideas, how we speak to the pain that a lot of young people are facing, how we speak to the challenges that are facing us, the fact that we've got climate change barreling down on us, and the fact that too many people, like think about the context of coronavirus, too many people are worried about what will happen if they get sick or a loved one gets sick.
But I mean, just for viewers who are watching at home, I mean, does this race continue between them?
I think like every candidacy, we've got to give the candidate a chance to make their own best decision. And there are a lot of good reasons why Bernie Sanders might want to stay in and be able to make the contrast with Joe Biden on the debate stage. And I think he's been really, really strong in these debates. There's ample reason why. And there are more states left to go, but this is a big blow.
Bernie Sanders was on television on Sunday, and he said, "I'm not a masochist." He said, "I will not stay in this race if there's not a path." You look at the 4 states, big states that are going to vote next week, almost 600 delegates, and he didn't win any of them. Most of them he lost by significant margins 4 years ago, and he's clearly not improving on his performance from 4 years ago. So, look, I've been on the winning side and the losing side of campaigns. It is a painful thing to have to reconcile with these numbers. And I think it's important how this ends in terms of rallying those young voters who are going to feel a little bit disenfranchised by this. But if you're making a judgment based on the numbers, it clearly, the numbers are dramatically bad for Bernie Sanders at this point.
Well, and if you look at the story from 4 years ago, Michigan was the place that kind of resurrected Bernie Sanders and started him on a real trajectory. And there was a sense he could stop the Clinton train. God, he was going to stop the Clinton train. And then now, here we are,
Not so much.
and Bernie Sanders is stuck. It wasn't so much that Michigan was going to be his firewall, but it was going to be kind of the backstop in case things didn't go so well on Super Tuesday. And things didn't go so well on Super Tuesday. But it turned out that he couldn't put together that kind of coalition that he really needed. And I think it may not be the end, it may be the beginning of the end, but Bernie Sanders is a realist and has said, to his credit, over and over and over again, he wants to unite the party because he wants to defeat Donald Trump. And if you look at the results in Michigan, where Joe Biden, was winning he's still not winning with young voters. Let me point that out. As Abdullah is saying, did not win with young voters.
Getting creamed by Sanders.
Getting creamed by young voters. But the places where he's had problem with white, non-college educated voters doing well with those voters. So you have to wonder whether this is a signal.
Let me just say I think this is a very dangerous moment for the Democratic Party. You have now an insurgency that's about to be defeated. What do you do with the people that you defeat? There was a hope on the part of a lot of young people they had a champion. You got young people who are graduating with $250,000 in debt. You got young people with a lot of pain, and they had a champion. Mm-hmm. And that they thought that they were going to be able to surround a divided establishment with their movement, crush that divided establishment, and move forward. Instead, the establishment united and stopped them. Now what do? Last time Bernie Sanders got beaten, there was an assumption that all these people were just going to fall in line and vote against Trump, and there was not enough care for the concern and the pain of his base. I think tonight there's going to be a lot of crowing, a lot of relief on the part of the establishment, but temper it and turn to those people and say, we want to be your champion. If you don't do that, you're going to have a Pyrrhic victory.
There were a lot of Sanders supporters in key states who did not end up voting for Hillary Clinton.
Yeah. That's exactly my point.
Right. I agree. Biden should pivot to the general and reach out to young people in particular who supported Bernie and let them know, I'm going to be your candidate. And that he understands the fact that we have left the next generation a real house of cards in terms of a path forward. College being 250% more expensive. Most jobs are temp gig or contract jobs that don't have health care benefits or a path forward. Joe has not done an excellent job of making it seem like he relates to young people in those situations. So he or his surrogates have to make that case very, very quickly that he's going to be their candidate too.
At a rally the other night, he had some hecklers, and they were either Sanders supporters or he thought they were, and people were trying to take them out of the stadium, and he said, no. First of all, I'm not Donald Trump. We don't do that around here. But secondly, he said, I need you to come into the party. He needs to do more of that in a more direct way, not just offhandedly.
But it's not just those gestures, though.
Right.
It is understanding that these kids are driven by ideals.
Yep, and ideas.
I mean, they have a vision of a country in which you can get an education without taking on this ton of debt, where you can get health care as a right, where inequality is not a growing reality that no one seeks to address. They have real ideals, and the important thing is not just to embrace them, but to embrace the ideals. You may not embrace Bernie Sanders' recipe for how to deal with them, but you need to at least address the spirit of their concerns.
On some of the numbers that are coming out of Michigan, I think there's two interesting points, which is that white men shifted. They supported Sanders in Michigan in 2016 by 62%, and now they've moved. Biden has slightly edged him out in certain places. He still has a little bit of the edge with white men in Michigan, lost them in Missouri. But I think that from 2016 to now, there was an anti-Clinton sentiment that appeared to really help Sanders. He hasn't been able to deliver young voters in the way that he wanted to, and his campaign has acknowledged that. And they, in the last week, said that they were trying to do more outreach to older voters. Congressman Khanna, who's a co-chair of Sanders' campaign, actually said that I think that we need to distinguish more. Our attacks on the establishment mean attacks on, quote, special interests, on insurance companies and the like, and praise where the Democratic Party has helped make great strides. So it'll be interesting to see if Sanders stays in beyond tonight, and there's no indication that he won't so far, how he tries to change that message heading into states like Arizona and Florida.
Joe Biden scoring 3 impressive wins so far tonight, adding to a string of victories. We're standing by to hear from the former vice president. That's coming up after a break.
We're standing by to hear from the former Vice President, Joe Biden. He's getting ready to speak. We'll, of course, have live coverage of that. David Chalian, he's the winner in Mississippi, Missouri, and Michigan, 3 important states, and he clearly has done very impressively.
Hugely important. We have 3 more states to go, of course, but hugely important states for Joe Biden. Take a look. I want to show you, Wolf, where we are in the vote counting and what that may mean for delegates. So take a look first in Michigan. You know, there are 125 delegates at stake. You see Joe Biden, 53.1% of the vote. He's got 116, almost 117,000 vote lead over Bernie Sanders, who's at 40.7. Now, remember, you need to be above 15% to collect delegates statewide and above 15% to collect congressional district-based delegates. Obviously, Bernie Sanders is well above the 15% there, but that 13 percentage point spread, it means that Joe Biden, with 55% of the vote in, and remember, this is going to change as the vote comes in, is going to get the lion's share of those 125 delegates. They're not going to split evenly if you're winning 53-40. Take a look at a different picture, more substantial for Joe Biden, over here in Missouri. 68 delegates at stake. Joe Biden at 57.1%, 26,000 votes ahead of Bernie Sanders, who's at 28.4%. Now, it's only 11% of the vote that is in so far in Missouri. We've projected, of course, but it's not as big of a delegate prize as Michigan. But look at that. That's a 30-point margin for Joe Biden in Missouri. He's going to get the lion's share of that 68 delegate prize.
What about Mississippi? Because Biden has also won in Mississippi.
So take a look here in Mississippi. This is the most dramatic example of all. Look at this. 80.1% with 15% of the vote in Mississippi. That 31,000 vote lead over Bernie Sanders has Sanders down at 15.4%. Well, he is just barely above the viability threshold to earn any of the statewide delegates out of Mississippi. So far, we've only awarded delegates in Mississippi to Joe Biden because of precisely this. We have to see if Bernie Sanders will get any of the 36 delegates out of Mississippi. Wolf.
All right, thanks very much. You know, John, as we look at this, impressive so far, still 3 more states to go, but so far 3-0 for Biden.
Well, let's put an exclamation point on 3 more states to go, especially if you're a Bernie Sanders supporter or working in the Sanders campaign. He simply now must win Washington State. It's the second biggest prize of the night. We're still waiting to get votes there, obviously, as we go west. Bernie Sanders is being shut out at the moment. This is a prize he won 4 years ago. He very much needs to win it here.
89 delegates in Washington State.
89 delegates there. Now, these are smaller delegate prizes, but if you're Bernie Sanders and you're seeing Joe Biden stretch out that lead, you need wins and you need delegates. 20 of them in Idaho. Bernie Sanders needs to win in Idaho, and then North Dakota, only 14 delegates at stake. But if you're in the Bernie Sanders campaign, or if at home you're a Bernie Sanders supporter, you're watching what's happening in Mississippi, Missouri, and Michigan. It's a painful night, a very painful night in terms of the margins and the math. You definitely need these 3 contests. So we have a ways to go in the night. We've had elections that swing before. We'll see if Senator Sanders, who has a history, remember, go back 4 years ago, has a history of doing very well out in the West and in the Plain States. So history, if Bernie Sanders can repeat it, maybe he can at least ease some of the pain with some wins out this way. And it is painful, Wolf. There's no other way to put it. Sanders had a big upset in Michigan 4 years ago. Joe Biden with just shy of a 13-point lead at the moment, 117,000 votes and change, 56% of the vote in. Just look at the map. I'm going to turn this off here. You see the congressional district lines. I had over that. I'll come back to that in a minute. But just look at 4 years ago. See all the Sanders light blue up here, Sanders light blue throughout the central part of the state. Come forward now. It is almost all Biden blue. This is just a stunning turnaround in the state of Michigan. Joe Biden going into the state that Bernie Sanders won 4 years ago. Bernie Sanders says he's Wall Street, he's corporate, he's establishment, he's not for you, the blue-collar guy. The colors tell the story. The voters of Michigan just deciding, again, Wayne County now up to 17% of the vote, 13-point lead there, just a little shy of that 12 and change. In the city, in the suburbs right around Detroit, Macomb County, a 10-point win. Blue-collar battleground right here, the place that gave us the name in the study of Reagan Democrats. Oakland County, more over to the suburbs, an even bigger win there. Just the formula for success that we saw in Virginia, North Carolina, Tennessee, down into Texas, repeating itself in the state of Michigan tonight. Missouri used to be a battleground state in presidential politics, now a red state come general elections for the most part. We'll see if anything changes this year. That's most unlikely. But just take a look again. Take a look again. One county of Bernie Sanders. And this matters. This matters when you get to the delegates. Not only is Joe Biden winning big statewide, but he's winning where the population centers are. Democrats award more delegates in the areas where you have a higher African-American population. In St. Louis City, Biden winning there. Move out to St. Louis County. Again, look what happens when you go out to the suburbs. Just look what happens as you start moving toward the suburbs. The Biden numbers go up. You move out even more. Let's come out here to St. Charles County. St. Charles County is a place that Bernie Sanders actually won 4 years ago. More affluent, suburban area outside of St. Louis. Bernie Sanders won it 4 years ago. Not this time. Joe Biden's suburban success has been key as you go through the map. And then if you come just down, pull it back out to the other win tonight down here in Mississippi, again, you can see just surrounded. And that is a blowout. And again, Bernie Sanders, after 2016, spent a lot of time courting black voters, a lot of time courting Latino voters. If you look to the western parts of the country, Nevada and California, it has worked among Latinos. Sanders has been performing better among Latinos, among African Americans. Wolf, you just look at this map right there. This is the heart and soul of the Democratic electorate, African American voters in the Democratic primaries. That is all Biden blue. That's a big night.
I'm just curious, how much better is Joe Biden doing in Missouri and Michigan compared to how Hillary Clinton did against Bernie Sanders 4 years ago?
It's an excellent point because you get into, now we have essentially what we had in 2016, a two-candidate race. We have that now in 2020 that just about everybody else has dropped out. Tulsi Gabbard's still effectively in the race, but she's not polling well anywhere. So look at this, look at the margin here, right? 18 points right there. This was a very close state in the margin, in the decimals. So a very close race 4 years ago, not close at all. Not close at all now in the state of Missouri. Move up to Michigan. This is where we are right now. 12-point lead and change for Joe Biden, nearly 120,000 votes right there. 4 years ago, about as close as you can get right there. And so that's the statement that Joe Biden is making tonight. One, you're winning by big margins. Number two, that gets you more delegates. Number three, if you pull out the map and you come forward to 2020, we all know, come November, the campaign is going to be fought here. Pennsylvania, Ohio, Michigan, Wisconsin, Minnesota, states that either Trump flipped or were very close when you go back 4 years ago. Michigan, we all remember very well. Bring it up. You go back, you bring it up here. This is one of the reasons Trump is president, right? And the weaknesses we saw in Hillary Clinton and Bernie Sanders' win 4 years ago in Michigan started to show us Hillary Clinton's weaknesses with those
by 10,704 votes.
10,000 votes, right? And so then you move over here to Minnesota. 44,000 votes there. The Trump campaign believes it can put, interesting to see a lot of the Trump campaign calculations based on the economy of a few weeks ago, in the coronavirus and all the turmoil we shall see. But Joe Biden can now make the case to Democrats in the industrial heartland where Trump won the presidency, I'm the more competitive candidate. Doesn't necessarily translate to the general election, but that's the argument he can make to Democrats right now.
Key battleground states. Anderson, back to you.
Wolf, John, thanks very much. Andrew Yang, I see you've been writing on your paper a lot. We haven't heard from you a little bit. You haven't. Where do you see the race right now? Where do you see this going for Joe Biden?
I believe that Joe Biden will be the Democratic nominee. And I've always said I'm going to support whoever the nominee is. So I hereby am endorsing Joe Biden to be not just the nominee for the Democratic Party, but the next president of the United States. And I say this, having supported Bernie Sanders in 2016, Bernie was an inspiration for me, inspired my run. But the math says Joe is our prohibitive nominee. We need to bring the party together. We need to start working on defeating Donald Trump in the fall. I've had many personal conversations with Joe about the impact of the fourth industrial revolution on the middle class. I believe that he's the right man for the job to help us not just defeat Donald Trump, but govern the country in the years ahead.
And the question is, I guess I have for you, is what does he need to do to bring the Yang gang and the Sanders folks to him?
And what do you say to your supporters who might support Sanders? Let's go.
What I'd say is that we need to start doing the work of improving Americans' lives on the ground, because too many Americans have seen their way of life disintegrate over the last number of years. And Bernie has been calling out those problems and tapping into the frustration in the right way. And so if Joe says this is going to be a return to business as usual, he's in danger of losing many of the young people that came out for Bernie that supported my campaign. He has to show that, look, we know that this economy is not working for many, many Americans, millions of Americans who feel left behind. And you can't just say we're going to swing the pendulum back to the Obama-Biden years. We have to actually start doing the work that activated people to vote for Donald Trump, that activated people to get out for Bernie Sanders. I believe Joe is open to that message. His heart's in the right place. He's a really, really patriotic, public servant, decent man. He wants to do right by the American people. To me, a lot of it's about getting real solutions in place that more and more Americans feel like will actually improve their day-to-day lives.
Have you had conversations with the Biden campaign about endorsement?
I have. Joe called me last week. We had a really great conversation, and it was hard to say no to Joe at that time, but I have such admiration and respect for Bernie, what he's meant to so many Americans. I think Bernie has called out the real problems in a very powerful and necessary way. So I wanted to let the democratic process play out, and I believe it has. At this point, you can see very clearly that Biden is building a delegate lead that's only going to grow in the days ahead. And so we need to come together as a party starting tonight.
What would you say to Sanders supporters who, obviously are going to be unhappy if Sanders drops out of the race? For you, as it is, as Senator Sanders has said himself, defeating Donald Trump trumps all of that.
I would say I get it. And that I believe that Joe gets it too, even though you may not feel that in the same way. I get the frustration. I get the desire for a revolution. I get the fact that it seems like our institutions are failing us right and left. I get all of that. It's why I ran. But we have to defeat Donald Trump in order to make progress on the climate, on any of these problems in a bigger way. And you have to believe that Bernie and Elizabeth and I and other people will have a voice in the Biden administration to start solving these problems.
This is what Andrew's saying is the dynamic you're going to see set in the next few days. The person who looms largest in this Democratic primary process has been Donald Trump. And a lot of Democrats have been searching for the candidate they think has the best opportunity to beat Trump. And Biden emerged as that candidate when Bloomberg faded away and so on. And now the verdict is clear. The danger is not to continue the primary if you're Biden in your own head and make the turn to the general election and give people a sense of enlistment in this cause of restoring decency and the other themes that he is so comfortable. He was great in South Carolina on this. He needs to strike that tone tonight more than a triumphal tone
that's what
about
you want to
winning
hear
the
tonight.
primary. Yeah.
Yeah, and I think he needs to draw a distinction with Donald Trump. He has to take a turn and start acting like a president, because now people will start comparing him to the person who is in the Oval Office. And that will be, for example, on how you would handle the coronavirus. If you had been in the Oval Office, would you have gotten rid of the office that would have been in charge of this in 2018 if you had been president? Would there be more testing now? What would you be doing right now if you were president of the United States? I think you have to give people an opportunity now to look at you as president and compare you to Donald Trump.
But I would not do that tonight.
Not necessarily.
Van, go ahead.
You can do both.
Hey, listen,
You can do both.
I think his main appeal, Biden, is that he wants to bring the country together and heal it.
Yeah.
And I tell you, when you got a pandemic going on, somebody who's a healer has a lot of appeal. But the first thing you got to do is bring this party together. If you want to bring America together, your first test of that is, can you bring this party together? And I'm going to tell you right now, as happy as a lot of people are up here tonight, there's a lot of people whose hopes have been crushed tonight. I don't think a lot of people get it. There are people who they don't know how they're going to make it. They're in the gig economy. This whole pandemic has thrown them completely out of work. They can't go from point A to point B, and they don't see the passion yet from Joe Biden for their pain. They don't trust him yet to fight till the last dog barks for them, and they trust Bernie Sanders to do it. If Bernie's going to be ushered off the stage tonight, and Biden's going to stand up there, he's got to pull those people close to him. And the empathy that he has for everybody else, he's got to have for these Bernie kids.
We got to take a quick break. We're going to have more, and we're waiting for Joe Biden to speak. We'll be right back. And we're waiting to hear from Vice President Joe Biden. He is going to be speaking in Philadelphia. We'll obviously bring that to you live any moment on what has been a very good night, a decisive night for him. Governor Granholm, just before the break, Van Jones was talking about what Biden needs to do in terms of reaching out to the pain and stepping into the pain of many supporters of Sanders, who are not only heartbroken that there's not a path forward for him, but also just the issues that he has championed.
Right. I mean, Van is so great about speaking their pain, and I really appreciate that. And Andrew, for you to say the same thing about yours, and Abdul, for you to say it as well. And I just hope that all of the people who have been Biden supporters, like Terry and I, are aware of this, hear this, see this, and recognize that there will be a period of grief, no doubt, that will ensue, and that there has to be a really overt way of reaching out to young. I mean, I think of my family, my kids are all Sanders kids, and I have no doubt that they are feeling really angry and frustrated and don't know exactly how to channel that yet. So for all Biden supporters, I think it's really important for us to take it upon ourselves to reach out and say, we want you in our movement to help to shape this election.
There's still a debate on
He's
Sunday
not dead yet.
between these two.
Candidacy is not dead.
What should Sanders do in that? I mean,
Well, first of all, Senator Sanders is not out of this race, so nobody should assume he is. I remember in 1992, Paul Tsongas got out of the presidential race. He was out of the race, and he ended up winning a primary a couple weeks later. I mean, he's not out, and no one should assume. But let's assume he does get out. I agree with Jennifer. Biden has to have a campaign that reaches out. This is not the first time. We've all been in races. You win some, you lose some. You got to reach out to the other side. You got to bring them in. I remember 2008. I was chairman of Hillary's campaign. The day after the election, Barack Obama called Hillary, called myself. We met with him immediately. Then the three of us actually did a huge rally, if you remember, in Washington. There are practical ways the campaigns will come together. The other thing is, how do you reach out to the folks who you got to bring in for the general election? But I will say this for, everyone's saying he's got to do this, he's got to do this. We should, if he does end up getting this nomination. It has been very impressive what Joe Biden has done.
Agree.
This is the fastest nomination we have seen since 2004. Much quicker than Barack Obama, much quicker than Hillary Clinton. He coalesced a lot of people. Now, this is about addition. But, folks, we should understand what Joe Biden has been actually able to put together. This is a very quick nominating process.
I do, I want to provide some context for this. I was in Grand Rapids for the rally with Bernie Sanders and Reverend Jesse Jackson, and a young man came up to me and said, look, I've taken $100,000 in debt. My parents just lost their jobs, and I don't know what I'm going to do with health care because I was covered through them. Mm-hmm. That's the reality in which so many people in our country are facing. And if we're not serious about solutions to those problems, if we can't speak to their pain with a level of empathy and a level of respect, I worry a lot about what it means to beat Donald Trump. Now, we lost Michigan by 10,000 votes in 2020. And in some part, it was because there was this assumption that on the left, we did not see that pain. We've got an opportunity to come together and say, we understand and appreciate what that looks like. We have real, tangible solutions to solving it. And a vote for us is a vote for a future, not the past. Because for a lot of these young people, that past was the moment in which they saw the crags showing on the cliff of where we were headed. So the last point that I'll just make on this is that right now, we have an opportunity. Whatever happens in the next week or so, we have an opportunity to choose what we will take forward to take on Donald Trump. I think everybody recognizes the existential threat that he poses to our democratic norms. I mean, we see it with coronavirus every single day. But if we're more focused on beating a Bernie Sanders or beating down the will of young people, right, and telling them, see, we were right all along, I worry that the focus will be this primary rather than the general.
Yeah. Well, and don't forget, in the debate coming up, they're going to have Bernie Sanders taking on Joe Biden, and he's been doing it very frontally these days. He hasn't been just saying, oh, I'd like to beat him. He's been talking about issues upon which they disagreed, not only health care, but he's talking about his vote on the Iraq war. He's been talking about trade. He's been talking about Social Security. And he and Sanders, of all things, have gotten into a Twitter war over the question of whether, I know that sounds weird with two septuagenarians, but they've been getting into a Twitter war over who, Sanders saying that, or intimating that Biden would take away your Social Security, and Biden saying, let's get real, Bernie. I'm never going to do that. That's going to continue for a while until it doesn't anymore. And maybe the math, as Andrew points out, is there. But Sanders, I believe, is going to continue until he decides, as he said, he's not a masochist and doesn't want to do it. So I think part of it is up to Bernie Sanders as well, and the way he decides to proceed going forward.
You know, I just think back to 2008, and everybody has kind of a romanticized idea of what happened back then. That was a hell of a tussle.
You bet.
And it went on for quite a while.
Till June.
And there were some real blows landed.
Yeah.
Some of them on some of the same issues that these guys are debating about, like the war in Iraq. And yet there was a coming together. I think that the longer the period there is to effectuate that. And let me suggest that I think that one person who may be important in this process is AOC. She has emerged as a really important figure among these young Americans who are yearning for real serious solutions to these problems, and yet she's shown herself to be a very pragmatic yet principled figure.
We've also never seen a situation like this, certainly in modern times, in terms of a potential pandemic influencing the next couple of months in a way that's kind of hard to even imagine. I mean, obviously there's the difference on healthcare between Sanders and Biden. But if hospitals are overwhelmed, if the military is called in, if
There's
people
no
are
rallies.
being triaged in school gymnasiums on respirators or whatever, however bad it may get, and let's hope it doesn't.
Nothing makes you appreciate a functional government like a global pandemic.
Right.
Yes, I've always said that.
Yeah, no, that's
No, you're right.
But I mean, none of us. There's very few people who have seen what happens when a society, has the potential to really burst at the seams.
Yes.
I mean,
Joe Biden's argument has been about sort of a return to moral normalcy, but it's also going to begin to look like a return to competence, because Trump and the Republicans have been running the government in sort of an anti-government frame, which is not what you want when you're dealing with a health crisis. And we all know when Joe becomes our president, he's going to bring back many of the Obama alums who are really, really competent and technocratic, and that there's going to be real hunger for that in the days to come among many, many Americans if the coronavirus crisis continues to grow.
Well, it's also an issue of trust in government, because we've been hearing for the last couple of years everything about how you shouldn't trust your government, how you shouldn't trust the CIA, how you shouldn't trust the FBI, and on and on and on. And now people are looking to the government to help. And post 9/11, before 9/11, trust in government was low. After 9/11, if I recall, trust in government went up because people saw first responders. Who do first
Depends
responders?
on who you were.
Well,
in my community, trust in government didn't go up.
Well, but
because we were being surveilled and assumed to be terrorists.
But-
And the point that I'm making here is that this idea about moral normalcy, right? It hasn't always benefited everybody, right? We've got to be serious about the fact that we have one of the most unequal moments and one of the most unequal high-income societies in the world. And fixing that means taking on, not going back, but taking on those challenges and being full-throated about what the solutions look like. And I think it's important to remember
finish her thought.
Well, my point was, that the polls did go up, and maybe it was pockets in which it didn't, and I will grant you that. But people saw the way first responders reacted, running into the flames, and trust in government and trust in your state officials and your local officials really skyrocketed because people had to turn to them to provide services. And that is going to be part of the debate.
Just one thing to add is that, you talked about the impact on the election. I think you mean in terms of like the issue set, but there's also physically, how are people going to go to the polls could become an issue as well. And I think that one of the things that Democrats should jump out on, and I think Biden has a chance tonight, people need to be able to vote from home. One of the reasons why you didn't have as much disruption in places like Washington State is that people were able to vote from home. So even though you've got a big pandemic happening in Washington State, the election proceeded because people could vote from home. That's not true in all the other states. If we're going to be in a pandemic environment in 2020, everybody's be able to vote from home.
And that's not just a Democratic issue. That's Republican, Democratic.
Yes.
That's just an issue of safety.
From a vote by mail, Van, you know why. I'd love to see it in all 50 states. You know why we don't have it in 50 states.
You know, from a
this is voter suppression. It's holding folks down. We got to make it easier for people to vote. You saw in Texas the other night, people waited 7 hours in line to go vote. It's disgraceful. This is the greatest democracy in the world.
As a strategic matter, when you look at a candidacy, you look at the comparative advantages of your candidate as they match up with the weaknesses of the person that candidate is running against. And when you look at Joe Biden, the most salient qualities that he has are empathy, decency, humanity, connection, and that is a real deficit for Donald Trump. You could argue that that's the one that bothers people the most. And the other one is that the result of tweets and tantrums and feuds is this chaos that reigns around him. And now the price of that chaos is becoming more apparent. And I think that is a real problem for him in this election. So, yes, I think Biden has to stress competence, but I also think he needs to stress what is the qualities that people most identify with him, which is just the thoroughgoing humanity.
It's true
that I just wanted to go back to the debate amongst Democrats about how Biden could potentially win over Sanders voters. His campaign has noticed, of course, that Sanders does well with young voters, but also that Sanders has done very well so far with Latino voters. And Biden's campaign is starting to invest more money in the Latino community. We're about to head to states, Arizona and Florida, where there's big Latino populations there. And so he's realizing that in order to win over some of those voters, either to make a dent in Sanders or also to try to bring them over to his coalition, he has to speak to them more directly, because that is a weakness for Biden in that area. He has not been talking to them. And again, it comes down to policy, because Latinos in states like California, in Nevada, also in Arizona, they are very distrustful of the government because of deportations. They saw that under the Obama-Biden administration. So it'll be interesting to see how he's able to bring them into the fold and speak to them more directly.
If I can piggyback off of Laura's point, I think there's a really important thing to recognize here. I have no doubt Joe Biden's a good man. He's got decency and empathy in droves. And you love the picture with the aviators and the ice cream, right? But the question is, can he see outside of his own experience? Can he appreciate that the game has changed tremendously for a lot of folks, and the things that are on the line, the givens that used to be the case when he was a younger man, in the moments when he was in his prime, that those givens aren't really there for a lot of folks anymore. Back in his day, you could go to college, get a great university education, and in the summers, you could make back all the money that you needed to be able to pay your
I've had conversations with Joe. I think he gets it. It's one of the things that I found compelling is that, there's Joe, and then when you talk to him in private, he understands that we've set up a really rough path for many, many people that is different than when he was growing up.
I tell you the one thing I love about Joe Biden, he listens. I mean, you can sit with him. I've spent a lot of time with him recently. He will listen. He will act on the things you want. So he doesn't go in predisposed against anything. So he's open to suggestions.
Terry,
the message has to respond.
I said anyone who sits with you listens.
I just want to see the message reflect that, right? The message embraces that and engages that. Because, when you point to Kamala Harris and Cory Booker and say, you're the future, those folks are both in their 50s, right? There's a very different future that's many years younger. And if you're not engaging them and saying, hey, look, right, you need a seat at this table too, because your experience is fundamentally different than even those who are 20 years older than you, I just feel like it's incomplete. And so there's an opportunity here, I think, to be grand in a message and to be embracing of those folks.
And there's an opportunity for the Sanders.
Anderson, thanks. All right, let's recap with a key race alert right now. Very good night so far for the former Vice President Joe Biden. He is the winner. Major win in Michigan right now, 125 delegates at stake. He's the winner in Missouri. Joe Biden wins in Missouri, 68 delegates at stake. He also won Mississippi, 36 delegates at stake. North Dakota, too early to call between Biden and Sanders. No projection yet. Coming up at the top of the hour, two more states, Washington State and Idaho, will be able potentially to make projections there as well. Washington State, a very important contest right now. Let's go over to John King, who's watching all of this unfold. Missouri, very important, but Michigan, even more important, given the fact that Biden spent a lot of time there. He was trying to win the state, and Bernie Sanders was trying desperately. Didn't work.
A Super Tuesday 2 thumping at the moment. You're right. We're waiting for North Dakota, Idaho, and Washington State. Bernie Sanders has a chance to rebound, but smaller delegate totals out there. If you look at where we are right now, especially in the signature race of the night, the largest prize of delegates, the battle for the industrial Midwest, if you will, 125 delegates at stake. Look at this lead, a 13-point lead for Joe Biden, 137,000 votes and change, and a lot of Biden blue in a map. If we go back 4 years ago, this was a big moment for Bernie Sanders 4 years ago. Look at all that Bernie blue from 4 years ago. This is a Biden thumping in the state that both candidates said was the most important prize tonight. 62%, 13-point lead. Again, you come into Wayne County, in Detroit, your inner city, we're up to 77% now. 13 points right there for Joe Biden. Big win in the city, what he's been doing. Come out here, Macomb County, signature studied county in American politics, going back to the Reagan days, so-called Reagan Democrats, blue-collar workers who switch over. Trump Democrats, you might call them now. Trump won Macomb County 4 years ago. Joe Biden making a statement, again, blue-collar workers here, 10-point-plus win, 11-point win there. And then again, you move over into other suburban areas. This has been Joe Biden's success since the big win in South Carolina. Go across the states he won last Super Tuesday. Go across where he's winning tonight. Get out into the suburbs. You start to see big leads like that. Just pop it back out again and look at Michigan. Look at all that Biden blue. Look at all that Biden blue. You have Bernie Sanders winning in some of the smaller cities, Kalamazoo, for example. But look, very narrow margin. In the places he won 4 years ago, Grand Rapids as well, Kent County, 4 points there, a little less than 4 points there, 3 points. So as you just see, in the places Sanders is winning, they're narrow. In the places where Biden is winning, he's running it up. That's the big prize in Michigan. Then you get into delegate math, right? So if you just start here with 53%, number one, you're going to get your share of the statewide delegates at 53%. Number two, look at all the Biden blue. When you lay a congressional map over that later and you're doing the congressional delegates, it tells you Biden's going to get the bulk of the delegates there as well because of all that blue. It gets even more pronounced when it comes to the delegates and the congressional districts when you move into these other states tonight. You cannot find Bernie Sanders blue on the state of Missouri right now. Only a third of the vote counted. We'll see if it changes, but Joe Biden close to 60%. Sanders at 32.5, round that up to 33. That again, 68 delegates at stake in Missouri. A big chunk of those are going to go to Joe Biden in a state. Look at that margin, 17 points. Again, go back in time 4 years ago. Hillary Clinton just barely won Missouri then. So Joe Biden overperforming in Michigan compared to 4 years ago to Clinton, beating her performance in Missouri. And look at this in Mississippi. One of the questions here is, can Senator Sanders stay above 15%? That's your basic viability. You need to be above 15% statewide to get delegates. Again, then you go through the congressional districts. But just look, there is no Bernie Sanders blue in the state of Mississippi. Looks very much like neighboring Alabama last week. Joe Biden's march across the South based on the overwhelming support of African Americans. And Wolf, as you just look so far, Mississippi, Missouri, Michigan, the map filling in. This is a turning point in the race. Sanders can try to reclaim some of the night, some momentum as we go west, but both candidates conceded coming in. That was the biggest prize. Then you look at the delegates from Mississippi and Missouri, Biden. That was the question. Would this lead stretch or shrink? It is stretching.
I want to go to Arlette Saenz. She's in Philadelphia right now. That's where the Biden campaign is. They wound up in Philadelphia. No campaign rallies tonight, either from Biden, Arlette, or from Bernie Sanders because of fears of the coronavirus.
Yeah, that's right, Wolf. But the Biden campaign is certainly celebrating tonight after those so far 3 wins in this round of contest tonight. A Biden advisor that I spoke with said that looking at the primary calendar, they always thought this was going to be their toughest night in March. But now they are 3 for 3, and they believe that they are doing well in quite a few, among a few constituencies. They've pointed to his performance among African American voters, among suburban voters, among college-educated voters. And that advisor told me that that performance is a recipe for success for a Democrat in the fall. They specifically said that is how a Democrat wins in the fall. So they think that his performance tonight is also giving a strong showing of how he might perform and compete against President Trump if he becomes the Democratic nominee. Now, Biden is expected to speak here in Philadelphia in just a short while. He canceled that campaign rally in Cleveland due to concerns over coronavirus. And tonight, tonight, we've seen several dozen staffers from headquarters file in. This is a rare opportunity for a lot of those staffers to see the man that they are trying to elect president.
And we expect, Arlette, fairly soon, is that right, for Biden to speak?
They haven't given us an exact timing, but we are hoping that it'll be in the next hour.
All right, we'll watch it very closely together with you. You know, John, as we look at the Biden wins tonight, let's assume he's the Democratic nominee. The wins tonight that we're seeing, what does that bode for him going into the fall, November, against President Trump?
Right. The Biden campaign has every right to say what they have done tonight and what they did last Tuesday gives them confidence. Let's also be careful. We're in the primary campaign, and things are often different. One of the arguments that Senator Sanders made about Secretary Clinton 4 years ago, Senator Sanders making about the Biden campaign now, Hillary Clinton made it about Barack Obama, is when a Democratic candidate is winning all these states in the South, well, guess what? You know, South Carolina is not going to be a battleground state in the general election. If it is, it's game over, right? We don't expect Alabama or Mississippi or Arkansas to be battlegrounds. Those will be Trump states in the general election. But to the Biden campaign's point, let's just take case in point, Michigan. This was a state, remember, Sanders won it narrowly last time. When he did so, when Bernie Sanders won this state 4 years ago, one of the things we probably didn't spend enough attention on is understanding the weakness. Hillary Clinton won Macomb County, but just barely. It was a big warning, flashing sign that Hillary Clinton had problems with blue-collar workers in the industrial Midwest. How did Trump become president? Trump became president by flipping Michigan, number one. Just 10,000 votes, but a win is a win. Flipped Michigan. Flipped Wisconsin, 22,000, just shy of 23,000 votes, and flipped Pennsylvania, right, by 44,000 votes. That's why Donald Trump is president of the United States. So what Joe Biden wants to argue is, I was born in Scranton. I just won the Michigan primary. He won Minnesota. Hillary Clinton won that, but just barely. And Wisconsin is on the, we'll get to Wisconsin later in the campaign. So if you look at 2020, what Joe Biden wants to say is, I'm competitive. I proved I'm competitive, and these are still to come as we go forward. It's a perfectly rational argument to make, especially if you look at the suburbs. One of the things that's been really interesting as we look, Texas was a surprise last week. Let me pop this out here and show you. Texas was a surprise last week, right? Right here in the Dallas area, one of those congressional seats that flipped, a Republican-held seat in 2016 that became a Democrat-held seat in 2018. There's another one right here just outside of Oklahoma City. Was a Republican-held seat, became a Democratic seat in 2018. Joe Biden is winning in almost all of those districts. California would be the one exception where you see Senator Sanders doing some of that. But in places that flipped from red to blue, helped make Nancy Pelosi Speaker, they are in the suburbs. They're in the suburbs like Northern Virginia. There was a seat right here that flipped. Look at all that Biden blue. This was a Republican House seat a few years ago. It's a Democratic seat now. So Joe Biden's campaign can make the case that in the suburbs, African-American turnout, they are proving that they have a coalition that shapes up well for a general election. They can make that argument, Wolf. It does not make the case that it's a guarantee, but against Senator Sanders, especially as Sanders argues, I'm the blue-collar guy, if you look at the state of Michigan tonight, Biden has those bragging rights. Does it necessarily carry over to November? Absolutely not. Does it give his campaign some steam when you look at the cities and the suburbs and the blue-collar areas? Absolutely.
Good point indeed. You know, David Chalian, as we take a look, and let's do a delegate track right now. As we take a look at the delegates so far tonight, let's start off with Michigan.
Yeah, 125 delegates at stake. Take a look at what we've been able to allocate already. 34 delegates for Joe Biden, 19 delegates in Michigan for Bernie Sanders. What you see there is a 15 net delegate lead so far out of Michigan for Joe Biden. So taking the lead he had, now he's adding a 15 net delegate lead. We still have 72 delegates to allocate out of Michigan. In Missouri, we've allocated more than half the delegates already, 68 delegates at stake. 26 of them went to Joe Biden. 12 of them went to Bernie Sanders. There you have a 14 delegate lead for Joe Biden, again, as a net lead. So he's just adding and adding to his already existing lead. We still have 30 delegates to assign in Missouri.
So delegates to date right now, given all the contests that have happened so far.
All the contests. You need 1,991 delegates to win the nomination. Look at this, Wolf. Joe Biden has 713 delegates to date. Bernie Sanders has 589. This is significantly, Joe Biden has more than 100 delegate lead now. That is 124 delegate lead that Joe Biden has over Bernie Sanders. He's building such a substantial delegate lead this evening that as it continues along this pace, it is going to be extraordinarily difficult for Bernie Sanders to catch up in the delegate race.
It's a very important point indeed, Jake and Dana. It looks like it's going to be incredibly difficult based on the lead that Biden has right now with the all-important delegate count for Bernie Sanders to come back.
And the primaries in a week
Four more states.
are 4 states that Bernie Sanders did not win in 2016, if you want to look at what those are. And while I do that, let me just also say that the Sanders campaign is obviously going to have a hard decision to make. I don't think they're going to drop out anytime in the immediate future. And certainly there's a debate on Sunday. And I think that it will be something that the Sanders team wants to do is have the head-to-head debate. Just 2 major candidates. Tulsi Gabbard's still running, but has not met the threshold for the debate. And I think Sanders is potentially a stronger debater. And I think that they will make at least one last attempt to try to convince Democratic voters that he would be a stronger nominee against Donald Trump. Because to be completely frank, I'm getting real 2004 vibes tonight, which is Democrats want to defeat an incumbent Republican so badly, Democratic voters, I mean, that they decide which one is electable, and they decide, okay, it's John Kerry, or in this case, it's Joe Biden. There's a huge coalescing around that person. They want to end the primary process as soon as possible, and then basically they coronate this person. Now, what did we learn in the last few weeks? Mark McKinnon, former George W. Bush advisor, told me that actually they feared Howard Dean more. Because Howard Dean, even though he was less predictable, there was a starker difference between Howard Dean and George W. Bush. And he was drawing much bigger crowds than John Kerry was able to. And Howard Dean, we had him on the Sunday show, and Howard Dean said, now you tell me. But the point is that when you have the Democratic electorate deciding that they are all a bunch of Rachel Maddows and Chris Hayes and the like, that they're just, progressive pundits, and they're going to pick out who is the best one, maybe they don't necessarily always know what they're doing.
Yeah. So first of all, I think the states that you were talking about are now in the wall there. That we're
There we
going to
go.
see
So these are the
voting next week, right? Florida, Ohio, Illinois,
and Arizona.
So those are the states you were referring to.
A lot of delegates at stake.
A lot of delegates at stake.
And there are 4 states that Sanders lost last time.
Exactly. Which is why just communicating with people who are big supporters of Bernie Sanders tonight, they're not sugarcoating it. I mean, they can't. Tonight is a very, very big disappointment. We still have Washington State, a place where they're hoping maybe he can eke out a surprise, but they're certainly not counting on it. And that's sort of one dynamic that's going on. The other thing is, just to kind of bounce off of the conversation that was happening with our friends on the panel, as they were talking about if Bernie Sanders, doesn't get the nomination and how Joe Biden can get the Sanders people on board in a way that Hillary Clinton could not in the general election. I got a series of texts from a Bernie Sanders delegate who I met at the convention in 2016 going off, saying, he is not going to get people like me to vote for him. And people in the quote unquote establishment don't understand what we want and what we are for, and that we are not gettable if they support the kinds of policies that they do. Now, is this person alone? Probably not. Is he representative of all Bernie Sanders voters? No. But it just is a reminder of where the Democratic Party is. The Republican Party, it was in a similar place, although they ended up coalescing a lot more around Donald Trump than they did around Hillary Clinton. But that dynamic is very real. It is very raw. And it is not going to go away anytime soon.
Now, just to give the converse argument that I was just giving, Bernie Sanders had a theory of the case. And the theory of the case, as you noted earlier tonight, was I can bring all these new people out to vote. Look at what I did in 2016. Look at the crowds. And those people are not turning out to vote. Yep. They're not. They're not coming out.
All right, we're waiting to hear from Joe Biden, who's won these first 3 states. Polls will be closing. More polls close at the top of the hour. Much more of our special coverage coming up.